White Campus adalah salah satu kampus dengan desain bangunan yang unik dan kampus unggulan dengan berbagai inovasi berkelanjutan di berbagai bidang ilmu yang menjadi kampus impian di mana tempatmu belajar dengan bebas di tengah indahnya kota Jember untuk mendukungmu menjadi generasi muda yang berakhlakul karimah, aktif, dan inovatif. Kemitraan aktif dan kolaboratif yang kuat telah menjadi bagian yang tidak terpisahkan dari universitas. Kemitraan internasional dan nasional menciptakan peluang untuk mobilitas mahasiswa, dosen, dan staf dalam kolaborasi penelitian dan pengabdian di masyarakat. White Campus berkomitmen menjadi pelopor kampus swasta yang mencetak generasi muda intelektual yang berakhlakul karimah dan cerdas secara spiritual, dengan akar yang kuat dalam tradisi kebebasan akademik untuk mendukung kebebasan berekspresi untuk berkontribusi akan solusi dari masalah yang dihadapi. Dan sudah saatnya Universitas Dr. Subandi bersiap untuk mewujudkan cita-cita menjadi world class university yang berakhlakul karimah.
Soekarno Hatta. cek.
Cek cek. Cek cek. Cek cek.
Ada Pak R.
Cek cek. Cek cek. Cek cek. Assalamualaikum. Cek cek. Sudah Pak. Mana Pak?
Dapatkah Anda bayangkan, kampus pionir pendidikan tinggi dengan excellent with akhlakul karimah menjadi kampus impian masa depan? White Campus yang terbuka bagi setiap warga negara. Tempat belajar arti indahnya keragaman tanpa harus melupakan arti penting ketaatan pada nilai-nilai keagamaan. White Campus Dr. Subandi adalah kampus impian yang memberikan pengalaman global dengan rekognisi pembelajaran internasional yang berakhlakul karimah. Di program studi dengan akreditasi dan fasilitas yang unggul, tempatmu mengembangkan ilmu pengetahuan di berbagai bidang ilmu. White Campus adalah salah satu kampus dengan desain bangunan yang unik dan kampus unggulan dengan berbagai inovasi berkelanjutan di berbagai bidang ilmu yang menjadi kampus impian di mana tempatmu belajar dengan bebas di tengah indahnya kota Jember untuk mendukungmu menjadi generasi muda yang berakhlakul karimah, aktif, dan inovatif. Kemitraan aktif dan kolaboratif yang kuat telah menjadi bagian yang tidak terpisahkan dari universitas. Kemitraan internasional dan nasional menciptakan peluang untuk mobilitas mahasiswa, dosen, dan staf dalam kolaborasi penelitian dan pengabdian di masyarakat. White Campus berkomitmen menjadi pelopor kampus swasta yang mencetak generasi muda intelektual yang berakhlakul karimah dan cerdas secara spiritual, dengan akar yang kuat dalam tradisi kebebasan akademik untuk mendukung kebebasan berekspresi untuk berkontribusi akan solusi dari masalah yang dihadapi. Dan sudah saatnya Universitas Dr. Subandi bersiap untuk mewujudkan cita-cita menjadi world class university yang berakhlakul karimah.
Ya, Soekarno, Hatta.
Dapatkah Anda bayangkan, kampus pionir pendidikan tinggi dengan excellent with akhlakul karimah menjadi kampus impian masa depan? White Campus yang terbuka bagi setiap warga negara. Tempat belajar arti indahnya keragaman tanpa harus melupakan arti penting ketaatan pada nilai-nilai keagamaan. White Campus Dr. Subandi adalah kampus impian yang memberikan pengalaman global dengan rekognisi pembelajaran internasional yang berakhlakul karimah. Di program studi dengan akreditasi dan fasilitas yang unggul, tempatmu mengembangkan ilmu pengetahuan di berbagai bidang ilmu. White Campus adalah salah satu kampus dengan desain bangunan yang unik dan kampus unggulan dengan berbagai inovasi berkelanjutan di berbagai bidang ilmu yang menjadi kampus impian di mana tempatmu belajar dengan bebas di tengah indahnya kota Jember untuk mendukungmu menjadi generasi muda yang berakhlakul karimah, aktif, dan inovatif. Kemitraan aktif dan kolaboratif yang kuat telah menjadi bagian yang tidak terpisahkan dari universitas. Kemitraan internasional dan nasional menciptakan peluang untuk mobilitas mahasiswa, dosen, dan staf dalam kolaborasi penelitian dan pengabdian di masyarakat. White Campus berkomitmen menjadi pelopor kampus swasta yang mencetak generasi muda intelektual yang berakhlakul karimah dan cerdas secara spiritual, dengan akar yang kuat dalam tradisi kebebasan akademik untuk mendukung kebebasan berekspresi untuk berkontribusi akan solusi dari masalah yang dihadapi. Dan sudah saatnya Universitas Dr. Subandi bersiap untuk mewujudkan cita-cita menjadi world class university yang berakhlakul karimah.
Ya, Soekarno Hatta.
gentlemen, we are going to start our program. Could everybody who has joined us on Zoom please stand by on your device? Before we start our program, please enjoy this video. Assalamualaikum warahmatullahi wabarakatuh. A very good morning, ladies and gentlemen. The Honorable Board of Directors of Pendidikan Jember International School Foundation. The Honorable, the Chairperson of Pendidikan Jember International School Foundation. Rector of Universitas Dr. Subandi. The Dean of Faculty of Health Sciences. Head of Study Program in Faculty of Health Sciences. The respectable speakers, guests, and all the participants. The concept of transforming the future of healthcare through potential artificial intelligence is appropriate for us in Indonesia today, where there is an increasing demand from the community to obtain quality and comprehensive health services. They not only prioritize physical aspect, but also require several approaches, such as social, cultural, and spiritual approaches. The second International Conference on Health Sciences will highlight the application of transforming the future of healthcare through potential artificial intelligence by health professionals, so that they can improve the quality of healthcare services in clinical and community settings. The theme of our conference today is Transforming the Future of Healthcare Through Potential Artificial Intelligence. Dear ladies and gentlemen, let's commence our second Universitas Dr. Subandi International Conference on Health Sciences. The first agenda is singing the national anthem Indonesia Raya and also the hymn of Universitas Dr. Subandi. To all the participants, please kindly rise. Thank you very much. To all the participants, please be seated. Before we start our main agenda, let's pray together. The prayer will be led by Mr. Ahmad Efrizal, Master of Science. To Mr. Ahmad Efrizal, time is yours.
Assalamualaikum warahmatullahi wabarakatuh. Alhamdulillahirabbil alamin, hamdan katsiran thayyiban mubarakan fi. Allahumma shalli ala Muhammad wa ala ali Muhammad. Good morning, ladies and gentlemen. Before the conference begin, let's pray together to Allah. Allahumma shalli ala Muhammad wa ala ali Muhammad walhamdulillahirabbil alamin. Rabbana dhalamna anfusana wa illam taghfir lana wa tarhamna lanakunanna minal khasirin. Rabbi syrah li sadri wa yassir li amri wahlul 'uqdatam min lisani yafqahu qawli. Rabbi zidni ilma warzuqni fahma. Allahumma inni as'aluka ilman nafi'an wa rizqan thayyiban wa amalan mutaqabbalan. Rabbana atina fid dunya hasanah wa fil akhirati hasanah wa qina adzabannar. Wa sallallahu ala Muhammadin wa ala alihi wa sahbihi wa sallam. Subhana rabbika rabbil izzati amma yasifun. Wassalamun alal mursalin walhamdulillahi rabbil alamin. Assalamualaikum warahmatullahi wabarakatuh.
Thank you very much. The next agenda is the welcome address from the Dean of the Faculty of Health Sciences of Universitas Dr. Subandi. Please welcome Mrs. Ainur Zana, Master of Midwifery. To Mrs. Ainur Zana, time is yours.
Bismillahirrahmanirrahim. Thank you so much for Master of Ceremony. Assalamualaikum warahmatullahi wabarakatuh. Good morning. Alhamdulillahirabbil alamin. Wassalatu wassalam ala asrafil anbiya'i wal mursalin. Nabiyina wa habibina Muhammadin wa ala alihi wa sahbihi ajma'in. Wa man tabi'ahum bi ihsan ila yaumiddin amma ba'du. Honorable Director of the Pendidikan Jember International School Foundation and officials, Honorable Rector of Universitas Dr. Subandi and officials, Honorable expert lecture speakers today in the second international conference on health science with the theme transforming the future of healthcare through potential artificial intelligence. Dear all lecturers and the committee, especially conference participants, all attendees from health workers, medical workers, pharmacist workers, and health students who took the time to attend the extraordinary international conference event. I'm Ainur Zana, not AI, but the Dean of the Faculty of Health Science at Universitas Dr. Subandi, and I am honored to be here to provide a report on the activities as a representative of the organizing committee. This conference is attended by experts, researchers, and practitioners from various countries who will share their knowledge and experiences on the development and application of artificial intelligence in the field healthcare. Over the next 2 days, we will listen to presentations, engage in discussions, and build collaborations that are expected to contribute significantly to the future of healthcare services. We realize that there may be shortcomings and imperfections in the execution of this event. Therefore, we apologize for any deficiencies and inconveniences that may occur over the next 2 days. We are committed to giving our best and are always ready to receive feedback for future improvements. Thank you to the entire committee Thank you to speakers, thank you to all participants and everyone who has contributed to the organization of this conference. We hope this event runs smoothly and brings great benefits to all of us. Wassalamualaikum warahmatullahi wabarakatuh.
Thank you very much. The next agenda is the opening remark from the Rector of Universitas Dr. Subandi, who will also symbolically officiate today's event. Let's extend our warmest welcome to the Rector. To Mr. Andi Eka Pranata, Master of Health, time is yours.
Okay, thank you very much for Master of Ceremony. Assalamualaikum warahmatullahi wabarakatuh. Good morning and best wishes. The Honorable, the Head of Yayasan Pendidikan Jember International School, the Honorable All Speaker of the International Conference, the Honorable Guest of the International Conference, dear all participants of the conference. Thank God we praise Allah Subhanahu wa Ta'ala. Because of His grace and blessing, we all can join this amazing event to attend our second UDS International Conference on Health Science. Salawat and salam may still be delegated to our great Prophet Muhammad Sallallahu Alaihi Wasallam. Ladies and gentlemen, the beginning of this speech, I would like to say welcome to our second International Conference on Health Science with the theme Transforming the Future of Healthcare Through Potential Artificial Intelligence, or the mentioned AI. It is an honor to facilitate health professionals from the world to enhance health science. I would also like to express my heartfelt gratitude to all of you who sincerely committed to this event to make it a success. This event would have been impossible without the support of each and everyone present here. Ladies and gentlemen, artificial intelligence has the potential to transform how healthcare is delivered. AI technologies have significantly advanced our ability to analyze vast amounts of complex data, leading to improved diagnosis and treatment outcomes. AI can help to improve the experience, enable them to spend more time in direct patient care and reducing burnout. To support the goal of implementing AI technology, we will discuss and refine this topic with speakers from 5 countries: Malaysia, Brunei Darussalam, Thailand, Timor-Leste, and Indonesia. This collaboration can also continue and improve knowledge of the profession we love. I ensure this event will be profitable and fruitful for everyone present here. Have a great discussion. Thank you very much and success in the future. I hope this event can make the improvisation, our potential, and our competence, the student, the lecturer, and the all publics. Okay, thank you very much. Wassalamualaikum warahmatullahi wabarakatuh. Success for all.
Thank you very much. To all participants, the next agenda is presentation from our keynote speaker. Our keynote speaker is Mr. Ahmad Syahid, Master of Nursing from Universitas Dr. Subandi. Mr. Ahmad Syahid is also Vice Rector, and here's his curriculum vitae.
Okay, Assalamualaikum warahmatullahi wabarakatuh. Alhamdulillah, in this freezing morning, let me melt the situation because I'm a little bit freezing and a little bit nervous actually. Okay, let me say hello to everybody. Selamat pagi for Indonesian participant, and then good morning for all, and then for magandang umaga for participant from sorry, is this okay? Magandang umaga for participant from, and then Sobal Khair for my college and participant from Middle East, and also Sawatikan Chao from Thailand, and then Bomdia from Timor Leste. Okay, ladies and gentlemen, I would like to, this morning, I would like to share about the artificial intelligence in healthcare. Let me share my PowerPoint. Sorry. Okay. The artificial intelligence in healthcare. Let me start from the definition here. Okay. We start from the definition here. The artificial intelligence or AI refers to the simulation of human intelligence in machine that are programmed to think like humans and mimic their actions. So this is just like a artificial, not the real intelligence that only mimic or acting like a human being or acting like an expert. Another definition is computational simulation of complex intellectual processes associated with the intelligent human behavior, such as learning, decision making, problem solving, and executing tasks on self-corrections. Okay, from these two definitions, we can conclude that the artificial intelligence just an artificial, not the real expert. So for everything in healthcare, still we need the clinical adjustment from the expert. For example, for the diagnosis, for medical diagnosis, we need the clinical adjustment from the medical doctor or the specialist, and then for the nursing diagnosis, of course, we need the expert, a real expert from the nurse, and also for the medical laboratories, and also for the pharmacies. Okay, why? Because this technology, sorry, wait a minute. This technology, sorry. Okay. Okay. This technology serves to augment human expertise rather than to replace the human being. So, according to the definition, also we can conclude that this is then just an artificial that can help the human being. Why? Because the artificial intelligence working based on the data and the problem that made by the human being, by the expert, of course. So this mechanism from this image or from this picture, we can see how the artificial intelligence working. So based on the vast amount of the data, and then by the algorithm, they will analyze, and then where they will think, or then they will analyze, and then produce a conclusion. This program with the ability to learn and reason like a human, just like a human, or just like an expert, not the real expert. So still, we need the human or the expert as the core of everything, but, as a medical doctor or as a nurse or anything. Okay. Next, wait a minute. Why is not moving? Wait a minute. Okay, there. Okay, this artificial intelligence in healthcare, actually I divided into two sides. Yani for the health worker, and another side is for non health worker. Transforming the future of healthcare through the potential of artificial intelligence involves leveraging of AI technologies to enhance patient care, improve outcomes, reduce costs, and personalize treatment. And then here, the several ways in which AI is poised to revolutionize the healthcare. As I said before, it's divided into two sides, for hard worker and then non-hard worker. For the hard worker, there are 8 points here. There are diagnostic accuracy, predictive analytic, and then personal medicines, drug discovery and development, and then clinical decision support, robotic surgery, and then behavioral health, and then remote monitoring and telemedicine. That will be discussed by other speakers later. For more detail, they will discuss by the other speakers. There are from pharmacists, nurses, and then for the MAPRI also, and medical laboratories. Okay, then the other side is no hard worker, but still this is there is they have a part in a hard worker. I mean in healthcare. So for example, in hospital, there is an administrative efficiency. There is administration to have the patient having the bill or anything, and then population health management in the community. So let me explain one by one from these two sides. Okay, the first one is diagnostic accuracy. There are so many research, and then here I got one systematic review and meta-analysis that explaining AI algorithm can analyze medical images such as X-ray, MRI, and then CT scan with a level of details and speed that surpasses human capabilities. This can lead to earlier and more accurate diagnosis of the condition like a cancer or anything, enabling timely intervention. So by this AI, we can help the patient or the client to get an earlier diagnosis. By using this AI, we get the accurate diagnosis, but still, yeah, this AI are working by the data. If the AI because actually this AI there are two categories. There are two types. First one is for the narrow, and the other one is for uh, general AI. So for the special or narrow AI, this is working for the special tasks. For example, like this one for the accuracy, for the diagnostic accuracy. So this AI is programmed and set by the programmer by using the vast amount of data regarding pertaining to the diagnostic program. So this AI it will not work for other program. So by this by the data input by the operator, then the AI will analyze the data, and then read there is a conclusion that this patient or a client having this disease or a certain disease. Then we are as a worker, we can give a earlier intervention. So this patient will get recover well as soon as possible, and then reduce the cost also as well. Okay, the next one, predictive analytic. Yeah, this is the systematic review also. So based on the thousand of research that can then analyze and then conclude that this predictive analytic, by analyzing vast amount of patient data, AI can predict outcomes and identify patients at risk for certain diseases. This can help in preventive care and tailoring treatment to individual patients based on their likelihood of responding positively. So by using this AI, for sure, this program already set by the programmer by using vast amount of data pertaining to the predictive analytic. Yeah. For example, we just inputting some patient data and client data. For example, here this habit or this hobby. By that data, we can predict, we can analyze, or we can prevent uh, the bad future. I mean the worst, the bad future, especially in health situation. So by modificating the hairstyle, and then the exercise also. Okay, the third one is personalized medicines. Okay, this technology can help in developing personalized treatment plans by considering patient genetic makeup, lifestyle, and other factors. This approach can lead to more effective treatment with fewer side effects. So this for the pharmacist actually, uh, from this uh, from this uh, from this side, from this by these technologies, we can use it to give the special or personalized treatment for the patient. For example, by inputting the data pertaining to the all for everything regarding to the patient. For example, he's having uh, allergies, experience, or anything. You just input everything, and then these technologies which will analyze which medicine will is better for this patient. For example, also in other situation, for example, this technology also will prevent us to give two medicine in the same time, but there is antagonist reaction. For example, also like antacid, and then we will give together with the meal also is not allowed, and then also for the like amlodipine and simvastatin is not allowed to give together, because it will damage the muscle also. Okay, the fourth one is drug discovery and development. Yeah. This is also for the pharmacy. Later on, maybe will be discussed more furthermore by Mrs. Ani from MSU, I think, regarding to the Oriental medicine. Yeah. So it will develop in other medicine or herbal or anything. This AI can use for that one. Okay. This technology can accelerate the drug discovery process by predicting how different drugs will work and by what mechanism they will interact with the human body. This can significantly reduce the time and cost associated with the bringing new drug to market. So, for example, we want to make a new medicine by using herb or anything. We can use this AI or these technologies uh, to improve or to make it faster, because we have already so many data that support this research. Okay, the fifth one is clinical decision support. Okay, this technology can provide healthcare professional with real-time information and evidence-based recommendation to support clinical decision, ensuring that patients receive the most up-to-date and effective care. Yeah, for sure. We can use this AI. For example, in the ancient healthcare, maybe we can give for example, for the nurses, we can give a warm compress for any pain case. But but the recently, I mean the up to date, we cannot give all the pain cases. We cannot give the hot compress or warm compress. For example, for the appendicitis, we cannot give what hot compress or warm compress, because it can worsen the condition or can make the poor variation also later. Okay, and then the sixth is robotic surgery. This one for the surgeon. They can do they can do the surgery with the accurate precision, so it can help. This AI can enhance the precision and outcome of surgeries by assisting surgeons with robotic system that can perform delicate operation with greater accuracy and control than human hands. Yeah, but still need the human being to adjust it. Then the next is behavioral health. AI or artificial agent chatbots and virtual therapists can provide mental health support by offering immediate assistance, monitoring patient progress, and providing coping strategies. So this is just like a question and answer. Maybe here recently we can see a TikTok social media. We can ask everything and then they will answer. It's the same like that. So this AI working as the program as the first amount data that inputted already. And then this one for the population health management. As we know, especially in Indonesia, so many population here. So next time maybe not next time. Now we need this AI or these technologies to help us in managing the health of entire population by identifying trends, predicting outbreaks, and optimizing resource allocation to improve public health initiative. So, for example, also in our country, we have so many hard workers actually by the data, but still in the rural still there is no the lack of the staff, so the healthcare there is not managed well. Okay, this is from the from the hard worker side. For another one, this is for example for the hospital, we need the administration. Yeah, this AI can help us. This artificial intelligence can automate routine tasks such as appointment scheduling, billing, and claim processing. For example, for us, for health insurance, yeah, claiming our health insurance, bring up healthcare professional to focus on patient care. So another health worker just focus on the patient, not like before when I was still uh, as emergency staff nurse. We have to in mobile hospital in Kuwait. I have to manage everything there. Yeah, according to the administration, also inputting the data. So by this AI, we can it can reduce our task, our job. So we just focus on the patient care. It can also help in managing patient record and ensuring compliance with regulations. Okay, this one also number 10, remote monitoring and telemedicine. AI, yeah, this technology actually over wearable devices and mobile apps can monitor patient vital signs and detect anomalies that may require medical attention. This is particularly beneficial for patients with chronic condition and can reduce hospital readmission. Yeah, for example, a patient or client have just discharged from the hospital. Uh, they need these technologies. The health worker can monitor from away regarding to the patient condition. For example, if the still we have to input the data. For example, the patient having the blood pressure going down or decline. So the relative will input to this AI, and then they will analyze, and then will give information that the patient is in stable situation condition or need to readmission. Okay. While the potential of AI or these technologies in healthcare is vast or in that amount, it also raises important ethical, legal, and social issues that need to be addressed, such as privacy, security. This security is very hot issues now, especially in our country, in my country, because our ministry is hacked by the hacker, the data is stolen by them. Yeah, I don't know what happened now. Yeah, this also happened to the AI or this artificial intelligence is the hot issue now. Yeah, the security, privacy of the patient also. For example, this patient don't want to anybody knows about his condition. So we have to give more focus on this one, and the potential for algorithm bias. Yeah, bias. There's no bias also. Yeah, because this AI, this technology are working by the data and program set by the programmer. And then the implementation of AI in healthcare must be done thoughtfully with a focus on patient safety, yeah, ethical consideration, and ensuring that technology serve to augment human expertise rather than to replace it or replace the human being or the expert. So this is the core of the core. Still, the human is the core of the core because they are the expert. So these technologies cannot replace the expert. It just augment the human expertise. And then the disparities in health services between rural and urban. Yeah, as we know, in every country there is urban and rural areas. Yeah, of course there is disparities between these two places. Yeah, there are significant and multi-phase affecting the quality of care, accessibility, and health outcome for population in different regions. Yeah, especially in rural and urban areas. These disparities are influenced by a variety of factors, including infrastructure, economic resources, workforce availability, and technical advancements. Okay, here are some case aspects of the disparities between rural and urban areas. Yeah, there are 10. The first is accessibility. Yeah, of course, the accessibility in rural areas often have limited access to healthcare services due to longer distance and to travel and poorer transportation option. This can result in delayed care or a tendency to forego medical treatment altogether. Yeah, for sure. For example, uh, like TB before, like TB patient, they have to take the medicine from in special place or in special hospital. From the rural, they have to spend more money and spend for more time to take the medicines. Yeah, this case can delay the treatment also, or sometimes because of the discitement they are feeling tired and then the patient and the client feeling tired and then they decide to not to take the medicine. Of course, it will forego medical treatment altogether. Okay, number two, healthcare workforce shortage. Yeah, there is a significant shortage of healthcare professionals in rural areas. Doctors, nurses, and other medical staff are often attracted to urban areas where there are better facilities, of course, higher salaries, of course, also, and more opportunities for professional development. So, as we know, most of us will prefer to work in urban area. Why? Because of the facilities, like internet also, and of course the salaries, it will be higher than in rural area. And then also the job also, it will be more clear in urban area. Okay, the third one, healthcare facilities and infrastructure. Yeah, of course, in the rural area, it will be lack of the facilities. Yeah, for example, like microscope also or anything. Yeah, urban areas typically have better healthcare infrastructure, which with more advanced hospital and clinic that are equipped with the latest medical technologies. Rural facilities may lack the resources to provide specialized care or maybe understaffed and under-resourced. Of course, lack of everything, lack of the staff, lack of the facilities, lack of the internet also. So for these technologies, we have to think 1,000 times to apply in rural area. And then the fourth one also, this is together specialized care. For example, for the in rural, for example, for the primary care or the clinic in the rural area, of course, there is no surgeon, there is no uh, uh, specialist doctor or specialist anything. Yeah, for the cardiologist, there is no also orthopedist, there is no there. The all this specialist care will be centered in the urban area. The fifth one, information technology. Urban healthcare facilities are more likely to have advanced health information, which can improve the efficiency of care and facilitate better communication among healthcare providers. Rural area may lack in the adoption of such technologies. Yeah, for sure. Yeah, because of the facilities also, and then also the staff. Not all the staff are ready to or can operate these technologies. The sixth one, health outcome also. There are disparities or differences between rural and health, urban and rural area because of the facilities also, and then the facility care, and then other thing, and the lack of the staff. For example, in the hospital, one nurses for two patients, but in the rural maybe one nurses or one doctor for one village or more than two villages maybe. Okay, the next one, economic disparities. Rural communities often have lower average income and higher rate of poverty, which can affect the ability to pay for healthcare services, including insurance premium and out-of-pocket expense. So sometimes they will think better to buy food to than taking the medicine. Yeah, for example, like I said before, for the TB patient, maybe they have to take the medicine in far away. They will think 1,000 times to take the medicine, but they will not think more times to buy food or like any snack. They will think more better. They feel their stomach. Then 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 taking the medicines. Number 8, cultural and social factors. Rural areas may have different cultural norms and social culture that can influence the behavior and the utilization of healthcare services. There may also be language barriers in some rural communities that further complicate access to care. Yeah, the language also. For example, the Japanese nurse or the Japanese medical doctors will come to the Madura Island, then they cannot speak any Madurese language. Of course, it will be a big problem, and then a big barrier between the hard worker and the clients. Okay, and then emergency services. For sure, in the rural, emergency medical services or EMS and trauma center are often less available in rural areas. Yeah, the longer response time and distance to definitive care can have critical complications for patient outcome in emergency situation. Sometimes they will just waiting for the death because they cannot do anything. They cannot go to the services. Yeah, that's the big problem. Yeah. And then the last one is telehealth and telemedicine. While telehealth has the potential to bridge some of the gaps in rural healthcare, there are still disparities in access to and utilization of these services. Rural areas may have less reliable internet connectivity and fewer healthcare providers who are equipped to offer telehealth services. So back to the facilities, the internet, then add any other facilities. Okay, ladies and gentlemen and guys, for all participants here, addressing these disparities requires a multi-phase approach, including policy intervention, yeah, by the government, of course, who having the power for decision maker. Investment in rural healthcare. Yeah, investment. We need money also to invest this one in the rural area. Incentive for the healthcare. Yeah, to increase the incentive the healthcare also because they need to survive also for their life and their family. Incentive for healthcare professional to work in rural areas, and the expansion of telehealth services to improve access to care for rural population. Okay, so by this all these things I told you, as a hard worker, we have to think what we have to do, what we can do to give the best thing to our clients, so we can have their we can have them, and then we can do something better to their lives. Yeah. I hope the government also can make a better policy for the our health system. Yeah. Okay, ladies and gentlemen, that's all I can give to you. I can say to you. The last word is thank you very much. Arigatou gozaimasu, syukran kathiran for Middle East participant, and then Rapunka uh, for Thailand college, and then participant, and then for the obrigado for the uh, participant from Timor Leste. Okay, thank you very much. Thank you very much. Assalamualaikum warahmatullahi wabarakatuh. Back to the MC. Thank you.
Thank you very much. Ladies and gentlemen, entering the main agenda. Our next agenda is plenary session. In the first plenary session, we have 3 speakers. With the first speakers, we will listen to talk about transforming the future healthcare through potential artificial intelligence by esteemed Professor Dr. Rusli Binardim from Masa University. The second speaker, we have Dr. Sarena binti Haji Hashim from University Brunei Darussalam, and we will listen about nutrition and holistic midwifery care. And then we continue with the third speaker, Mrs. Anilin Chienting from Management and Science University, Malaysia. And we talk about the amazing traditional remedies from several countries. Ladies and gentlemen, let's start our first plenary session. This session will be guided by Mrs. Sydney Nurisyuh Baba, Master of Nursing, as moderator, and also Mrs. Solihatil Hidayati, Master of Pharmacy, as secretary. To moderator and secretary, please kindly come to the stage.
Okay, thank you, Makia. Assalamualaikum warahmatullahi wabarakatuh. Good morning, distinguished guests, esteemed speakers, and all participants. Welcome to the second Universitas Dr. Subandi International Conference on Health Sciences 2024, an international conference dedicated to advancing health and wellness worldwide. My name is Zidni Nuris Yuhbaba, and I'm honored to serve as your moderator in this important event. And today, I'm accompanied by my partner, Mrs. Sulihatil Hidayati, as a note taker. Before we begin, I would like to extend a warm welcome to our speakers, Professor Dr. Rusli bin Nordin from Malaysia, Dr. Sarena binti Haji Hashim from Brunei Darussalam, and Ms. Ani Lim Chianting from Malaysia. Also, to all the attendees, thank you for joining this event. We have an exciting lineup of presentation and discussion ahead, and I encourage to everyone to actively participate and share their insight. In this session, there will be 3 speakers, and each speaker will have 16 minutes for their presentation. And this discussion will take place at the end of the session. For those in the audience who wish to ask questions, please write them in the comment section, your name and your affiliation. All right. We'll begin shortly, and the first presentation will be delivered by Professor Dr. Rusli bin Nordin. Let's take a look at his curriculum vitae. Okay. Professor Rusli will present about transforming the future healthcare through potential artificial intelligence. And I'm sure this will be very interesting. Ladies and gentlemen, let's welcome Professor Dr. Rusli bin Nordin. Good morning, Professor. Good morning. Okay, Professor. Maybe you can on cam. Okay. Good morning, Professor. Good morning, Professor. Hello. Okay. Okay, we will wait for Professor. It seems like there is some trouble.
Hello.
Hello, good morning, Professor.
Morning.
Okay, thank you.
Can you hear my voice or not?
Yeah, it's so clear, Prof.
It's clear now. Okay.
Yeah.
All
Are
right.
you
So,
Yeah.
and my slides. Can you see my slides?
Yes. Yes. Okay, Prof, are you ready to present your material?
Yeah. Yes.
Professor, you have 16 minutes to present your material. And to all participants, if you have a question, you can write them in the comment section, including your
Okay.
name and your affiliation.
Okay.
Professor Dr. Rusli Binodim, the time is yours.
Thank you very much, MC, because first of all, thank you very much for the organizing committee for inviting me to this webinar, and it's an opportunity for me to represent our university, Masa University, to talk about something about AI and the future of healthcare, and especially looking at the effort to use AI for to find solution to our health problem. So for today's presentation, I will be talking about a little bit about artificial intelligence in healthcare, a benefit of AI in healthcare, challenges and considerations, AI in medical imaging, AI in personalized medicine, some case study, futures in AI healthcare, opportunities for innovation, ethical and regulatory considerations, and conclusion. So the first one is that because I think our keynote speaker has already gone into detail about some of the background of AI, I just want to touch on three important issues. The first one about artificial intelligence. There are three components which are at the moment heavily used by industries. The first one is that the AI encompasses these three technologies. The first one is machine learning. Second one is natural language processing and robotics. I think machine learning is a very important development AI because many of the application nowadays are using machine learning to provide prediction and so on. And the second one is natural language processing, where it is a branch of AI that enables computers to understand, interpret, and generate human language. Very important. It involves techniques for processing text and speech data, and it's also used for extracting information from medical records, analyzing clinical notes, automating medical coding, and improving information retrieval. And the third component of AI is robotics, a very important development nowadays. And this robotic involves the design, construction, and operation of robots that can perform tasks autonomously or semi-autonomously. In healthcare, robotic systems are used to assist surgeons, especially, and perform precise surgical procedures. So, robotic have been used, for example, in many parts of the world. The WC surgical system, where we have robots being used for surgical procedure, for rehabilitation robots, and also the telepresence robot for remote patient care. And what are the benefits of AI in healthcare? There are at least 10 benefits that I can consider. The first one is that it is advanced healthcare through AI and has a lot of improvement for mankind. The first one is that it improves diagnostic accuracy. Secondly, it has personalized treatment plans. Okay? The third one, efficiency and cost effectiveness of our process of treatment, drug discovery and development. We have new drugs to be discovered, remote monitoring and telemedicine, telehealth that has been mentioned by the keynote speaker, enhanced imaging and radiology, healthcare access and equity, and predictive analytics for public health, robotics and AI-assisted surgery, and finally, ethical and regulatory considerations. So there are 10 components, I think, in healthcare that can be advanced through by AI. And then in terms of the challenges that we face today, I think the most urgent challenge for us now is the data privacy and security concern, because nowadays our data, there are a lot of regulation around the world for data privacy and data processing. Even in Malaysia, okay, we have Data Privacy Act to safeguard our data privacy. Secondly is of course how to integrate the AI application with the healthcare system to upgrade the healthcare system on the platform similar to AI. The third one is issue regarding regulatory and ethical consideration. Regulatory meaning the agencies, organization in the country that will regulate practice. For example, in Malaysia, we have the Malaysian Medical Council regulating the practice of medicine, and also ethical and also legal consideration. And the fourth one is the issue of addressing AI bias and ensuring transparency. Because AI, as you know, when they are developed, there's some component of element of bias which are introduced into the algorithm, and therefore, how do we reduce the bias, and how do we ensure that the system is transparent? Now, one of the big development, I think, in AI, I think related is to medical imaging. In medical imaging, right? Medical imaging, we have enhanced image analysis, automated detection and segmentation, regulatory and ethical consideration, image reconstruction enhancement, quantitative image analysis, and real-time support. So these are all have to do with imaging. For example, the first one, enhanced image analysis, very important. We give a clearer image analysis for doctors to make decision. All right, we are able to automate the system, which is very good, and no longer used on the previous the old system. We have also regulatory and ethical consideration of sharing images across platform, across country, image reconstruction enhancement. Okay, for example, in many of the current development of imaging for brain scan and so on, we do have this important development. Quantitative image analysis, where there is more focused insight into image, and also real-time decision support, because many of the images now are real-time, okay, and can be shared across platform. Now, the other one is again mentioned is in personalized medicine, and I think many countries now are going very strongly into this area. All right, basically, this is the area of genomic data analysis. Using that genomic data analysis to develop profile for patient, because nowadays we have every patient is treated, is managed, right, according to this profile. So basically, we can customize the treatment for even like drugs, you know, medicine for treatment for high blood pressure, for diabetes, and so on. We can customize it. So this is the genomic data analysis. The other one is we can do a predictive modeling for treatment response. For example, like in cancer therapy, right? We can do a prediction whether the patient can survive, or the patient can, you know, may need a longer time of survival and respond to treatment. So this is again a very important development in curative medicine. And then we have clinical decision support system. We are able to make decision based on real-time facts and best practice. This can be included in the decision making. The fourth one is drug discovery and development. They give you a development for drugs, which now we have to depend on newer drugs, especially in areas like cancer therapy, you know, for treatment of cancer and chronic diseases, right? and finally is the real-time monitoring addiction. So again, the whole idea was using AI so that we can have a real-time response to treatment.
Me, Professor.
Case studies are important. For example, here we have case studies related to the use of AI. For example, we have this is more for the first one is more on population health management. There are case studies here that enable organization here, for example, use of machine learning algorithm to identify high-risk patients by analyzing vast amount of health data, including electronic health records, genetic information, and lifestyle data. One of the example is was done by this organization called Kaiser Permanent. Kaiser Permanent using predictive analytics to identify patients at risk of sepsis, life-threatening response to infection. Okay, so they use AI to be able to improve the outcome, assistant improving patient care outcome. Again, an important development here. For example, is the use of there's a new development called this using NLP, right? Natural language processing, and using of virtual health assistant, what they call Babylon, using AI to offer medical advice based on patient-reported symptom and medical history. And the third one is robotics and AI in surgical procedure. And the most common, I think, here to improve precision and safety in this part of the world, in Malaysia, we have the Da Vinci surgical system. Okay, the Da Vinci surgical system uses AI and robotics to assist surgeon in performing complex procedure with enhanced precision and control. And then we have future trend in AI healthcare. Future trends are basically again touching on a similar what do you call this item, personalized medicine. This is a trend. I think as we pass into the new millennium, more and more of personalized medicine become more prominent. So treatment become more personalized. We no longer treat people, on a very generic basis, but very much personalized medicine, and that requires information derived from genomic studies and profiling. Second one, again, AI diagnostic imaging. This is another big area of AI in healthcare, diagnostic imaging, using the latest AI platform. And then remote patient monitoring and telemedicine. In Malaysia, telemedicine has been here for the last 20 years, and telehealth. We have been using telemedicine to provide remote assistance for remote patient, especially in several parts of Malaysia which are remote. And then AI-driven drug discovery, which is a new trend again, which have been growing in Malaysia as well. AI in genomics, I mentioned recently, was the genomic more for profiling, and then AI-powered mental health application. This is again something new in the area of mental health, psychology, psychiatry, and so on, where we have AI are being used more and more. So what are the opportunities for countries like in this part of the world, right? In like Malaysia, Indonesia, in the ASEAN region, right? So the opportunities will be for innovation. In other words, we have to think outside the box to think about what are the new things that we can provide for using AI in our healthcare system. The first one, again, is to think critically about how to improve early disease detection and diagnosis. Very important, diagnostic. This applies not only to, nowadays we talk about chronic diseases, but we also think about infectious diseases. Because now we have COVID, we have so many of the infectious diseases emerging, zoonotic diseases and so on. So we need to have an early disease detection and diagnosis. And especially in cancer therapy, cancer area, we have to be very fast in having new detection and diagnosis. And then second one, which is predictive analytics. This one more for preventive care. I think we have a lot of data, all right, that can be used to be analyzed and to do modeling and to provide some kind of prediction for population, not individual, but we can do population prediction, for community prediction, but at the same time and in the hospital for patient prediction. And then AI-driven personalized payment plan. So we have mentioned earlier. This again a new development. many hospitals are again are using this as in the main therapy for patient. And then virtual health assistant and chatbot, we mentioned that very important because sometimes therapy cannot be applied sometimes in rural area. For example, we mentioned about some disparity between rural and urban. So many of these assistant may be needed in such a situation. And then in medical research, this again important because in medical research we need to leverage on this new AI platform to do research, to share evidence, to share data, right? To share information and so on. And then finally is that to improve clinical workflow and operational efficiency. All right. So then, of course, the other component will be the ethical and regulatory consideration. All right. I mentioned already about patient privacy, data security. We need to improve on that. Bias and fairness has to be again another area. I think we need to do a lot of research and engagement to how to reduce bias and to provide fairness in data sharing. Transparency and explainability of information, again another area. Accountability and liability, because now as much as we use AI, we are now have to have new legal and also ethical what do you call this development to account for this new scenario in our country. Informed consent also important because many of the processes or procedure in hospital we need to inform patient, and patient need to understand and to provide informed consent. And regulatory compliance and standard. This is another big development, okay? Which is I think especially in healthcare would involve the medical council and so forth. So in conclusion, so is that the AI has demonstrated immense potential to revolutionize healthcare by enhancing disease detection and diagnosis, personalizing treatment plan, streamlining clinical workflow, and accelerating medical research. Number two, innovation in AI-driven predictive analytics, virtual health assistant, and remote patient monitoring are already improving patient care and operational efficiency. Number three, AI algorithms are being used to predict disease onset and progression, enabling preventive care and timely intervention. Number four, AI in diagnostic imaging is improving accuracy and reducing diagnostic errors, which is critical for early detection and treatment of conditions like cancer. Number five, to fully realize the benefit of AI in healthcare, it is crucial to address ethical and regulatory challenges. And finally, healthcare stakeholders, including policymakers, developers, and practitioners, must collaborate to create a robust framework for the responsible integration of AI. So, Ms. Chairperson, I think those are basically what I can share with the audience. And sorry for the initial glitches and during the presentation. So I think that's all. Basically, it's open to question and answer. Thank you very much.
Okay. Thank you, Professor, for the outstanding presentation. And next, we will move to on the Q&A session. Okay. Professor, maybe you can open your camera on Zoom meeting, please.
Yeah.
Because your camera is off.
Let me go back.
And to all participants, if you have a question, you can write them in the comment section, including your name, affiliation, and your question. Excuse me, Prof. There are a question for you.
Sorry, yeah, I will answer. I'm sorry,
Yeah.
camera. We have some problem with our camera. I will check again. What's the problem? Check again. Yeah. Okay.
Okay, no
I
problem.
will respond. Yeah.
Okay.
Um,
There are a
do you
question for you,
do you
Prof.
want me to respond verbally or what to the question?
Yeah.
Or you
Is it,
want me to respond by typing the answer? Or you want answer by verbal? I can answer now. The first question, yeah. The first question was regarding genomics. Yeah, the genomics actually is an area of medicine. Yeah. Okay. Genomics in an area of medicine where we actually we do a profiling of patient. All right. Patient profiling, and we will be able to develop, okay, what do you call this, like a profile of the genomic information of the patient, and based on this genomic information, later on the treatment of the patient will be done accordingly. Example, if you have certain profile, you may be able to accept certain medicine, say for high blood pressure, right? So to treat blood pressure, for instance, certain people may not be able to tolerate one type. For example, like using ACE inhibitor or ARB or even calcium channel, okay, blockers. So the treatment has to be customized. So I'm saying that this is part of the plan for what do you call this, for personalized treatment method. So this is the answer for genomics. So genomic is basically almost like a genetic profiling of patient. So every person has his own profiling. So the profiling will be matched with the drugs, medication. I hope that answers the question. All right. This one, and then what else? Okay. In the second question is regarding how is the development of AI in healthcare facilities in Malaysia? Yeah. So AI actually, just like any other countries, I think now in the ASEAN region, it is something that is new, even in Malaysia, right? I think it's more enhanced, especially in the urban facilities, urban areas like in Kuala Lumpur, in Penang, Johor Bahru, all this. We have huge amount of AI, in integration in the health facility, but it cannot be said about rural area. We still have problem to try to improve the AI integration rural area. So again, I think the disparity that was mentioned earlier was correct, because we still need to develop more effort to reduce the disparity of AI development in the rural part of Malaysia. Okay. What else? Okay, in the Malaysia, there's another question was from Mr. Elias. Explain how the health system in Malaysia, how is AI used in Malaysia? Okay, so health system in Malaysia, ours is basically we have first we have the what do you call this, the public health system, which is under the Ministry of Health, and then we also have the private health system, the private hospital, private clinic, and so on. Okay, there are two parts. We have public and private. Okay, so public hospital and clinics are the one at the moment, I think, which have been using. I mentioned about telehealth and telemedicine. Yeah, and very much more is again issue about disparity, because many of the bigger hospital are in the urban area. Okay, the big hospital in big clinics are urban area. In the rural area, we have mainly the community clinics. Like in Indonesia, suppose you have the Puskesmas, we have the and so on. So very few hospitals in the rural area. So this one, and then the private hospital, these are mainly developed in the urban area. They cater for a lot of patients, and also patients from overseas, from Indonesia, from other part of ASEAN. We have many of our patients coming to our private hospital. So that is the two systems. So How do we the connect basically is that sometimes a patient may be referred to a private hospital, they may be referred again to the public hospital. So it depends on how they collaborate in the treatment of patient. So a lot of this collaboration also between these two systems. Now let me see. This issue about from Mr. Lim Zheng Hong regarding is there a prediction on when will the challenges that come with using AI be overcome? I think it's a very difficult question to ask to answer, because this is an issue about challenges that I mentioned earlier in my talk. The challenges are many, and especially regarding data privacy, data security, which are I think and also regulatory standard and compliance. Those I think need time, because they need to develop legal provision. The legal aspect of it has to be fully developed and to be discussed. Maybe have to go to parliament for approval. But other areas, I think again we see the trend in for example, like in robotics development. Robotics now is not new anymore. We have, for instance, like I mentioned about Da Vinci robotic in surgery. So that has come in, and I guess in the next few years, even the next 5 years, we see more and more robotic surgery to be improved, to be introduced in this part of the region. So and then the third one is the natural language processing. There's more of issue involved in data extraction and so on. That I think again development may take a few years more to be able to be in this league in the big time, because data extraction is an ongoing process even in Malaysia. I think that's about it. So I hope that answers some of the questions that have been raised here. Thank you very much, Ms. MC. Thank you.
Professor, for the excellent answers and the presentation. Hopefully, the material present can bring benefits and advancement in the field of health. And ladies and gentlemen, the next agenda is awarding of certificates of appreciation to our speaker, Professor Dr. Rusli bin Nordin. Okay. Thank you very much, Professor. Yeah.
Thank you very much for the certificate. Thank you. Sorry for not show my face, because of problem with the camera. Okay. Thank you.
Yeah. Thank you very much, Prof, and have a good day. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam.
Ladies and gentlemen, we will now move on to our next speakers. Our second speaker is Dr. Sarena binti Haji Hashim from Brunei Darussalam. She will be presenting on nutrition and holistic midwifery care. And let's take a look at the curriculum vitae. Okay. Ladies and gentlemen, please join me in welcoming Dr. Sarena binti Haji Hashim. Good morning, Dr. Sarena. Hello, Dr. Sarena.
Hello, good morning.
Morning. How are you today, Dr. Sarena?
I'm good, Alhamdulillah. Thank you.
Okay, it's nice to meet you, Doctor.
Yes.
Dr. Sarena, in this session, you have 60 minutes to explain your material. And the Q&A session will take place at the end of the session after the last speaker has finished presenting their material.
Okay, thank
To all
you.
attendees, if you have a question, you can write them in the comment section, including your name and your affiliation. Now, I invite Dr. Sarina to present her material. Dr. Sarina, the time is yours.
Okay, thank you very much. I just want to check, can you see me and can you see the screen?
Yes,
All right, so I'll start, yeah?
but your camera is, oh, okay, okay.
Can you see me?
Yes,
All right, so I can start, yeah?
yes, sure.
Okay, thank you very much. Thank you very much, MCA, for the introduction. Assalamualaikum warahmatullahi ta'ala wabarakatuh and a very good morning, everyone. So first of all, I'm honored to be invited to speak at this conference organized by the Universitas Dr. Sobandi Jamber. And the conference theme is Transforming the Future of Healthcare Through Potential Artificial Intelligence. Now, this is a very interesting themes to explore, not only in midwifery, but across various healthcare practices. So aligned with your conference theme, so my presentation today will focus on integrating AI into midwifery care for holistic nutritional advice, exploring future technologies. So now to guide our discussion today, here is the outline of my presentation. First, we begin by looking at the role of AI in midwifery care. And then next, we will explore the future technologies in midwifery, moving on to holistic nutritional advice, which is one of the critical areas where AI can make a significant impact. And then we explore the benefits of integrating AI into holistic care. However, integrating AI into midwifery is not without challenges. So I will talk about these challenges. And lastly, I will talk about the ethical implication, which has been mentioned by the previous presenter as well in relation to using AI technologies and also including using AI in midwifery care. As you all know, AI is transforming various aspects of healthcare, and midwifery is no exception. So let's start by exploring the roles of AI in midwifery care. Now, in some part of the world, AI technologies can actually assist midwife in numerous ways. So let's explore how some of the current available AI technologies assist in enhancing this prenatal monitoring. So the first is actually an app, which is known as AI-powered fetal monitoring devices. This device actually utilizes advanced algorithms to track fetal health parameters. So these devices continuously monitor vital signs such as fetal heart rate and also movement, and they also provide real-time alerts to healthcare providers. So such a system is being used in several hospitals in the United States and also in Europe. And this real-time monitoring allows for timely interventions when abnormalities are detected. So thereby, this actually helps in terms of improving outcomes for both mother and also the babies. So next is predictive analytic for high-risk pregnancy, and this device actually plays a very significant role in managing high-risk pregnancies. Algorithm can actually analyze vast patterns, vast amounts of patient data to identify the patterns and also the potential risks. So by predicting complications such as, for example, the common complication in pregnancy, such as preeclampsia and gestational diabetes. So these algorithms actually enable to actually proactive intervention and the development of a personalized care, especially in relation to the care plan of an individual woman. So for example, system like this, those developed by Bloom Life, are actually being used in various healthcare settings in the US and also Canada and also in the United Kingdom. So this actually predicts capability, which is helps healthcare providers to anticipate and also manage potential issues before they become critical. And then finally is the remote monitoring through AI enabled apps. So now these apps actually offers expectant mothers greater convenience and also involvement in their prenatal care. And this mobile application can actually help to actually track vital sign, and it can actually provide a personalized healthcare advices and also facilitate communication with healthcare providers. So for instance, an app which is used in several clinics in Australia is known as the Herabit. Okay, so this device actually helps in terms of providing timely interventions for high-risk pregnancies. So by using these apps, expectant mothers can actually actively, participate in their care and also receiving guidance and support without the needs for them to be in-person visits. And then this approach not only improve patients' engagement, but it also ensure continuous monitoring and support throughout the pregnancy. So as you can see, AI is transforming prenatal monitoring by providing advanced tools and also technologies that enhance the ability of healthcare providers to monitor, predict, and also manage the health of expectant mothers and also their babies. Now, this actually leads to more personalized, timely, and also effective care, unlimitedly improving maternal and also fetal outcome. Right, now let's focus on how current AI can provide personalized nutritional guidance. Okay, so first, AI-driven dietary recommendation. So now this device can significantly enhance the nutritional care provided during pregnancy. So by processing individual health data, so AI can actually generate tailored nutritional advice that support the specific needs of pregnant women. So for example, one of the device known as the Nutrino AI platform, which is being used in various healthcare settings in the United States. So this personalized approach ensure that expectant mothers receive the necessary nutrients, optimizing their health and also the development of their babies. All right. So next is AI tool can also perform behavioral analysis to assess eating behavior and also preferences of individual mothers. So by understanding these patterns, AI can actually offer personalized strategies to help maintain a balanced and also nourishing diet throughout their pregnancy. So for instance, a platform like Nutrino and also Luck Health are utilized in clinics across the United States to provide suggestion for healthy food swaps, meal planning tips, and reminders to stay hydrated as well. So all based on individual, unique habits and also preferences. So finally is the real-time nutritional support, which is also made possible through AI chatbots, which is also mentioned by our keynote speaker as well. So this chatbot can deliver instant responses to nutritional inquiries, so providing guidance and encouragement to expectant mothers whenever they need it. For example, ADA Health's chatbot which is widely used in Europe and also in Asia to answer questions about safe food, suggest healthy recipes, or offer motivation to stick to a nutritional plan. And also AI chatbot also provide continuous support and also reassurance, ensuring that mothers receive timely and also relevant advice. So this AI is actually transforming the way we approach nutritional guidance during pregnancy. So by offering personalized data-driven recommendation, analyzing data, dietary habits, and also provide real-time support. So this advancement empower expectant mothers to make informed choices about their nutrition. So ultimately, of course, they help to enhance their pregnancy and also that of their babies. Now, let's shift to our focus to the postpartum period, another critical phase, okay, where AI can actually play a transformative role. So postpartum care is essential for the health and well-being of a new mother. And AI technologies are providing innovative solutions to support this critical time. So firstly, one of the apps, which is known as AI-enabled postpartum wellness monitoring, which is currently available and used in some parts of the world in tracking recovery progress after childbirth. So for example, the Philips Avalon CL fetal monitoring system, which is being used in several hospitals in the United States and also in the Europe. So this AI system, like this, can continuously monitor vital signs and other health parameters. So identifying potential complication early, and this proactive approach also ensures timely intervention and provide new mothers with the necessary support to recover smoothly and also healthily. Right. Next is the virtual lactation consultant powered. Okay, so by AI offered personalized breastfeeding advice as well. So and troubleshooting support. All right. So an example is the LAC app. Okay, widely used in Spain and expanding to other European countries. Okay, an AI-based virtual consultant can also provide a real-time assistant to new mothers. Okay, this is a very crucial in order to actually support them in during the earlier part of their postpartum period. So this can actually help them address the common breastfeeding challenges and also enhance their lactation care. And these services is actually particularly beneficial for mothers who may not have access to an in-person lactation consultant. So this can help in terms of ensuring that they receive consistent and also reliable support. Now, next is AI-driven tools, which also can offer significant support for emotional well-being during the postpartum period. So, for instance, a chatbot, Woolboot, an AI-driven mental health chatbots. Okay, so this AI-driven mental health chatbot is used globally, okay, including in the United States, in the United Kingdom, and also in Australia. So this application can actually provide mental health assessment and resources, and also intervention to aid new mothers in managing their postpartum depression and also anxiety. So by promoting emotional well-being, AI tool can contribute to a holistic care, ensuring that both the physical and also mental health needs of a new mother are actually addressed. So AI is transforming postpartum care by providing comprehensive support through wellness monitoring. So through virtual lactation consulting and also emotional well-being tool as well. So this advancement empowered new mothers. This can actually help them to navigate the postpartum period with confidence and also ensuring their overall well-being. Now, next, let's focus on the emerging technologies that are set to transform midwifery care. So several advanced technologies are set to transform prenatal monitoring and care, some of which are already in use in various healthcare settings around the world. So firstly, advanced wearable devices for continuous fetal monitoring are becoming increasingly sophisticated. So these innovative devices provide a real-time data of fetal heart rate, fetal movement, and also oxygen level. So for example, a Philips Avalon CL fetal monitoring system is being used in several hospitals in the United States and also in Europe. So by continuously monitoring this vital sign, they can improve the early detection of potential issues, ensuring that any abnormalities are promptly addressed. So next one is the AI-powered ultrasound analysis in enhancing our ability to accurately track fetal development. For example, utilizing in artificial intelligence algorithm systems like GE Healthcare's Voluson E10 are used in various healthcare settings in the United Kingdom and also in Canada. So this system can actually analyze ultrasound images with remarkable precision, allowing for a more accurate assessment of fetal growth and also development, and which help the healthcare providers to identify and also address any potential concern earlier on. And then remote monitoring system for high-risk pregnancy. This device actually offers a significant advancement in prenatal care. Integrated technologies also allows for the remote tracking of vital signs and also a warning signs. So for instance, sorry. All right. So for instance, again, for example, the Philips Avalon CL fetal monitoring system is being used in several hospitals in the United States and across Europe. So by continuously monitoring these vital signs, they can improve the early detection of potential issues and ensuring that any abnormalities are promptly addressed. Okay. So, so the future of midwifery is being shaped by the cutting edge. Sorry about that. By the cutting edge. By the cutting edge of technologies. So advanced wearable and also AI-powered ultrasound analysis and a remote monitoring system are just a few examples. All right, of how this innovation is improving prenatal care. So these technologies actually promise to enhance our ability to provide timely and also accurate and personalized care to expectant mothers. So which we can actually help in terms of ensuring a better outcome for mothers and also their babies. Next is, as we can see, AI can significantly enhance prenatal care by providing personalized nutrition guidance, ensuring the expectant mothers receive the optimal nutrients they need. Now let's explore into how AI is empowering personalized nutrition even further. So postpartum care is actually essential for health and also well-being of a new mother. And AI technologies are providing innovative solutions to support this critical time. So this is the device which is called the Smart Nutrition Planning utilizes AI to actually create AI to create tailored nutritional plan that actually consider maternal health condition. So in terms of their dietary preferences and also cultural factors. So an example again is, of this is the Nutrino AI platform, which is used in various healthcare settings across the world. So by processing individual health data. So AI can actually help to generate personalized nutritional advice that ensure expectant mothers to receive the necessary nutrients, optimizing their health and also the development of their babies. So next is the virtual nutrition consultation, or also offer personalized nutrition advice, okay, and support through virtual platforms. So these platforms promotes healthy eating habits, all right? So during pregnancy and also lactation. So for instance, like a platform like Luck Health utilized in clinics across United States, and these virtual consultations, it actually helps in terms of providing expectant mothers with tailored advice and also support. So this will help in terms of encouraging them to maintain a balanced and also nourishing diet throughout their pregnancy. And lastly is incorporating advanced technologies to analyze biomarkers and genetics. So this actually helps in terms of providing information, which in terms of the biomarkers and genetics to enable precise nutritional recommendation for expecting mothers. So for example, countries like the United Kingdom, Australia, they are actually the pioneer of the use of these platforms. Okay. And then, so AI can actually offer tailored nutrition plans, promising to transform how we approach maternal nutrition. So AI is empowering personalized nutrition by offering all these smart nutritional planning. So virtual consultation and advanced nutritional analysis. So this advancement helps to enable expectant mothers to make informed choices about their nutrition, ultimately enhancing their health and that of their babies. Next is how we discuss how AI is revolutionizing prenatal care with personalized nutritional guidance. So let's move on to the postpartum period, during the postnatal period. Yeah. So the postpartum phase is a very crucial recovery and also well-being for the new mothers. So AI is providing innovative solution to support this critical time. So firstly, is the telemedicine offers virtual consultation for postpartum mothers. So this actually focus on the recovery assessment and also the mental health guidance as well. So this approach, it helps in terms of enhancing accessibility to professional care, allowing the new mothers to receive the necessary support for comfort and also from their own home. Okay, for example, telemedicine platform like Amwell and also Teledoc are widely used in the United States and also various European countries. So this platform actually provide comprehensive postpartum and also postpartum checkups and also mental health support, ensuring that continuous care and monitoring can be provided. And then next is AI-driven postpartum wellness monitoring app, which is also employed AI in relation to algorithms to track a postpartum recovery process of the postpartum mothers. So this application offer personalized recommendation, all right, for physical and also emotional well-being. So one notable example is the devices used in the United States, United Kingdom, and Australia, and maybe in some part of the Asian country as well. So they use by continuously monitoring, vital signs and other health parameters. So these apps usually ensures timely intervention and provide new mothers with the necessary support and also to recover smoothly and healthily. And next is the integrated technology incorporating AI. So this actually provide guidance, okay, on breastfeeding techniques milk supply management, and also addressing common concern. So platform, for example, like LEC app are widely used in Spain and also expanding to other European countries. So this AI-driven solution offer a real-time for breastfeeding which helps to enhance lactation. Okay, so and also provide enhancing lactation care and ensuring mother receive consistent and also reliable support. Right. Next, I'm going to share how AI can be integrated into providing holistic nutritional advice. So, right, on this slide, we can see three significant ways AI can actually enhance our approach to nutrition. So, based on the user input. So, the first one is the personalized dietary recommendation. AI can actually analyze individual data to provide dietary suggestions tailored to personal needs and also preferences of an individual. So this ensures that each person's unique nutritional requirement are met, so leading to a better overall health outcome. So second is the identifying nutritional deficiencies. So utilizing advanced algorithms, so AI can actually assist in detecting potential nutritional gaps in a user's diet. So by identifying these deficiencies, we can, as a midwife or a healthcare professional, we can provide precise and also effective advice to address them, and also optimizing health and preventing related issues. And the third one is promoting holistic well-being. So beyond simple nutritional needs, AI can also guide holistic nutrition, considering the physical, mental, and also emotional well-being of an individual. So this comprehensive approach ensures a more balanced and also healthier lifestyle. So again, one of the leading countries that has actively utilized AI for this nutritional analysis is the United States. So various technologies company and healthcare providers in the US have integrated AI to offer personalized nutrition plan and identify any deficiencies and also promote overall well-being through the holistic approach. Now, continuing from our discussion on AI-driven nutritional analysis, let's now have a look at how interactive meal planning and also tracking can further enhance our dietary habits using these advanced technologies. So on these slides, we explore three critical components, of interactive meal planning and also tracking. The first one is AI-powered meal planning. So artificial intelligence assists in creating personalized meal plan by considering individual nutritional requirement and also preferences. So this actually helps in terms of customization of meal plans, to ensure that each person receive a diet plan tailored to their specific health needs. And the second one is the real-time nutritional tracking. So with the real-time tracking, users can actually monitor their nutritional intake as it happens. So this immediate feedback allows for timely assessment and also ensure a balanced nutritional intake, ensuring dietary adherence and also health outcomes. Right, sorry about that. So next is integration of wearable devices. So for this one is in terms of integrating these devices, AI can actually seamlessly track nutritional data and also provide continuous feedback as well. So this integration facilitate a healthier choice by offering a real-time insight and also suggestion based on the user's dietary habits and also physical activities. So building on the benefit of interactive meal planning and tracking. So let's now explore how AI can actually help in terms of enhancing users' engagement, and accountability in maintaining a healthy diet. So on this slide, we will discuss 3 key aspects of how AI can actually improve users' engagement and also accountability. Okay, the first one is personalized nutrition coaching. So what AI can actually offer is they can offer personalized coaching, which keeps users engaged and accountable for their dietary choices. So by providing tailored guidance, users can actually more likely to achieve a long-term success in their nutritional goals. All right. Then the second one is the behavioral pattern recognition. Or AI can also has the capability to recognize pattern in users' nutritional behaviors. All right. So by identifying this pattern, AI can actually suggest, all right, targeted strategies for sustainable changes. So helping users to maintain a healthy habit over time. So this is actually crucial, especially in terms of motivating the individual to be more committed to their adhering to the advice given. So the third one is community support and also interaction. So in relation to AI integration, AI can actually help in terms of facilitating the community to support by connecting users with similar health goals. So this platform actually helps to share experience and also mutual encouragement, and also enhances motivation and adhere to healthy dietary practice. Okay. Now, let's shift our focus now to understanding the broader benefit of AI in a holistic care. Now, having explored the broader benefit of AI in holistic care, let's now focus on how this AI can actually enhance personalized nutritional advice. So in this slide illustrates 4 critical ways AI can actually help in terms of improving the personalized nutritional advice. The first one is customized meal plan and dietary recommendation. So AI can actually help in terms of analyzing individual health data and then taking into account their dietary preferences and also health goals. So this personalized approach can help to ensure that each person's unique nutritional needs are met effectively. And then the second one is the real-time dietary guidance and also monitoring. So AI is actually a very maybe a tools, important tools that can actually provide an instant feedback, all right, on nutritional choices, allowing individual to make informed decision for their holistic well-being. The real-time guidance help users stay on track on their dietary goals. The third one is identifying nutritional deficiencies and imbalances. So AI algorithm can actually help in terms of detecting micronutrient gaps and also helps to suggest targeted interventions to address specific nutritional needs. So by identifying these deficiencies, AI can actually help to prevent potential health issues. And then adapting to change health conditions. So AI-powered system can actually adjust nutritional recommendation based on evolving health parameters and ensuring continuous holistic support. And this actually adaptability is crucial for maintaining optimal health as a condition change. Now, having seen how AI can enhance personalized nutritional advice, let's now look at how AI improve access to holistic nutritional advices and nutritional guidance. So this slide showcase 4 key ways AI can expand access to nutritional guidance, ensuring it is more inclusive and also comprehensive. So the first one is remote AI-assisted nutritional consultants. So this actually helps in terms of providing virtual consultation, expanding across access to experts, nutritional advice, and regardless of geographical constraint. So this ensures that individual everywhere can actually receive the guidance they need. Next is multilingual and cultural sensitivity. So this platform can actually offer nutritional guidance in diverse languages, consider cultural dietary preferences for holistic care. So this inclusivity ensures that advice is accessible and relevant to users. The third one is targeted nutritional education and resources. So AI can actually deliver personalized educational material resources to empower individual with holistic nutritional knowledge. So this targeted approach can actually helps to enhance users' understanding and also engagement. And the fourth one is 24/7. This is very important. We also sometimes we need a 24/7 helps. Yeah. So availability of the nutritional inquiries. So AI can actually helps in terms of ensuring round-the-clock access, okay, to nutritional support and accommodating diverse schedule and also time zone. So this constant availability helps users get timely advice whenever they need it. So now, having seen how AI improve access to holistic nutritional guidance, let's now focus on enhancing efficiency and also accuracy in nutritional analysis using AI. So this slide detail 4 critical way AI can actually enhance the efficacy and also accuracy of nutritional analysis. So the first one is the automated assessment of dietary patterns. So AI streamlines the evolution of food intake, providing efficient analysis for comprehensive holistic nutritional assessment. So this automation save time and also it ensure accuracy as well. So the second one is predictive modeling for personalized nutrition. So AI utilizes predictive analytic to forecast individual nutritional needs, contributing to a holistic management. So by predicting future requirement, AI can actually help in terms of planning and also maintaining a balanced diet. So next is the integration of biometric data for nutritional insight. So AI encompasses biometric information to offer comprehensive insight into personalized nutritional requirement. So this integration actually helps in terms of ensuring that nutritional advices is tailored to the individual unique psychological data as well. And the last one is the continuous refinement of nutritional recommendation. So AI algorithm continually learn from user data, refining nutritional advice for enhanced holistic and care outcomes. So these continuous improvement processes ensure that recommendations stays relevant and also effective. So in the United States and some parts of the world, these AI technologies are actually being used to analyze dietary patterns automatically. All right, moving forward from our discussion on enhancing efficiency and accuracy in nutritional analysis, let's now focus on how this AI empowers individual to make informed nutritional choices. So this slide highlights 4 key ways AI empowers individual in their nutrition decision. So the first one is the personalized recipe suggestion and meal planning. So AI can actually offer tailored recipes, ideas, and also meal plans. So promoting informed choices, okay, for holistic nutritional well-being. So these suggestions are based on individual dietary needs. The second one is nutritional label interpretation and guidance. So AI can actually help in terms of understanding food label, provide guidance on selecting nourishing option for holistic nutrition, will help the user to make healthier choices. The third one is behavioral nudges for sustainable dietary habits. So AI can also deliver the gentle prompts, reminders to support individual and also maintaining holistic and sustainable behavior. So these nudges help reinforce positive habits and also ensure consistency. So the fourth one is integration of fitness and wellness data. So AI with activity and wellness metrics to offer comprehensive guidance for holistic nutritional balance by combining dietary, physical activity, and data. So AI can actually provide a well-rounded support for overall health. So this next slide actually demonstrate four essential aspects of how AI integration foster collaborative care. So interdisciplinary communication, data sharing. So AI can actually facilitate seamlessly information exchange among healthcare professionals, promoting healthcare coordination. So this will ensure that all members of the healthcare team are informed and can work together efficiently. The second one is a personalized care plan informed by AI insight. So AI generated insight contribute to a tailored care plan that prioritizing holistic nutritional support within the overall healthcare approaches. So this personalized plan, help address specific needs for individual. And then the third one is integration of patient feedback for AI refinement. So AI system incorporate patient input to continually enhance holistic care strategies and nutritional recommendations. So this feedback loop ensures that care remain relevant and also effective. And the fourth one is community engagement and support through AI platform. AI foster community interaction and peer support, create holistic network for sharing nutritional experiences and also knowledge. So now, as we continue to explore the integration of AI in healthcare, it is also essential to address specific challenges faced in integrating all AI within the field of midwifery. So this slide will highlight the key obstacle that needs to be considered overcoming to ensure effective and also beneficial implementation. So now that we have discussed the challenges of integrating AI in midwifery, so it is important to address also the ethical considerations involving in AI application. So this slide highlight four critical challenges, ethical aspect that must be carefully managed to ensure the possible use of AI in healthcare. So the first one is data privacy and patient confidentiality. So this has been mentioned by the previous presenter as well, ensuring that sensitive patient information is protected and also not misused in AI algorithms. So which is is paramount. So robust data security measures are actually necessary to maintain patient confidentiality and also trust. And next is equity and also fairness in AI decision making. So addressing these potential biases in AI model is also essential to ensure fair and equitable to treatment for all patients. So we must work towards developing AI system that are inclusive, okay, and free from discriminatory biases. And next is AI impact on the patient-provider relationship. So exploring how AI integration may affect the interpersonal dynamics between midwife and also their client is crucial. So we need to ensure that AI enhances rather than hinders the patient-provider relationship. Next is legal and also regulatory challenges. So navigating the complex legal landscape surrounding AI use in healthcare and also midwifery is vital. So compliance with regulation, ethical standard is necessary to protect patient rights and also ensure that safe implementation of AI. So incorporating AI into traditional midwifery practices also present unique challenges in opportunities. So this slide highlights four key considerations for integrating AI with traditional care practices. So the first one is balancing AI recommendation with traditional knowledge. So it is essential to find a harmonious coexistence between AI-driven insight and also a traditional midwifery practices. So this balance ensure that AI enhances rather than replaces, okay, the valuable knowledge and experiences of midwife. So respecting culture and individual preference is another crucial area. So acknowledging the diverse cultural background and also preferences of client is crucial in AI-driven care approaches. So AI system must be adaptable and sensitive to this variation to provide personalized and also respectful care. The third one is training and acceptance of AI technology. So ensuring midwife are adequately trained and comfortable with the integrating AI tools into their practice, which is vital. So continuous education and support is very crucial. This will help in terms of the smooth adoption and also effective use of AI technologies. And the fourth one is ensuring continuity of care with AI integration. So maintaining seamless care transition and also consistent support for client amidst AI adoption is essential. So AI should facilitate continuous and cohesive care, ensuring no disruption in the quality of service provided. Next is ensuring that the quality and algorithm accuracy is crucial for effective and also ethical integration of AI in midwifery care. So this slide outlines the 4 key considerations to achieve these goals. The first one is reliability and also accuracy of AI generated insight. So we must assess the dependability and also the precision of AI generated recommendation in AI midwifery care. So reliable insight are foundational to building trust in AI system. So ensuring they can contribute to positively to patient outcomes. And then next is incorporating diverse and representative data. So ensuring that AI algorithms are also trained on diverse data set, which is essential to accurately represent the full spectrum of the patient. So this inclusivity will help in terms of prevent biases and also ensure that AI can provide appropriate recommendation for everyone. Next is explaining AI recommendation. So effectively communicating AI drive insight to a client is crucial. So we need to ensure that midwife and healthcare providers can interpret this recommendation and clearly address the potential misunderstanding with their client. And lastly is the monitoring and also addressing algorithm biases. So implementing this strategy can actually help to detect and mitigate biases in AI algorithm used in midwifery care is vital. Right. Incorporating AI into midwifery care settings, it comes with various infrastructure as well, and also resource challenges. So this slide highlights 4 key areas that needs attention for successful implementation of this AI. So the first one is investment, in technologies. So it's actually not cheap, So securing resource and also funding for this implementation is very important. Next is integrating with existing healthcare system, what we have currently. So we have to be able to integrate the new system in the current one. So ensuring seamless integration of AI tool with the current infrastructure workflow in midwifery care is essential and is also vital. Next is accessibility and inclusivity of AI. So it is important for AI technology to be accessible to all midwife and clients, regardless of their location or resources. Inclusivity ensure that everyone can benefit from the advancement. So next is equally important. So training and support for AI implementation, providing comprehensive training, ongoing support for midwife to effectively utilize AI tools in their practice, which is also essential. So continuous education will help in terms of keeping the workforce adept and also confident in nursing using the new technologies. Next is patient education and empowerment are also critical component when integrating this AI into midwifery care. So this slide highlight the 4 key areas on the focus on the use to ensure patients are well informed and actively involved in their healthcare. So the first one is educating the client about AI in midwifery care. So empowering client with knowledge about the role of the benefit of AI in their maternity care journey is also essential. So it will help them to understand how AI can actually enhance their care and improve the outcome. So the second one is involving patient in AI-informed decision making. So engaging involving client into the process of utilizing AI insight will help to make them informed choices about their care, which is crucial. So involving patient in decision making, it fosters a sense of ownership and trust in the AI-assisted care process. Next is addressing the client concern about AI integration. So acknowledging and also addressing any apprehension or uncertainties that the client may have about AI in midwifery is also vital. So open discussion help alleviates fears and should build a confidence in the technologies. Next is prompting transparency in AI utilization. So ensure that open communication with client regarding the use of AI technology in their care plan. So which this will promote transparency, and clear and also honest communication will help to maintain trust and ensure that patients are fully aware of how AI is being used to support their care. All right. Next is as we explore deeper into the integration of AI in midwifery, it is also essential to consider ethical implications. So this slide outlines the key ethical consideration that must be actually addressed. So what are the impact? The first one is impact on patient autonomy and decision making. So AI implementation may influence how patients make decisions, raising concern about the informed consent and also individual choices. So it is important to ensure that AI support rather than undermines patient autonomy. All right. Second is data privacy and security, as I mentioned earlier also, which is a concern. So the use of AI in midwifery requires safeguarding, sensitive patient data to maintain privacy and also prevent unauthorized access. So robust data security also measure essential to protect patient information. Next is algorithm bias and fairness. So we have to address these bias and fairness as well in terms of, it must be developed and tested to avoid discrimination, to promote inclusivity. And the second one is professional responsibility and also accountability. So this is very crucial, especially in relation to when the healthcare professional have an access to this patient data. Okay, so AI integration raises question about the accountability of healthcare professional and the professional potential error in decision making. So clear guideline protocol are actually required to ensure that responsibility and accountability are maintained. So understanding the social implication of integrating AI into midwifery is very crucial to ensure that technology is adopted. So this slide highlights 4 key social implications that needs to be considered as well. The first one is the impact on the patient midwife relationship. So AI implementation may alter the dynamics of the patient midwife relationship, potentially affecting trust and also communication. So the second one is equity, accessibility in healthcare. So consideration must be made to access AI does not exhibit existing disparities in access to quality of midwifery care among the diverse population. And then public perception and also acceptance of AI. So we have to understand the public attitudes toward AI in midwifery. So this is crucial to address concern and also build trust in the technology. And the fourth one, impact on healthcare workforce and job roles. So the integration of AI may also lead to a shift in the roles and responsibility of midwife, impacting the healthcare workforce. So integrating AI into midwifery care involves navigating various regulatory and also legal consideration to assess, ensure ethical and also effective use. So the next slide, this slide actually addresses this. Okay, first is compliant with health regulation. So all systems in midwifery must adhere to regulation standard to ensure safe, critical, and ethical use within the healthcare framework. So compliance within this regulation is crucial to maintain patient safety. And then the next one is liability and also malpractice implication. So legal framework also needs to address issues of liability and also malpractice related to the use of AI technology in midwifery care. So clear guidelines are actually necessary to determine responsibility in case of error or adverse outcomes present. So next is informed consent and transparency. So again, Clear guideline is necessary to ensure patients are fully informed about the use of AI, and also they have the right to consent. And then transparency in AI application help to build patient trust and support ethical practices. And then this is very important as well, intellectual property and data ownership. So ownership and control of data generated or used by AI system must be defined to prevent disputes and also protects the patient's right. So clear policy on data ownership ensure that patient information is used appropriately and also ethically. So incorporating AI into midwifery care also come with various technical challenges that must be addressed to ensure smooth integration and also optimal functionality. So this slide highlights 4 critical technical consideration. The first one is interoperability and also integration with existing system. So effort are needed to ensure that AI solution seamlessly integrated with current midwifery care system and also workflow. So this will achieve the interoperability is also crucial for maintaining efficiency and also coherence into the healthcare delivery. The second one is reliability and accuracy of AI algorithm. Again, addressing concerns about the reliability and accuracy of AI algorithm is essential, ensuring that all tools provide accurate and dependable information. And then resources allocation and also infrastructure requirement. So assessing the resources need the infrastructure for implementing AI in midwifery, which is vital for sustainability and also effective integration. And the fourth one is continuous monitoring and also update. So ensure that there is a protocol for ongoing monitoring and also updating AI algorithm, which is essential. So continuous update with evolving best practice and guideline will maintain their relevant and also effectiveness. So users' acceptance and adoption are critical to integration of AI in midwifery care. So this slide outline the 4 key areas of focus to ensure both midwives and also patients are comfortable and also confident in using these technologies. The first one is education and training for midwife patient and also patient. So investing in comprehensive education and training is a program is essential to ensure both midwife and patient are comfortable with AI, which enable care. Proper training help to build familiarity and also competence in using this. And then AI addressing concern and also building trust. So efforts to address concern and build trust are essential for the successful adoption of AI technology in midwifery care. So next is user experience and interface design. So designing users-friendly interfaces and experiences is also critical to ensure that seamless interaction with AI tools for both midwife and also the patient. Next is ethical and cultural consideration in care delivery. So AI integration should be sensitive to diverse culture and ethical aspect to ensure respectful and also inclusive care actually delivered. All right. So by focusing these areas, we can promote users' acceptance and adoption of AI in midwifery care, leading to improved care outcomes and also a better experience for both midwife and also the patients. Right. Now, with the advancement in technology, Brunei has its shares of enhancing its healthcare services by integrating AI into the healthcare system, specifically through the BruHealth, the utilization of a BruHealth app. Okay, so this BruHealth app is a comprehensive application developed by the Brunei Ministry of Health. So it is actually significantly enhances healthcare delivery by incorporating various features such as health monitoring, appointment, scheduling, telemedicine, and also as previously used COVID-19 specific tools like contact tracing and also vaccination records. Now, these apps is designed to empower patients by providing them with a real-time data, a real-time health data and also analytic. So it is also improve communication between patient, healthcare providers, and this synergy not only support public health initiative, but also advances healthcare accessibility, efficiency, and also quality across Brunei. Now, a critical features of BruHealth is its ability to enable midwife and also other healthcare professional to monitor their patients' health data closely. So this includes tracking important metrics such as blood glucose level, dietary intake, weight gain. So by having access to this information, midwives can actually develop personalized and effective care plan for their patients. So moreover, BruHealth offers pregnant women with convenience of scheduling appointment and also accessing telemedicine consultation. So this functionality ensures that they can receive timely nutritional advices and follow-up care without the need to visit healthcare facilities physically by contacting the maternity healthcare professional through the apps. So this BruHealth app stands as a powerful tools in enhancing midwifery care in Brunei. So leveraging AI to provide better health outcome for mothers and also their babies. So again, in relation to midwifery, care, the use of BruHealth is actually targeting women to access, advices through making, scheduling appointment, so they can actually access the scheduled consultation when they actually meet the doctors. All right. Next is sorry. Oh, I missed that slide. Sorry about that. So to conclude, while artificial intelligence offers valuable tools that can significantly enhance midwifery care by improving accuracy, efficiency, and also personalization in its essential, to recognize, that it cannot replace, the crucial human aspect of midwifery. So the emotional support, and cultural sensitivity and also personalized interaction component interaction provided by midwife remains fundamental, component of holistic care. So AI should therefore be seen as a complementary tool that support midwife, so enabling them to focus more on the human aspect of care that technology cannot actually replace. So this symbolic relationship between AI and also midwifery is where the true potential lies. So looking ahead, the future of midwifery care can actually depends on the harmonious integration of AI and also human expertise. So this approach ensures that we provide the best possible outcomes for mothers and their babies, blending the strength of advanced technology with the irreplaceable value of human touch and also understanding. So thank you very much for your attention. And this is the reference that I use. Thank you.
Thank you, Dr. Sarena, for that comprehensive presentation. Dr. Sarena, we kindly ask you to wait, as the discussion and Q&A session will be held after the third presentation are finished. Dr. Sarena, how about that?
Can you repeat that again because it's not clear?
Okay, the discussion and Q&A will be held after the third presentation are finished. Okay, jadi
Okay, sure.
to it. Okay, thank you. Thank you
Thank
for
you.
your understanding. And to all the attendees, if you have a question, you can write them in the comment section, including your name and affiliation. Okay, ladies and gentlemen, we will now proceed the third presentation. Our third speaker is Miss Annie Lim Jianting, a renowned expert in traditional medicine. The topic of their presentation is the amazing traditional remedies from several countries. And this is her lab curriculum vitae. Ladies and gentlemen, please welcome Annie Lim Jianting. Good morning, Miss Annie.
Good morning, everyone. Please
How are
allow
you
me to
today?
share my slides here.
Okay. Talk about traditional medicine. I find this very interesting and I can't wait to hear about it. So, without a further ado, Miss Annie Lim Jianting, you have 16 minutes and the time is yours.
Okay, thank you. All right. So before I start my speech, okay, please excuse me if my pronunciation is unclear because I have just put on the braces. So I kindly ask for all of your understanding and would like to apologize here. So distinguished chairperson, esteemed experts, and honored guests, good morning, salam sejahtera. It's an honor to be here today at this prestigious conference where we gather to discuss, share, and learn about the advancements in the field of medicine. Before I dive into the heart of my presentation, I would like to extend my gratitude to the organizers of this conference, University Dr. Subandi, the esteemed speakers, and all of you, the dedicated professionals, researchers, and also students who are the backbone of the healthcare systems. All right, so this is my background, okay. Actually, I'm more pertaining to clinical practice, okay. And currently, I'm a lecturer in Management and Science University, Malaysia, as a TCM lecturer. Okay. All right. So today, I'm honored to share with you all with insights about the TCM, so-called traditional Chinese medicine. Okay, and actually, TCM originates from China, and it is a very unique and comprehensive medical system. And the theories and treatment methods of TCM are distinct from Western medicine, actually. So this is the contents for my presentation today. And now I would like to introduce what is TCM. So TCM, or we call it traditional Chinese medicine, okay, is a very comprehensive medical system that integral to Chinese culture, influencing daily life, dietary habits, and health practices. Okay, and it is considered a national treasure. The national treasure here is mentioned to China treasure and has been practiced for thousands of years. And TCM actually has gained worldwide recognition for its holistic approach and effectiveness, especially in treating chronic diseases. So practices such as TCM acupuncture and herbal medicine are increasingly integrated into Western healthcare systems. Okay, for example, it's getting well known and spreading internationally over the world. For example, like in the countries of United States, UK, US, UK, Australia, Germany, Italy, South Korea, even to Indonesia recently. Okay. So for TCM, actually TCM aims to restore the balance in human body, mind, and spirit. Okay. As we know that a very healthy body not only means to a physical, but also to the mind, okay, and also the spirit. So as TCM emphasizes on the harmony relationship between natural environment, means our natural, okay, and also the human beings. And such aims are supported by a few main TCM principles. First, it is yin and yang theory. I'm not sure whether most of you maybe had never heard before what is yin yang. Okay, as you can see this diagram, okay, this black color, it represents the yang, okay, the yin, sorry, okay, and this bright color represents the yang. So yin and yang theory is the concept, okay, from the ancient philosophical framework and is central to understanding the balance and harmony that TCM seeks to achieve within the human body. That means when we are talking about yin and yang, we are integrated it into the body health. We say that as long as the yin and yang is balanced, okay, our body is in healthy state. Okay, what are the examples of yin and yang? Okay, like yin, this one, Y-I-N, yin, we can say that it is, can be said that it is a darkness, okay, cold, okay, stillness, introspections. While for yang, it is linked with light, okay, the light, warming, activity, and external focus. Okay, so in TCM, when we say a yin-yang balance, means the body is in healthy state. Okay, the blood circulation is very good. Okay, and the emotional is balanced. The second principle in TCM is qi. Okay, qi. This is the we say that this is the ancient words for qi. Okay, as here, the inside, there's a Chinese word. It is mean that the rice, rice, okay? When we're talking about the qi, it is a vital life force in our body, okay? That flows through the body. And this qi is very important in TCM. And we say that the qi actually maintain the flow and balance of our whole body mechanism. And it is very crucial for our health also. So how to maintain the qi in a very balanced state? We need to eat. So in TCM, we are very, very concerned about the appetite of our patients. That's why we say that the word here, it means to rise. We humans need to eat rice to maintain our daily life, our health, right? Okay, so this is how the Chinese word means to the qi. So for the third principle, okay, the third principle is 5 elements. Okay, actually 5 elements is considered as one of the important theory in TCM. From here, you can see the 5 elements consist of wood, okay, fire, earth, metal, water. We call it 5 elements. So those 5 elements are believed to be the fundamental component of the universe and interact with each other in various ways to influence our health. Okay? And this is a part of the theory that we TCM practitioners use to diagnose the disease. Okay? All right. So next, the other very important theory principles in TCM is meridian system. Okay, so what is meridian system? Meridian system, you can understand it in the way of so-called channels, okay, the road, okay? It is the channels that allows the qi, okay? Just now we learned about the qi, and also the blood to flow, to circulate through our body. So here the picture you can see the line, okay? And the line is distributed throughout the body from the head to the toes, okay? Pass through the stomach, maybe the back also, okay? And on the meridian, it has its own acupoints. So this meridian system and acupoints are very important for TCM practitioners to understand the body conditions, and also it allows us to do the acupuncture. Okay. Well, we have mentioned about the principles of TCM. So now let's see for the classic treatment methods of traditional Chinese medicine. Okay. So for the first treatment we have in TCM, it is herbal medicine. Okay. TCM, actually we have quite lots of herbal medicine which recorded in our classic books. Okay. Normally we use plants, animals, and mineral substances as our herbs to treat the illnesses and also maintain our body health. For example, like ginger, okay? Ginger. I think ginger is very common in everywhere, okay? And actually, in TCM, we say that ginger can have many functions based on how the TCM practitioner process the herbs. For example, we have raw ginger, okay? And we have dry ginger. And also we have baked ginger. We process these particular herbs in order to get the functions we want. So each of the processed herbs will provide a very different functions and treat different types of symptoms, right? So next, for the second types of classic treatments in TCM, it is acupuncture. I think acupuncture is very well known for everyone already, okay? And actually acupuncture also being like utilized by Western doctors also. And actually, our TCM acupuncture, we have many more theories to go through. And what is acupuncture? Actually, basically, it is the practice of inserting thin needles, okay, into specific points on the body. So what we want to do is to stimulate the flow of the qi, to stimulate, okay, the circulation, okay, in order to achieve the functions that we want. For example, like we can put needle to stop the pain, to relieve the pain, or to treat various health conditions, right? Okay, so this is the electroacupuncture stimulator. Though that this stimulator is not a very new thing, but actually with TCM, we are more focusing in the techniques, because when we are putting needle, we have many types of techniques, manipulations to treat different diseases, to treat different types of illnesses. Okay, so this is one of the electroacupuncture stimulators. Okay, as you can see, this one is a very classic one. This one is a quite latest invention of the electroacupuncture stimulator. So how we use this stimulator? After we put the needles, okay, and we just clip the things on the body of the needle, and then we can set the frequency and also the types of the wave we want, okay, in order to achieve the efficacy of the treatments. Okay, and this machine, it combines of the very classic electroacupuncture stimulator functions, plus it has the warming functions. Okay, so this is the latest one of the electroacupuncture stimulator. Okay, so let's see for the another classic types of treatments. Tui Na. Okay, this word is very rare to hear, right? Tui Na. Actually, Tui Na is a form of therapeutic massage and body work by applying pressure to acupoints, meridians, and groups of muscles of nerves. Okay, the TCM Tui Na, actually we have quite lots of techniques involving. For example, like kneading, pressing, rolling, shaking, and stretching. Okay, you can see from the picture here, we have different types of manipulation methods. That's why we call it Tui Na. Tui means pushing. Na means grasping. Okay, we take it out, take it. So it means Tui Na. And it's a little bit different with those so-called massage. Okay, because we involve a lot of TCM manipulation techniques, right? So for the another types of classic treatment, okay, it is moxibustion. So moxibustion actually involves the burning dry mudwort, okay, on or near the skin and specific acupuncture points. Okay, the purpose of using this moxibustion is to warm the body. And we also want to invigorate the flow of the qi, or so-called vital energy, okay, in the body and dispel certain pathogenic influences. Okay, so you can see we have different types of moxibustion methods. Okay, this is been quite interesting because I think most of you like maybe know something about moxibustion. Okay, I think the herb we're using here is also very quite popular in around us, but we don't know actually what is this. Okay. Yeah, so this is the modern types of moxibustion. We call it electric moxibustion. Okay. Well, this can see that we have like something like a bed, okay, and also the standing device. Actually, they already like converted the classic, okay, moxibustion to the electric types. So, the convenient part is everyone can manipulate by learning, okay. For the very classic type of moxibustion, it involves a lot of techniques, okay? And also we need to do a lot of prevention and precautions also, okay? So now let's see for another types of classic treatments, which is cupping, okay, or bekam. So for TCM cupping, we use three types, okay? We have the vacuum suction cupping, this one, okay? And also we have fire cupping and also fire cupping, but the material of the cups is bamboo. So the most classic one is this bamboo cupping, okay? And why in ancient time they use this bamboo cupping? First, because of the invention problem, and also bamboo cupping in ancient time, they will cook the herbal formula, okay? The decoction of the herbal formula, okay? When they already done cooking, they will just like dip the cupping, the bamboo cups into the decoction. So after that, they will use the bamboo cups to do treatment on the patients. Okay, this is the reason why in ancient time they use bamboo cups. Okay, nowadays we already like more on use of the glass cupping and also the plastic one. Okay, so the functions for cupping actually is to like help with pain, inflammation, and for relaxation of the muscles. And it's a type of deep tissue massage also. Okay. So now, I would like to share a little bit about the clinical application of TCM. Okay. So actually, TCM has a very great potential in clinical treatment of diseases. So in China, the integration of TCM and Western medicine has become a very common practice. And therefore, courses on the integration of TCM and Western medicine are offered in major TCM universities across China. So due to differences in healthcare systems, some countries will maintain TCM and Western medicine as separate disciplines. For example, in Malaysia, right? So nevertheless, the effectiveness of TCM is well known and is being promoted internationally. And also, okay, TCM treatment is available in Malaysia government hospitals. Okay, we have 15 government hospitals which already implemented the TNCM treatments. Means TCM is part of the TNCM, traditional and complementary medicine. It is TCM is under the TNCM unit. So in Malaysia, government hospitals, we already like implemented this so-called alternative medicine treatment. Right? Okay. So this is the chart, okay, got it from the study on 2015, okay. This study shows that how responsive of the Malaysian, okay, and how much of the rates for Malaysian to choose the TCM, and the reasons for selecting TCM in Malaysia. As we can see that the reason is recommended by friends and family, and the second one is trust in TCM. So that means TCM actually is slowly but slowly being accepted by most of the people from different maybe background, different races, and so on. Okay. So for AI in TCM, from what I understand is actually TCM is a kind of healthcare system that's more on hands-on and also very involve more technical skills. But also in China, they have already invented many AI system softwares applications for TCM. For example, okay, this is from the eTCM in Malaysia. Currently in Malaysia, we have one application who involve the AI TCM. We call it eTCM, okay? And this eTCM allows our TCM practitioners, no matter you are in a clinic or maybe you are freelancers, okay? You do house call service treatments, you can use this application to like let patients to do appointment, okay, through the applications. And also the TCM practitioners can prescribe the formulas, the herbal formulas, okay, order the herbs formulas through this application, and they have the stores to cook, to prepare the herbs formulations. Then they will send these herbal formulas to the patients. So of course, the patients need to pay through the apps. Okay, they need to do payment through this application. Only they can get their medicine. Okay, so that means we TCM practitioners no need to have like the prepared one powders of TCM by our own. We can like prescribe it anytime, anywhere through this application. Okay. And also in China, they already invented quite lots of like software or even the machine, okay, in order to help the TCM practitioners. So in TCM, actually, we are focusing on 4 diagnoses. Our diagnosis methods are quite different. First, we need to inspect the patient's face, complexion, the color of the complexion, and also the tongue. Okay, you can see the picture here. So this machine, or we say that the software, okay, the most important process is patient can take photo on their own tongue, okay, and then upload to the application, okay. Through this, you can see this application, they will start to like investigate, analyze, but also instead of tongue diagnosis, we still need to get the patient's information. For example, their symptoms, their clinical manifestations. Okay, through this, they can only analyze. okay, the problem of these particular patients, okay, and then the TCM consultations, okay, will start. Like the doctor maybe will have a video call, okay, to like get more information if they feel needs, okay, or else they will like generate out some very general diagnosis, okay, and also they will give some like suggestion, what should you do, okay. So this is how the AI works in TCM. And this is a Chinese version now. So I'm so sorry because it's more happens in China, so I only can get, okay, the Chinese words, but I can explain here. This is the remedies suggestion based on the tongue inspection diagnosis result. So this doctor will suggest the patients on their food remedies. Okay, food remedies actually is very important in TCM also, instead of prescribing the herbal medicine. Okay, so patients can know their body constitution, okay, and also they know how to cook the food using what kind of ingredients in order to help to boost up their body, okay. So they prescribe based on the tongue inspection diagnosis results, okay. And another types of AI, so-called AI-driven virtual acupuncture teaching software. This software can be implemented in the universities, okay. This software actually allows the students to learn, okay, to learn the meridians, the acupoints, and most important is to know how to insert the needles into the acupoints properly. Okay, normally in our school time, we learn the acupuncture. Actually, we learn it through inserting to our own body, own acupoints on our body. So somehow it may be like causing to some inconfidence for those students who in confidence, they really dare not to try, and this will like cause them to like no chance to learn, okay, to master the skill of acupuncture. So this software, teaching software, is very useful and very like very welcome by all the universities, okay. And this is how they perform the inserting needles, okay. So this is can be part of the examination tools. So when we lecturer want to give some like lab practical tests on acupuncture subject, so we can use this to let them to like do the test instead of doing the like the practice on the real human body, okay. So now I would like to share a little bit about the TCM treatments in some case, which is post-stroke rehabilitation. Okay, as anyone, I think all of you know that the stroke rehabilitations involves many like treatments. Instead of Western medicine, okay, we need physiotherapies, and also actually TCM acupunctures, tapping, tuina, and also the herbal medicines can assist the rehabilitations also. So before that, I would like to brief a little bit about the definition of stroke in TCM, because the definition of stroke in TCM is a bit different with Western medicine. So basically, Okay, in TCM, we say that stroke is involves of the wind, okay, from external. Okay, this is a little bit like maybe confused for all of you. Okay, but I would like to touch a little bit before I go through the clinical part. Okay, so we say in Chinese, 中风. Okay, 中风. Feng means the wind. So in ancient time, they understand that stroke actually involves of the external wind. Okay, and this theory or understanding can be like found in our very classic TCM classic book. We call it the Yellow Emperor's Inner Canon. Okay, and this book compiled during the Warring States period. Means it happened in 475 to 221 BCE. So it's 1,000 years ago. Okay. And also, there were some like etiology and clinical manifestation recorded in another classic book. We called it like 金匮要略. Okay, and this book compiled during the late Eastern Han Dynasty, approximately like in 150 to 219 CE. Okay, in this book, it stated clearly about the symptoms of 中风, stroke, deviation and paralysis, numbness of the skin, loss of recognition, and difficulty in speech. So these symptoms described are closely resemble those of a stroke in Western medicine. So these text indicate the wind stroke. Okay, is caused by the emptiness of the, we say that the vessels, the collaterals. Okay, so allowing the exogenous wind pathogen to invade. Okay, so in the view of Western medicine, okay, we say that the stroke occur when the blood flow to the brain is blocked or there is sudden bleeding in the brain, right? So they are actually two main types, and plus one is transient ischemic strokes, right? Instead of ischemic stroke and hemorrhagic stroke, okay? So for the treatment methods of TCM in stroke rehabilitations, we say that actually stroke rehabilitation requires the simultaneous integration of both Western medicine and TCM. Such integration includes oral administration of Western medicine, physiotherapy, acupuncture, tapping, tuina, Chinese herbal prescriptions, and etc. Right? So I would like to touch a little bit about the TCM syndrome differentiation. This is a very unique differentiation in TCM. We use it to like differentiate and analyze the nature of the disease. So for stroke, we TCM will categorize it into either two main types, okay, based on the criteria of the degree of impairment to brain and marrow functions and the presence or absence of consciousness disturbance. So in TCM, we have two main types of stroke. The first one is stroke affecting the meridians. The second type affecting the internal organs. Okay. This fundamental difference between the two lies in the alteration of consciousness. Okay. So this is the table. Okay. So basically in TCM, when we say that the strokes affecting the meridian, so normally the characteristic for this type of stroke, there is no alteration in consciousness. Means this patient is with conscious. Okay, While for the stroke affecting the internal organs, okay, these kind of patients, they may sudden fainting or straightly loss of consciousness. Okay, right. So in clinical, we T-cell practitioners need to assess the patients also, okay, based on these few criteria. And also, when we apply the treatments, especially the acupuncture, this is the core treatment in stroke rehabilitations. So acupuncture is recommended by the World Health Organization, WHO, as an alternative and complementary strategy for stroke treatment and for improving stroke care. Also, a study found that acupuncture may be helpful in the early stages of stroke recovery. Okay. So a more recent 2020 study suggests that acupuncture may help stroke recovery by alleviating oxidative stress, which is an imbalance between antioxidant and free radical in the body. So this can lead to tissue and cell damage. So another study again also showed that acupuncture can help people who develop dysphagia, okay, following a stroke, which is difficulty with swallowing, right? So basically, how does acupuncture work? Okay, acupuncture works by increasing the circulation of blood, relaxing muscles, and stimulating the production of neurotransmitters like endorphins and serotonin. Okay, so this result in relaxation and pain relief. So in TCM, it works through regulating the qi and blood of meridian and collateral system in order to balance the body. So maybe most of you don't know what is collaterals. And collaterals, actually, it is a very tiny branches, okay, derived from the big meridian, or we call vessels, and distribute throughout our body under our skin layer. We call it collaterals. Okay, that's why when we say that when we put needle, we do acupuncture, we are triggering, stimulating the qi and blood circulation through the collateral, okay, then through the meridian, and then link to our internal organs. Okay, so at here, I would like to introduce the scalp acupuncture with body acupuncture. So what is scalp acupuncture? Scalp acupuncture means we put needle on the head. Okay, in T-cell meridian and acupuncture, meridians actually distribute throughout our human body, including the head. As you can see the model, we have like total 365 acupoints in our whole body. Okay, as you can see, the red dots, all are the acupoints. Okay, and also we know that the brain, the central nervous system, is housed in the head also. Okay, and this is some diagrams about the stimulation areas of the scalp. Okay, each area has their own functions. Okay, so we will choose based on the patient's condition. Okay, and somehow instead of using scalp acupuncture, we will like combine with other parts of acupoints. For example, okay, instead of scalp acupuncture, okay, we will choose some acupoints from the body, the legs, the hands, okay, based on the patient's condition. And also, we will focus the acupoints, specially located near to the joint, okay? For example, like wrist, elbow, ankles, knees, okay, and so on. Because patients with strokes, they have the limitation in moving their hands or legs, right? So this is the important acupoints that can assist them to enhance the muscle functions, okay? So this is some examples of the acupoints that we will use, like on the top of the head, okay, and the hands, and also the lower limbs, okay. And this is my patients, okay, with a stroke condition, okay. This type of needle techniques, it's called the Jeans 3 needles. Means I choose 3 acupoints, okay, as the treatment. So this, we can see that it is focused on the frontal lobes, okay, of the head. So these methods actually can like stimulate we call it the emotionals, and also we can balance his or her emotionals to help him or her have a good quality of sleeps, okay. And also this one, we call it body acupuncture, which this needles is on the abdominal, okay. And the purpose of putting needles on the abdominal is for enhancing the digestive systems. Because in our TCM practitioner thoughts, okay, we say that patients must have a good appetite in order to get well soon. So we focus on their digestive system in order to say that when patient like taking the remedies or herbs, medicine, or even the Western medicine also, they will have a good digestive functions to digest, to like grab all the nutrients from the foods, okay, so that they can recover well, okay. So in recent research studies also, they have done some studies, okay, on the scalp acupuncture in treating the acute ischemic stroke, for example. And it shows that SA or scalp acupuncture appears to be able to improve neurological deficit score, right? And also another study shows scalp acupuncture with the long-stay method can improve neurological deficits and the ability to perform daily activities among AIS patients, acute ischemic stroke patients, which may be related to the improvement of CVR functions in patients. Okay. And also, this is the technology review by our Malaysia Ministry of Health regarding the acupuncture for post-stroke rehabilitations. So if you all are interested to read, you can access this website, okay, to go through the review report, okay? And instead of using acupuncture, we also will combine the treatment with herbal medicine. And why we need the herbal medicine? Because we need it to boost up the functions, okay, and also the recovery of the stroke patients. Okay, during in the acute phase of stroke, in TCM view, we say that these patients may in excess syndrome, means they are still like got a lot of we call it like blood stasis, frame. Okay, so we use the herbal medicine helps to like expel those unwanted products in the body, so-called the blood stasis and flame. And in the chronic stage, okay, or recovery stage, we say that this patient may need some herbs to strengthen and boost up their health. Okay. So based on the types of stroke of the patient, we will prescribe the treatment differently. Okay. For example, like acupuncture, we will choose the acupoints that's suitable to the patients. And also the formula, the herbal medicine formula that we use also will be different. Okay. And for another type of stroke, okay, because this stroke, okay, stroke affecting the internal organs, it is considered as a very serious stage, okay? So normally when we prescribe the herbal medicine, we will focus on like to wake the patient up, okay, to let the patient have the consciousness. Okay, of course, when we want to intervene with TCM treatments, okay, we TCM practitioners will intervene the TCM treatments only after the patient is stabilized. What does this mean? This stabilization must be diagnosed by Western medicine. Okay, so TCM intervention should only begin after Western medicine has diagnosed the patient as stable. Okay, this typically takes at least 1 week to ensure the patient's vital signs are stable and there are no acute complications. All right. So normally my patients come to me only when they are stabilized. Yeah, I will also confirm that they are stabilized with all the Western medicine treatment plans, procedures. Okay. And also about the comprehensive treatment and synergistic effects. The combination with Western medicine is also very important. So TCM treatment should be combined with Western medical treatment to achieve optimal result. And we say that the acute phase management is by Western medicine, and the rehabilitation phase by TCM can complement each other. Okay. And also, we TCM practitioners also need to individualize the treatment for each patient. That's why in TCM we have a lot of so-called syndrome. Okay, we will classify this stroke into different types of condition, and the types of treatment, the formula, prescription, the herbal formula we prescribe also will be different based on the patient's body conditions. Okay. And the prevention of complications. So during TCM treatment, attention should be paid to preventing and treating common stroke complications, for example, like lung infections, bed sores. Okay, bed sores happens in those who bedridden. Okay, and deep vein thrombosis. Okay, these are for the patients who are bedridden. Okay, and the most important things is psychological adjustment. Those stroke patients, definitely they will go through the psychological or maybe their emotional is very unstable. For me, myself, I will focus also on their emotional. Okay, most of them will be like reluctant or maybe give up to do the treatments because the stroke rehabilitation is a very long journey, especially for them. Okay, so this is how we TCM practitioners need to master, okay, the skills of how to like console, okay, to comfort their unstable emotional. Okay, so we TCM also emphasizes, okay, we'll emphasize treating both the body and mind, not only physical but also the mind. Okay, and also the guidance for family care. And the long-term care and support are needed for stroke recovery and also to their family members. And TCM practitioners should guide family members in scientific home care, including dietary adjustments, functional exercises, and stroke prevention. This is very important because when patients they go through all the treatments, especially like exercise, functional exercise, instead of doing in physiotherapy centers, they need to practice it also at their home daily, right? So this involves the family members. So if let's say the family members do not give supportive, do not want to involve, then maybe these patients will have a very slow recovery. Okay. So in conclusion, TCM actually can be a very significant role in the rehabilitation phase of stroke treatment, but it must be introduced only after stabilization diagnosed by Western medicine. Okay. And also, would like to touch a bit of AI in TCM field. So actually, TCM AI software applications hope that will be implemented slowly by slowly into private clinics and hospitals. Okay, because in Malaysia, the status of traditional Chinese medicine is started to like raise up. Okay, so start slowly and by slowly, all the Malaysian can accept the TCM as part of their alternative treatments also. So this is the future things that we can see that foreseen that AI softwares, okay, can be implemented and also it can assist, okay, enhance the TCM practitioners like their efficiency in treating patients, okay, and also the efficacy of treatment. And most important is this AI, TCM AI applications, devices can also build up the confidence, okay, in the patients, okay, towards their treatments, right? So these are my references of my presentation. Okay. And yeah, that's all of my presentation. Okay. I sincerely thank all the experts and distinguished guests for your patience, okay, and your attentive listening. So, and I look forward to the discussions and insights that will emerge from this conference. Thank you.
Okay. Okay. Thank you, Ms. Annie, for the excellent presentation. And now we will move on to the discussion session. And I will read the question that have been written in the comment section. Therefore, I would like to invite our speakers back. Dr. Sarina. Dr. Sarina?
Yes.
Okay. Thank you for waiting, and we will now begin the discussion session.
Yes. Can I address the question posed in the question and answer box?
Yeah. Wait.
Yeah, I actually have also provided my given my answer through the chat box as well, yeah. If you want me to go through it, or maybe just go through the one that I haven't actually provided my answer, I mean, for the questions.
Sorry, Doctor, can you repeat what you mean?
Okay, I have provided my answer to the questions in the chat box as well. So do you want me to go through the answer here as well, or you just want me to focus on the question that I haven't answered? Or maybe I'll just go through the the question, yeah? Okay, the first question, I have received 4 questions from the audience. The first one is, thank you very much for the question. The first question, from the exposure of almost all the advantages of AI, what is the most dangerous use of AI? Okay, this is a very actually interesting question, and I try my best to answer this, yeah? So the most dangerous use of AI is the development of maybe autonomous weapon systems, which is LOS, or the killer robots they call it. So this system can actually operate without human intervention, which can lead to a significant ethical and also moral and security concerns. So one of the key danger includes lack of human control. Okay, which is maybe AI takes over the machine. So machine making life and also decision. So that is the most dangerous area of concerns. And then also mass destruction can be a potential issues as well. So meaning to say that a large scale or maybe a precise attack causing mass casualties, yeah, and risk of proliferation. So meaning to say that falling into the hands of maybe, you know, a terrorist, or maybe, yeah, because we do actually have like human data, you know, like the population data, especially in relation to health. So this can be, you know, if it falls into the wrong hand, so it can be dangerous as well, yeah. And then accountability issues. All right, so difficulty in identifying responsible parties, all right, and also enforcing legal accountability. So people can just easily access, you know, the data of the patients. So this can be difficult to identify, and accountability issues may be a big concern as well. And unintended escalation. So, for example, maybe a rapid or unpredictable AI actions can actually lead to conflict escalation, or maybe there is or short circuit, or maybe there is a conflict of, you know, a link between a different data, which can lead to this. So unintended escalation. And then another issues that is very commonly discussed among in the healthcare practice is related to ethical and also moral concerns. All right, so challenges to the scarcity of human life and also existing international laws, so needs to be actually addressed in terms of maintaining ethical and also moral concerns. And so autonomous weapon system is a major concern here, can actually pose a severe risk. So necessitating for maybe, you know, international regulation maybe, or a dialogue, especially in relation to using AI in the healthcare system. Okay. And then I hope that's answered the questions. And then the second question is, what are the obstacles in the implementation of AI in the healthcare sector, especially in developing countries like Indonesia? As we know that technology development are often not matched by the readiness of the human resources in those countries. And on the other hand, another question is, AI can certainly poses a threat to the development of our healthcare systems, which I agree to that as well. And then what is your recommendation about the condition? Now, Brunei, Darussalam and Indonesia, I think is not actually quite far in terms of the AI technology advancements. Yeah. So, but we still have a lot of learning in terms of using, understanding, all right, those that AI that has been actually implemented, used globally, all right. So the obstacles in implementing AI in healthcare settings in developing countries, yeah, so including Indonesia, maybe is the limitation in terms of technological infrastructure. Okay, and also maybe inadequate data quality and availability. So this actually, in relation to this AI system, may require a large amount of high quality data, but in developing countries, healthcare data is actually often incomplete. Yeah. So inconsistent. So or maybe not digitized. All right. And another obstacle in implementing in developing countries may be human resource constraint. So this is there is actually a shortage of trained professional to develop or even manage and maintain AI system. Even in Brunei also, we do actually have like that issues in terms of human resources constraint, especially looking at those people who actually have specialized background in this area. So maintaining and handling this AI system is a very crucial task, and it's not actually easy. So and then next is economic constraint as well. So in developing countries, this AI technologies is actually very costly. So because the high cost of AI technologies and also implementation, it can be prohibitive for healthcare system operating because it's with especially with limited budget. Yeah. And then another obstacles will be regulatory and also ethical issues. So many developing countries, they have lack of comprehensive regulatory framework for AI in the healthcare. So even in Brunei Darussalam as well. So leading to concerns about patient privacy, data security, and also ethical use. Another obstacle is resistance to change. Now, for those healthcare professional who actually being comfortable using non-technology, yeah. So resistance to change is going to be another issues, yeah, obstacle for this implementation of AI. So they may be resistant from healthcare professional and also institution to adopt new technologies due to fear of maybe job displacement, yeah, lack of understanding, or skepticism about AI effectiveness. Yeah. And another obstacle could be cultural and also societal factor. So societal factors in terms of society acceptance towards AI or trust in AI can vary. Yeah. And cultural factor may influence the willingness of patient and also healthcare providers to embrace AI driven solutions. Now, what are the recommendation for this? So to ensure that we actually able to overcome this obstacle. So the recommendation would be to enhance digital infrastructure through government and also maybe through private sector as well. So collaboration between the private sector and also the government sector to ensure the reliable internet connectivity, which is a very common issues in the developing countries, data shortage as well, and also computing power. And another recommendation may be to enhance data management practices, okay, and also maybe to capacity building and training for the staff, yeah, to invest on the education and also training program, which is to build a workforce skill in AI technologies. This will help to enable the healthcare professional to maybe integrate AI in a tool effectively. Another recommendation, maybe cost management and also maybe funding. So explore any innovative funding mechanism, maybe such as private, public-private partnership. This could actually help in terms of cost management and also funding for the AI implementation costs. And then develop maybe a regulatory framework could actually help. This will help to maybe, like establish a clear guidelines and also what are the ethical standards can be used, all right, to ensure that privacy, data security, and also ethical consideration that can be actually addressed. Another recommendation, maybe promote stakeholders engagement, and also maybe prior to implementing the AI program or tools, maybe you need to pilot the program and also socialable solution. So meaning to say that start with pilot progress, all right, pilot program to test and refine it, and then the AI application in healthcare settings, and then scaling successful pilot gradually, incorporating lesson learned. So pilot testing the AI prior to implementing it. So, and last recommendation maybe to foster international collaboration. And maybe this is the most maybe what you call it, expertise in terms of gaining or collaborating with international partners or expert in terms to share what are the best practice or resources available out there, and what are the knowledge, and also accelerating AI adaptation in the healthcare in the developing countries. All right. So the third question, I hope that answered the question, the second question. So the third question, this participant would like to actually ask the current, that currently there are many application or website used for monitoring or reporting related to health services in Indonesia. We have mobile BPJS. I'm not quite sure what that is, which can now be used for patient registration, or maybe this is similar to BruHealth, So, sorry. Okay, sorry for that. So, and then how does artificial intelligence let me just read that. We have mobile BPJS, which can now be used for patient registration at referral hospital, and eMISO, which can be used for monitoring and evaluating the use of drug therapy by patient. In your opinion, how does artificial intelligence position itself in dealing with these numerous applications? How can artificial intelligence maintain data quality and decision-making accuracy in the combination of application use? All right, thank you for that question. So I'll try to answer this question. Now, AI roles in enhancing healthcare application in Indonesia. So AI can actually significantly improve, the functionality or integration and effectiveness of healthcare application, like as you mentioned, the mobile and the mobile BPJS and the eMISO in Indonesia. So maybe here are some of the key roles or methods that can be employed by AI. So maybe AI position in this integrating healthcare application by data integration and maybe interoperability, meaning to say that the role is to facilitate the seamless integration or maybe disparate data sources across the application. So maybe the method use, you can use natural language processing, maybe machine learning, algorithm to standardize the harmonious data, and also enabling easy sharing and also analysis. Another method may be to implement AI-driven data and also validate validation, and cleaning processes to ensure accurate and also reliable decision-making data. And then another method will be to use machine learning model to analyze maybe historical and also real-time data for patient, so which needs prediction and also treatment recommendation. And another method can be to analyze the patient history, lifestyle, and also genetic information to provide personalized treatment recommendation and also the preventative measures. So how do you maintain data quality and also decision-making process? So now to answer your question, so to maintain data quality and decision-making accuracy, you need to have a continuous data monitoring and validation system. Yeah. So technology, maybe, the approach maybe to deploy AI tools to monitor the data entry and also usage, and also flagging any anomalies and also ensuring adhere to quality standards. So another method will be to implement robust data governance framework, maybe. Okay, so approach to establish a comprehensive data governance, maybe policies in defining the data standards and the quality metric as well, and also the management accountability. And maybe ensuring security and privacy are also another approach that you can use. Okay, so because in AI technology, they can actually detect anomalies in network. All right, even in network traffic as well, and analyzes user behavior and also automates threat responses and also to safeguard the data. So these are maybe some of the recommendation that can be actually used to maintain data quality and also decision-making accuracy. And I hope that's answered the question. So I'll move on to the next question. Okay, this question is asking about, can you explain that AI can empowering personalized nutrition? One of the example there is smart nutrition planning based on individual health data. So my question is there some risk like misinformation or dangerous diet practice if we use AI tool for manage our nutrition or healthy diet? Yes, I like this question. It is very interesting to actually explore this. Okay, yes, there are actually potential risks, okay, associated with using AI tools for managing nutrition and healthy diets. So while artificial intelligence has the potential to provide high quality personalized or effective dietary recommendation, it is also carries risk. Okay, so that needs to be carefully managed. So to avoid misinformation or dangerous diet practices provided by the AI. So here are some of the risks and also strategies to mitigate this concern. So maybe a risk of using AI for nutrition management. So misinformation and inaccuracy recommendation. The risk AI system may provide the incorrect or misleading dietary. So you have to follow following the inaccurate recommendation. It can lead to nutrition deficiencies. Okay. So these are some of the risks. And then another risk is over-reliance. So we tend to sometimes over-reliance to AI without professional guidance. So this can actually pose risk to nutritional of an individual. And another area of concern is data privacy and security. Okay, so the collection and also processing of personal health data by AI tool can actually pose privacy risk, okay, of data if not properly secured. And some maybe bias in the AI algorithms. All right. So this can be a risk as well. So because AI model may reflect biasness present in the training data. Okay, so leading to recommendation that they are may not be suitable. Okay, for all demographic groups. All right, and then maybe lack of regulation and standard. All right. So in relation to this, the risk may be the absence of standards in terms of regulation and guidelines for AI-based nutrition tools that can lead to variable in the quality and also reliability of information given to the patient. And I hope that answered the question, yeah? Okay, so I'm not sure whether you're asking about, some of the and AI, what are the strategies? What are the strategies? So maybe in order to mitigate the risk, so maybe you can incorporate human oversight. So this is very important. We only use AI to actually assist, not to fully, rely on them. So incorporate human oversights. So ensure that AI tool for nutrition management are used in conjunction with professional guidance, all right, from dietitian, nutritionists, and also healthcare providers. So this will actually help assist in terms of, to ensure that, information provided to the patient is accurate. And then the algorithm needs to be enhanced, or the transparency and also validation. So maybe you need to develop a transparency AI algorithm with clear documentation of data. All right, data sources, methodology, and also you need to also highlight what are the limitations. Yeah, and maybe you need to address the algorithm biases. For example, use diverse data set, okay, for training AI models, and involve experts in, nutrition and also public health to review and refine the recommendation. So, and lastly, maybe, to mitigate the issues, you can actually, provide a clear disclaimer in terms of, educate the user on the AI limitation. Yeah. So inform the users about the capabilities of the AI and the limitation of the AI tool use, okay, in terms of nutrition management. So this needs to be clear. All right. So educational material that emphasize the importance of professional consultation and also critical evaluation of AI generated recommendation. So maybe by addressing these risks through careful maybe implementation and also regulation, I believe that AI tools can be safely used, to enhance personalized nutrition and also planning and support dietary practices. I hope I answer all the questions from the audiences. Thank you very much.
Thank you very much, Dr. Sarena, for your answer. And now we have a participant who would like to ask question directly. Please introduce your name before asking. Okay.
Hello, Assalamualaikum. Good morning, Dr. Sarena.
Good morning. Waalaikumsalam.
Hello, good morning. My name is Fia. I'm from Universitas Dr. Subandi, and I would like to ask you a question. And first of all, thank you very much for your insightful presentation. It is very interesting, especially for me, whose department is from the maternal and child department in nursing. So I would like to ask you about your previous experience. Based on your previous experience, the AI has been used previously, right? So is there any real collaboration while handling the nutrition or maybe postpartum stress in mother? For example, maybe there is an AI that collaborating the system to the hospital, so they will have a warning or maybe a significant system that will help the person directly, because at some point by using the telemedicine, sometimes we just typing the chat and get the answer from the healthcare worker, but do not have a direct involvement with the hospital. Thank you very much.
Thank you very much. It's good to have someone here from the maternity department area, yeah. So which I can actually relate and share this information with you. Now, in relation to your question, in Brunei, from my experience, we, as I have shared earlier, in my presentation, that in Brunei we use BruHealth. So, when your question is there any a real time advice? Is it that the patient can get information
Yes.
through AI? Okay.
Yes.
So yes, the current AI technologies that we have through health, we have been actually using for a couple of years already. So in relation to midwifery, when women seek medical help or attention, what we have is in the system is for them to access the what you call this schedule appointment. So in that system, they can actually log in, what are their issues and the appointment that they actually wanted to go to. So meaning to say, for example, if they have like issues with postnatal complication, like maybe breastfeeding issues, yeah, or breast engorgement. So what they need is they log in to the BruHealth system, and there is the consultation area where they can make a scheduled appointment to meet the healthcare providers. Okay, but that is the only system that we have in place. However, and they can once the appointment has been scheduled, and then they will go to the clinic to have the consultation. But in relation to AI technologies, a direct consultation is only available during the COVID-19, yeah, where you can't actually access physically meet the healthcare professional. So only during that time, COVID-19 pandemic, AI is actually being used in terms of like teleconferencing, they call it. So only if that individual have a very what you call this is experiencing complication. So that's the only time that AI technology has been used in terms of while not meeting the healthcare professional physically, but using a teleconferencing for consultation purposes. I hope that answer your question. That is the only the experience that we have that I actually encountered in Brunei, using an AI technologies, using BruHealth. I hope that answer your questions.
Yes, that answered my question. Thank you very much
Yeah.
for the example, because in Indonesia we still have developing the system. It's kind of new, so we need a lot more knowledge from the about. Thank
Yeah.
you.
Thank you.
Okay. Are there any more questions, maybe? Okay, Mr. Ian. Mr. Ian, you have a question? Mr. Ian Napitupulu. Hello, Miss Ian? Mr. Ian? Do you hear my voice? Okay. Maybe Miss Ulfia, any question again?
May I have another question, Miss Sydney?
Okay, please.
Okay, thank you so much for your time. I would like to ask a question to Miss Annie. So it is very, very interesting combination between the traditional medicine, especially from the China one. So I have a simple question actually, because in Indonesia we have still difficulties to combining the holistic traditional medicine and the modern one. In your previous experience in your country, how the nurses or maybe the healthcare professional combine the traditional holistic care with the modern one? Do they need to have a certain degree, or maybe do they need have a certain classification to do the traditional medicine? Because it currently new things that developing in our uh, country actually. Thank you.
Okay, thank you for your questions. Actually, in Malaysia, I think the rules and regulations of TCM is similar, I think, in Indonesia also. So in Malaysia, like for me, I need to go through the Bachelor of TCM in order to get my practice license through the Ministry of Health. Okay, so for your case, if let's say you are a nurse, registered nurse, okay, and if you want to like perform the acupuncture, I think the most important is you need to make sure that the acupuncture practice in clinical is like legal and also it's recognized. And of course, you need to go through the studies. At least you have to get the Bachelor of TCM degree in order to get the license to practice the treatments, acupuncture. So I believe it is a very new things in Indonesia, right? But in Malaysia, we have two different disciplines. So for us, I am a TCM practitioner registered under Kementerian Kesehatan Malaysia. So what can I do only on the TCM treatments? I cannot perform any related Western medicines, including prescribed Western medicine, herbs, drugs. Okay, so this is the different things. And for your case, I think, yeah, it's very interesting. So currently I have never encountered any like nurses to perform TCM treatments, but in China, yes, some of them are interested in learning TCM like treatments, anything. So they will pursue the TCM also, the TCM courses in some universities or institutions. Okay, so different countries will have different laws and regulations. So this one have to like check and double check about the law and regulation in particular countries. Okay, I hope that I got answer your questions.
Okay, thank you so much, Miss Annie, for the answer. It's a wonderful experience, and we hope that we will have a chance to do the same here. Thank you.
Yeah, of course. Thank you so much.
Okay, thank you to all the speakers and for the answer and presentation. And ladies and gentlemen, the conclusion of our discussion today will be presented by Mrs. Suli.
Okay. Please allow me to present the conclusion of this first session. The conclusion of this first topic in this session are artificial intelligence has demonstrated immense potential to revolutionize healthcare by enhancing disease detection and diagnosis, personalization treatment plan, streamlining clinical workflow, and accelerating medical research. Innovation in artificial intelligence-driven predictive analytics, virtual health assistant, and remote patient monitoring are already improving patient care and operational efficiency. For the second topic, the conclusion are, well, artificial intelligence offers valuable tools that can enhance midwifery care by improving accuracy, efficiency, and personalization. It connects It cannot replace the essential human aspect of midwifery. The emotional support, cultural sensitivity, and personalized interaction provided by midwives are crucial component of holistic care. And from the last topic, we can conclude that TCM aims to restore the balance in body, mind, and spirit, adhering to scientific treatment principle and individualized treatment plan can achieve good therapeutic effect. A patient and their family should cooperate closely and persistent patiently to achieve a successful recovery. Thank you very much.
Okay. Thank you, Mrs. Suli. And ladies and gentlemen, the next agenda is the awarding of certificates of appreciation to our speakers. Firstly, the certificate of appreciation is awarded to Dr. Sarina binti Haji Hashim. Yeah, thank you, Dr. Hasan. And secondly, our thanks and appreciation are given to Miss Annie Lim Jianting. Thank you so much, Miss Annie.
Thank you so much.
Okay, ladies and gentlemen, finally we come to the end of the presentation. As we conclude today's session, I would like to thank to all our speakers, Professor Nudin, Dr. Sarina, and Miss Annie. Thank you very much for your presence today. Hopefully it can bring benefits to the advancement of health science. And also I would like to thank to all participants for their active engagement and contribution. Have a great afternoon and wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Thank you.
Thank you, everyone.
Thank you to the all speakers and moderator. Our first plenary session of the second Universitas Dr. Subandi International Conference on Health Sciences has now completed. Dear ladies and gentlemen, we will have a 30-minute break to allow to the Muslim to have two prayers, and also all of you to have lunch. Please all participants return to the conference room at 12:45 p.m. Thank you and enjoy the break time.
speak to somebody. Really?
Cek cek. Cek cek cek.
Hello, can you hear me? Cek. Tes. Ini tak suara saya. Tes 1 2. Tes 1 2 tes. 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 Waalaikumsalam. Ya, gimana Pak? Oh gitu. Oh oke oke ya. Tapi suara saya udah masuk ya? Oh ya, oke oke.
Ladies and gentlemen, welcome back to the conference. And the next agenda will be started. On the second plenary session, we will have two speakers. The first speaker for this session is the Honorable Mr. Ferry Effendi, Master of Science, PhD, from Universitas Airlangga, Indonesia, who will talk about the potential for artificial intelligence in healthcare in Indonesia. The second speaker is the Honorable Dr. Hengki Ishawan Mulaidilai from UCMI, Malaysia, and we talk about molecular detection of current infection. This session will be guided by Mrs. Trisna Pangestuning Tias, Master of Midwifery as moderator, and also Mrs. Emi Elia, Master of Nursing as secretary. To moderator and secretary, we invite you on the stage.
Thank you for the time. The honorable speakers, distinguished guests, participants, ladies and gentlemen, good afternoon to you all. Assalamualaikum warahmatullahi wabarakatuh. This session will take about 3 hours. In this first session, we all have our outstanding presentation from our prominent speaker, who are Mr. Ferry Effendi, Magister Science, PhD from Universitas Airlangga, Indonesia. Hello, Mr. Ferry Effendi, are you here?
Yeah, I'm here.
Okay, good. The speaker will be given 16 minutes for each speaker, then the question and answer in the end of the plenary session. For the audience, the participant, you may type your question in the Q&A section, or you may raise hand using raise hand button if you want to ask the question directly to the speaker. Okay, without further ado, please welcome Mr. Ferry Effendi, Magister Science, PhD, from Universitas Airlangga, Indonesia, who will deliver the presentation entitled The Potential for Artificial Intelligence in Healthcare in Indonesia. Before Mr. Ferry Effendi present, I will read the curriculum vitae. Mr.
Sorry, I cannot hear the voice.
Okay, Mr. Ferry Effendi, Magister Science, Education PhD from National Cheng Kung University, Secretary in Institute for Innovation, Journal Development, Publishing and Intellectual Property Rights, Universitas Airlangga, Indonesia, lecturer in Faculty of Nursing, UNER, and also lecturer in School of Nursing and Midwifery, Lathrop University, Australia. Mr. Ferry Effendi also editor-in-chief Scopus Indexed Journal, Journal Nurse, which is Q3, managing in research in 2023, funded by Catalyst Australia, JETRO Japan, and GTZ Germany. Now, please welcome Mr. Ferry Effendi. Hello, Mr. Ferry Effendi.
Yeah, I'm here.
Okay, the Zoom is yours.
Yeah, thank you. But firstly, can you please help to give me permission on the video because I cannot start my video.
Oh, okay.
Yeah, hello. Yeah. Okay, yeah. I think now is on, and can you please also help me share my PPT?
Oh, okay.
Yeah, perfect. Thank you so much for the moderator. And yeah, Assalamualaikum warahmatullahi wabarakatuh. Good afternoon, ladies and gentlemen. Welcome to the second UDS International Conference on Health Sciences with the topic Transforming the Future of Healthcare Through Potential Artificial Intelligence. Okay, yeah, I'm Ferry from Universitas Airlangga Surabaya, and it is my honor to share with all of you regarding what is the current situation, yeah, and how is the potential for the artificial intelligence, especially in the healthcare industry in Indonesia. So we are going to explore how AI can transform our healthcare system, what are the types of AI technologies available, their application benefit, and also the challenges that we face. So let us begin by understanding the fundamental concept and also the current landscape of AI in healthcare. Yeah. Just next, please. Yeah, okay. Yeah, I think the moderator already read my CV, yeah. So everyone who would like to contact with me, you can try to contact me through email, yeah. So yeah, back to our slide, yeah. Artificial intelligence is deeply embedded in our daily life. From virtual assistant, like maybe every day you already using, yeah, like Google Assistant, yeah, Siri, Alexa, yeah, and the others, yeah, especially to advanced system, yeah, that being used in our everyday life, yeah. And I believe that the AI technologies are so pervasive, yeah, and also being and embedded, yeah, in our everyday life, yeah. But the question is, can we imagine our life without AI, especially in critical sectors like uh, healthcare, yeah. Also, AI's ability to process large volume of data and learn from it makes it is indispensable, yeah, in improving healthcare outcome, yeah. And as you may understand that a lot of data, especially the big data around us, yeah. And I think it is really difficult, really hard if we want to analyze the data manually. So still, we need a strategy, we need a best practice how to analyze, yeah, and also to ensure that all the data around us also having a benefit for us. So AI can help us, can assist us in these matters. Yeah. Okay, next. Yeah, AI itself, yeah, refers or defined as a machine capable of performing tasks that typically require human intelligence. So, in the simple ways that AI existent also because the human always thinking, human always developing, and also human always creating something innovative. Yeah. And these tasks include like self-learning, yeah, natural language processing, yeah, voice, image, video recognition, planning, and optimization, yeah. Also robotics and intelligent systems, yeah. So AI potential lies in its ability to augment, yeah, human capabilities and also enhance decision-making process, yeah, in healthcare. Next. Yeah, this is types of AI around us. Yeah, there are various type of AI. Yeah, it's serving different purpose. Yeah, like also what so called NLP, what so called machine learning. Yeah, speech. Yeah, computer vision, and then expert system. Yeah, and etc. Yeah, I think there are abundant types of AI that also being integrated, yeah, and also being used, yeah, in our human daily life, yeah. Next. Yeah, if we can take a look in our profession, yeah, nursing, yeah, especially actually the use of AI, yeah, in nursing industries, yeah, continues to increase year after years. And if we take a look at the published studies, yeah, we can look back in 1993, one of the studies, yeah, published by Rose M. Harvey, yeah, in the International Journal of Nursing Technologies and Classification, yeah, we can see that actually the application of neural networks, yeah, one types of AI, yeah, also was starting, yeah, in 1993, yeah, by using a computer for helping the nurses to diagnose the patient. Yeah, so when the nurse want to write or to develop the nursing diagnosis, yeah, it was already assisted by the computers. Yeah, and I think this is one of the revolution, yeah, happening in the nursing informatics area, and we believe that this kind of capabilities, yeah, could enhance not only the nurses' quality of care, yeah, but also have a greater impact to the patient, yeah, and also to the community itself, yeah. So for those of you who are interested to read and learn a lot about the nursing diagnosis by computer at the first time of the development, yeah, you may take a look at this journal, yeah, International Journal of Nursing Technologies and Classification, yeah, IGNTC, yeah. Okay, next. Yeah. Also, you may refer to the one published article. Actually, this is a systematic review, yeah, and the title is also interesting, yeah, regarding the artificial intelligence in nursing and midwifery. Yeah, it was published in 2022. Yeah, and yeah, actually we can see that the several development, yeah, and also several adoption of AI in healthcare. Yeah, it can assist the human, yeah, or assist nursing workforce or healthcare workforce, especially in the growing complexity and amount of medical data, yeah, because you may aware that everyday nurses also facing the big data, yeah, the patient data, the instrument data, yeah, and yeah, many things data around us, yeah, and also we need something, yeah, we need tools, yeah, to analyze and also inform the best option for our daily activities. Yeah, and the other consideration is we know that we are getting old. Yeah, yeah, everybody. Yeah, so the aging population. Yeah, as the global population ages. Yeah, AI can help manage chronic disease. Yeah, and also improve the elderly care. Yeah, in various settings. Yeah, so this is really impressive to see the development of AI, especially in aging area. Also, we can see that there are emerging global issues, yeah, because AI offer innovative solutions to tackle pandemics and other global health crises, and also another challenge may be regarding the human resources for health availability, yeah, because we know that this sometimes cannot fulfilled by AI, yeah, but rather than we should rely on the real human workforce, yeah. So this is you can see all of the compiling study, yeah, on the Journal of Clinical Nursing, yeah. It was published in 2022. Yeah, next please. Yeah, yeah. Actually, the review quite interesting, yeah, because the review question having three questions. Yeah, first is, are nurses involved in the development delivery or use of AI in healthcare, and if so, to what extent? Yeah, that's the first question. And then the second is, how is AI being employed, yeah, across the nursing profession in terms of clinical practice, education, research, and policy? Yeah, I think this is also interesting. Yeah. And the third research question is, what are the benefit, limitation, and risks of AI in nursing? Yeah. So this is the review question, yeah, from the systematic review. And the finding quite interesting, yeah, if you can see on the slide, yeah. So first is, you can see that nurses' involvement in AI actually quite active, yeah. It shows that 41 studies, or 29%, yeah, nurses led the study, yeah. So it means that from the 41 studies, actually the corresponding authors are nurses itself, yeah. And then active in clinical research, yeah, it was 6.42%, yeah, nurse participated by providing clinical expertise, yeah, and also some few, yeah, few of the studies is passive, yeah, 15% nurses were involved as study participant, and no involvement around 48.57%. So this is also challenging, yeah, because we need to do something, yeah, on nurses' involvement in AI, especially for the business process, yeah, for the activities that assist nurses to achieve the best outcome, yeah, the positive outcome for the patient, yeah. And what about the AI in the nursing profession? Yeah, 82%, yeah, on patient care, yeah, especially in the critical care, yeah, general nursing care falls, yeah, it would be such early warning system, yeah, for the falling incident, yeah, especially among elder people, yeah. Also general nursing care, wound care, infection, yeah, and yeah, many more, yeah. So we can see that actually it is widely used, yeah, in the nursing profession, yeah. And also 15% on administration and management, and 3% in nursing education, yeah. And what about the potential benefits of AI? Yeah, as we can see that the potential benefit is 87%, yeah, studies reported some potential benefits, yeah. 12% reported actual benefits, yeah, with the variable quality, and also we can see that increased accuracy in predicting health, employment, education, and other outcomes, yeah, related to the patient, yeah. And what are the limitations of AI? Many studies, yeah, also identifying that the quality of the data set, yeah. So again, the data quality being challenged, yeah. Also other AI techniques, yeah, could yield different result, yeah. So this is the challenge on the validity, yeah, especially regarding the use of different AI or tools, and also retrospective data, yeah, may limit the future predictive ability. And finally, a few, yeah, a professional needs to interpret result for clinical utility. Yeah, this is one of the limitation. And the risk is, you can see that the risk varies, yeah. It could be that nurses lack of knowledge, yeah, and skill, yeah. Also perception that AI could replace nurses, yeah, or decision making, yeah, and so on. Also lack of transparency, yeah, in how some AI algorithm work, and the cost and benefit, yeah, because you may aware that, yeah, actually AI also need greater energy, yeah, need more energy to run all of the algorithm, yeah. So this is the finding, yeah, from the systematic review that published in 2022 from Journal of Clinical Nursing. Yeah, next. Yeah. So if we can see that the AI application, yeah, in healthcare are diverse and impactful, yeah. So we can see that in the market, actually, we can see in the US AI in healthcare market, yeah, and also global generative AI in healthcare market, yeah, there is a continuous to increase, yeah, especially the demand, yeah, from various industry, not only from the health sector, but also from another sector or market, yeah, telling us that the growing is really tremendous, yeah, and also having a big demand, yeah, especially if we want to go further, yeah, especially in the future, we may see a lot of prevention strategies, yeah, diagnostic and treatment recommendation, yeah, especially to monitor the patient status and development, and yeah, etc. Yeah, I think the market is there, and also the demand also is there. Yeah, next. Yeah, next slide, please. Yeah, okay. Yeah, so this is the AI adoption, yeah, worldwide 2022 by industry and function, yeah. I'm not sure whether you can see the table clearly, yeah, but yeah, actually, it is how is the AI adoption in the various sectors, yeah, from human resources, yeah, manufacturing, yeah, marketing and sales, yeah, risk, strategy and corporate finance, and also the supply chain management, yeah. So the healthcare industry is we can see that this is at the front yeah, of many AI technologies, yeah, with around a fifth of organization already having used it for at least 2 years. Yeah, you can see that the healthcare or pharma, yeah, it is actually the leading industry that use AI quite often. Yeah. Next. Yeah. This is the drivers, yeah, affecting AI in the healthcare market, yeah. So I think I already mentioned, yeah, previously that actually the demand, yeah, from our contextual situation, yeah, especially not only in the global south, yeah, but also in the developed countries, yeah, is really high, yeah, and also we can see recently that all of the drivers, yeah, around us, yeah, especially when we want to go into the healthcare market, yeah, and also we can see that yeah, after the COVID-19 pandemic, yeah, actually the disruption going on, yeah, and the disruptive activities, yeah, disruptive idea, yeah, still ongoing, yeah, and it is also really closely related to the healthcare industries. Yeah, next. Yeah. So if we go back to the concept again, yeah, especially how machine learning and also the neural network use, yeah, in healthcare sector, yeah, yeah, it is actually the evolving industry, yeah, and we can see a lot of innovation, yeah, a lot of creativity, and also a lot of discussion, yeah, going on how the industry keep progressing, yeah, keep evolving, yeah, and also how they can use any types of tool, yeah, starting from deep learning, yeah, neural network, yeah, machine learning, and also the AI, yeah, especially to help the healthcare workforce, yeah, on the certain situation, yeah, in the hospital or in the community setting. Yeah. Next, please. Yeah, this is the application of AI in various domain of the healthcare. Yeah, you can see that actually the range from patient ecosystem, yeah, clinical settings, yeah, extended clinical setting, and also the provider ecosystem. Yeah, this is related to all of the variables, yeah, all of the situation around us, yeah, among us, yeah. especially how this is shaped the demographic situation, yeah, genomic, environmental factors, yeah, and also other related to this ecosystem. And yeah, to develop or to improve the ecosystem of AI, yeah, this is also need a comprehensive approach, yeah, especially not only from the government but also from any stakeholders, yeah, that involve or engage in the potential benefit of AI in healthcare industry. Yeah, next. Yeah, yeah, we can see that AI or machine learning, yeah, based software as medical device, or we call it SAMD, yeah, it is also yeah, going around among us, yeah, and the SAMD refers to the software that use AI and machine learning algorithm to provide medical insight. Yeah, so actually it use any kind of data. Yeah, and the data could give some hints. Yeah, some insight to the health workforce. And this device, yeah, or these tools, yeah, analyze real-time data. Yeah, helping healthcare professional in making accurate and timely decision. Yeah, for example, include apps that monitor health, yeah, detect early sign of disease and assist in remote patient management. Yeah, so I think now we also seen that our smartwatch, yeah, our smartphone, yeah, yeah, everything around us, yeah, can easily being monitored for us, yeah, especially on how many minutes is our pulse, yeah, our ECG, yeah, and yeah, many other things, especially the blood pressure and other indicators related to our health status, yeah, and they can analyze, yeah, all of the health status, yeah, of the human, yeah, by integrating or by connecting, yeah, with all of the IoT around us, yeah, Internet of Things or device that available on that used by a human every day. Yeah, so yeah, this is really a tremendous impact, yeah, or a positive impact to see that the SAMD also happening right now. Yeah, next. Yeah, this kind of technologies in AI based healthcare actually a lot. Yeah, but yeah, we can I can give you some example. Yeah, especially in the computer vision, in the NLP, in the robotic. Yeah, and also in the planning, scheduling. Yeah, and optimization. Yeah, or in the recommended system. Yeah, a lot of things happen. Yeah. Globally, but we can see also happen in Indonesia. Yeah, next year. Next slide. Yeah. So this is the potential benefit of AI in healthcare. First is improve diagnostic accuracy. Yeah, actually AI system can detect diseases. Yeah, in the early phase and also with high precision. Yeah, you can imagine if you use the smart watch. Yeah, and every day it keeps or it records all your activities, yeah, all your stress data or sleep data, heartbeat data, yeah, everything, yeah. So it's also can give you some early warning, some insight that yeah, if there are any situation that you need to be concerned, yeah, I think nowadays is really convenient for us, yeah. And then second is efficiency in hospital and clinic management, yeah. AI optimizes workflows, yeah, reduce administrative burden, yeah, and also enhance resource allocation, yeah. And yeah, we can see now if the nurse would like to write some nursing record, yeah, or everything in the hospital, yeah, they just need to do it electronically, yeah. So yeah, it can save time, yeah, especially for the healthcare workforce, yeah. And then the third is increase accessibility to healthcare services. Yeah. AI enables like telemedicine, yeah, or maybe in the future there will be development on telenursing, yeah, also remote monitoring, yeah. So it can making healthcare more accessible, especially in rural and remote areas of Indonesia, yeah. So I think these three benefits can lead to better health outcome, yeah, lower cost, and also more equitable healthcare delivery. Next. And what are the challenges and barriers? Yeah, yeah. Despite its potential, yeah, AI in healthcare face several challenges and barriers. First is ethical and data privacy issues. Yeah, so ensuring patient data is secure and used ethically is paramount here. And then the second is skill and knowledge gap. Yeah, healthcare professional need training to work effectively with AI technology. And then the third is the technological infrastructure limitation. Yeah, adequate infrastructure is required to support AI implementation. And lastly is yeah, we need regulation. Yeah, we need policy in place, especially regulatory frameworks. Yeah, must keep pace. Yeah, with technological advancement to ensure safety and efficacy. Yeah, so. Yeah, this is the some of challenges that crucial for the successful integration of AI in healthcare. Yeah, sometimes when we have witnessed the revolution in our society, yeah, let's say the story of Gojek, yeah, Grab around us, yeah, sometimes they are available or happening, yeah, around us, but then the government or the stakeholders, yeah, starting to talk about it and also to create some regulation and some policy in place. Yeah, so this is kind of two ways. Yeah, whether the policy and regulation is from the government itself, yeah, or maybe somehow the the catalyst, yeah, is also coming out from the players, yeah, on the field. Yeah, so it is the situational context, yeah, happening around us. Yeah. Okay, next. Yeah, the advancement in AI health application in healthcare in Indonesia, yeah, could lead to the way in AI adoption. Yeah, for example, in some hospital, yeah, also we do have apps, yeah, like yeah, Hello Doc, Hello Doctor, yeah, and also yeah, many more. Yeah, so I think this is also giving hints that although we don't really accept the AI around us, but yeah, the progressing, yeah, the growing demand, yeah, of AI also keep facing, yeah, and we need to be sure that we don't really left behind, yeah, in the issue of the AI application, yeah, especially happening in healthcare industry. Yeah. Next, please. Yeah. Also, yeah, a lot of advancement, yeah, in AI application in healthcare industry in Indonesia. Yeah, some network hospital, yeah, like Siloam and many others. Yeah, they also using chatbot, yeah, to enhance patient care and treatment outcome. Yeah, and also, yeah, some already using more advanced, especially in the treatment treatment intervention. Yeah, how is the AI in radiology, yeah, for pre-screening patient, yeah, streamlining patient registration and also scheduling, yeah, all are doing simultaneously, yeah, between traditional and also the modern one. Yeah. Next. Yeah. So this is the future of AI in healthcare in Indonesia. Yeah. First is from the data analysis view of point. Yeah, we can see that AI process large health data set, yeah, for accurate diagnosis and personalized treatment. And also from the point of view digital health platform, yeah, AI integration enhance accessibility, especially in the area that need need a focus, or need some intervention, let's say in the rural and remote areas of Indonesia that somehow it is difficult to retain or to place any health personnel, because of many issues, maybe security issue, maybe lack of infrastructure and everything, and then also the third is chatbots and virtual assistant, it is really massive around us. We can see AI chatbot manage medical queries, and also initial diagnosis, and allowing healthcare personnel to focus on complex tasks. And the fourth one is about the predictive analytics. AI predict patient outcome and identify high-risk cases for proactive care, especially when we want to go further into the genomic areas, it's really need some precise, or some activities that demand more accuracy, And the last is about the disease detection, So AI detect early sign of disease like dementia, tuberculosis, improving outcome and reducing cost. So actually, this advancement, will continue to transform healthcare delivery and management, especially in Indonesia. Next. This is about the regulatory frameworks and also workforce development. So to ensure the safe and effective use of AI in healthcare, Indonesia needs first is a strong regulatory framework, to protect data privacy, security, and also prevent AI malpractice. And then the second is workforce development initiative to train healthcare professionals in using AI technologies effectively. And then the third is continued investment in AI research and development to drive innovation and improve healthcare services. I think by addressing this need, Indonesia can maximize the benefit of AI in healthcare and improve overall health Indonesian outcome. Next. So this is actually the last two slides from me. We can see that artificial intelligence is not a substitute for human intelligence. It is actually or being a tool to assist or to help a human creativity and also ingenuity. So we have witnessed market growth and also key players in AI industry in Indonesia, and we are hoping that how AI can enhance patient care, streamline industries, and also drive innovation and in healthcare. It's really a great hope for everyone, especially in the view of nursing workforce. Okay, next. Okay, I think that's all from me. Thank you for your attention. I hope this presentation has provided valuable insight into the potential AI in healthcare in Indonesia, and I look forward to your question and productive discussion on this exciting topic. And I believe that we can explore how AI can transform healthcare and improve the health development for all Indonesians. Thank you for your attention. Wassalamualaikum warahmatullahi wabarakatuh. I pass on the time to the MC.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you so much, Mr. Ferry, for the informative, interesting, and useful presentation. Please stay in the Zoom because we will have Q&A at the end of the plenary session. For the next speaker, the honorable speaker, distinguished guest participant, ladies and gentlemen, in this second session, we all have our outstanding presentation from our prominent speaker, who are Dr. Hengki Isyawan Mulyadilai from UCMI, Malaysia. Hello, Dr. Hengki Isyawan, are you here?
Hello, can I? Yep.
Yes.
Can you
I
hear
can-
me? Yes.
Yes. Okay, Dr. Hengki will be given 16 minutes, and then the Q&A session after in the end of the plenary session. For the audience, the participant, you may type your question in the Q&A section, and I will read the question for you, or you may raise hand using the raise hand button if you want to ask the question directly to the speaker. Okay, without further ado, please welcome Dr. Hengki Isyawan Mulyadilai from UCMI, Malaysia, who will deliver the presentation entitled Molecular Detection of Current Infection. Before Dr. Hengki Isyawan present, I will read the curriculum vitae. Dr. Hengki Isyawan Mulyadilai from UCMI, Senior Lecturer, Faculty of Health Science, Director Research and Management Center. Dr. Hengki Isyawan, academic journey includes PhD in Pharmacology from National Yang Mingqiao Tung University, Taipei, Taiwan. Areas of expertise, generative medicine and stem cell therapy, tissue engineering, clinical health sciences, cell biology, and molecular genetics. Now please welcome Dr. Hengki Isyawan Mulyadilai. Dr. Hengki Isyawan, the Zoom is yours.
Okay, so thank you. So I hope everyone can listen to me, right? The voice. Is it clear? Okay, so Assalamualaikum and very good afternoon, everyone. So I'm quite honored to be today and would like to express my gratitude to several individuals who make this event quite possible as well. So first and foremost, I would like to extend my sincere thanks to the rectors of the Universitas of Dr. Sobandi, Mr. Andi Eka Pranata, for his supports and leadership in organizing these significant events. And I also like to acknowledge the Deans of the Faculty of Health Sciences, Ms. Ain Nurjana, for the dedications and hard work in promoting the field of the health sciences and the efforts of bringing us together today. And I would also like to thank for the community, the entire community, for the international webinar for the Faculty of Health Sciences, Universitas Dr. Sobandi, and also very for their well plannings and coordination as well. So your effort is truly make this webinar is a success as well. So I'm deeply honored to be the invited speaker for today, and I'm quite excited as well to share my insight or journey to all of us as well. Okay, so within these 60 minutes, I think I will try to utilize to explore the critical rules of the molecular detections techniques that play in the diagnostic infections, particularly in our hospital settings. So these molecular detections have brought revolutions in how we can be identify and manage to identify and manage the infection disease as well. So by offering unmatched accuracy and speed, we able to cover various techniques, the developments and the application in detecting infections like malaria, dengue, influenza, and most popular currently is about the SARS-CoV cases as well. So can I have my slide play on the... Okay, do I have my slide on the screen?
Dr. Henry. Dr.
Yep.
Henry,
Yes.
please. Yeah.
Okay, so currently it's the first page, right? Regarding to objective. Sorry, because I couldn't see my slide.
We on process, Doctor.
Oh, okay. So I think today I'm going to talk about the molecular detections on the current infections, whereby I would like to touch a bit of the advanced method and the technique as well. And of course, I would like to highlight several techniques that been what we call as a gold standard in the hospital setting as well for detections of the molecular in the current infection diseases. So while waiting for my first slide, I think the first slide is about the objective. So our objective for today, I cover up for these threefold. Okay, the first objective I would like to cover is to understand the various molecular detections techniques that is available. And then the second one is to reveal the significant developments of the molecular diagnostics over this year. Okay, and also to discuss the specific cases studies that involve some infections, for example, like COVID, SARS-CoV, because I think that is the most recent pandemic cases that hit most of the country throughout the world as well. So then I think my second slide, if I can, I'm not sure if, yeah, okay. So I think you can go to the second one. Okay, this one is, yeah. So today we're going to talk about objective I already covered up just now. Okay, about the three different objectives that I would like to cover up for today. Okay, to understand the various molecular techniques that we have, and also to review some of the significant developments of techniques. Okay, later on I will cover up a few of the methods, molecular methods that we have throughout this year, starting from 1990s, early of 1990s to current year as well. Okay, and then I will pick some of the case studies, for example, like SARS-CoV-19, because it's a quite famous diseases that happens pandemically. Okay, next slide. Okay, so today we're going to talk about what is the molecular detections, and I believe that most of us already know what is molecular technique as well. Okay, so molecular detections involve identifying the pathogens by detecting their genetic material. So, for example, like the DNA or the RNA as well. Okay, this is a very famous things that we are looking at on the genetic material. Okay, so this method is highly precise. Okay, that allow us to pinpoint the exact causes of an infection as well. So which is very important for the effective treatments and the management of the disease as well. Okay, so in next slide, I'm going to talk about the hospital setting as well. So in hospital setting, I think the terms of rules that we need to remember is the rapid. Okay, and rapids and accuracy diagnostics on the molecular detections technique as well is very important. Okay, because we want it to have a fast diagnosis and to give a better treatment towards the patient as well. So when you have a better rapid and accurate diagnosis, we know what kind of diseases that we have, the bacteria or the virus infections. Okay, so it can lead to a better patient's management as well and the treatments. So it also significantly reduce the spread of the infection disease within the healthcare facilities. Why? Is because just imagine if, let's say, a patient, they go into the hospital. For example, like SARS-CoV cases back then, we know that this SARS-CoV diseases is basically due to the airborne disease. So just imagine when it first hit a country without knowing that there's a SARS-CoV diseases. So while we are waiting for the particular diagnosis on the viruses, so it can spread towards people as well, right? So if let's say we have a better diagnosis and we know that it's a viruses, so we can manage the patients by isolating the patients, and it also can reduce the spread of the infection diseases as well. So that's why I was saying that molecular technique is becoming a key for people to have accuracy and rapid testing as well. Okay, so next slide. Okay, in this slide, I'm going to talk about some of the historical perspective, or what we call as old techniques. I'm not going to say it's old because it's still a gold standard technique. Why is it gold standard technique? Because it's still being using currently, and of course, it's accurate. Okay, but we are not going to say 100% accuracy as well. But it's a technique that we've been using. Okay, so I think the most common things that we always use is to culture. If let's say you're talking about microbiology, or we talk about the infection diseases, definitely you cannot run away from culture. Okay, when you're doing culturing, it can consume your time, so time consuming as well. So at least I think if let's say you're doing culture, it need a 24 hours. Okay, and to doing a culture or microbiology, you need a turnaround times. The most shortened time you can give is two days. Okay, but some of us, like hospital setting, we give a longer turnaround times, like basically like five days. Okay, okay, might be some of the hospital setting is better. Okay, so they have given a shorter time, like 3 days. Okay, but more or less, I think the culture time also consume a lot of timing as well. Okay, so once you get a culture, what do you do the next? Microscopic examinations, right? So you have to visualize your pathogens, and then some of it is lack of sensitivity and specificity, because it required the skill of the MLT, or the diagnosis patient as of the diagnosis as well. Okay, so when you time consuming and lack of specificities, you cannot diagnose properly, so it also affected towards your treatment as well. Okay, and then moving forwards, if let's say we already do a culture microscopic examinations, or we know it's a gram negative or gram positive, so then we do a serological examination as well. Okay, so in serological examinations, we try to detect the presence of the antibodies and antigens as well. Okay, so it might not provide an early diagnosis because it's also time consuming as well. Okay, and by traditional method, it often lacks of speed and accuracy. Okay, so that's why we need to utilize the advance of the molecular techniques that currently that we have. So next slide. So in this slide, I'm going to highlight several molecular detections techniques that are commonly used, and I believe most of you guys have already exposed to this kind of technique as well. So I think we can recap some of the techniques, and also I can add in some of the new techniques that we're using for the molecular detection as well for infection diseases. So I think most of the hospital setting have already PCR tech machines. Okay, so PCR back then, the full name we call as a polymerase chain reactions. And then, okay, the following by the second one, what we call as a reverse transcriptation PCR techniques, we call as RT-PCR. So the difference between this technique is that RT-PCR, basically back then, people use it for gene expression studies. Okay, but then during SARS-CoV, this RT-PCR become a very powerful tools, especially for detections because of the RNase virus. Okay, and then we also have one I can say is a very advanced techniques of PCR. We call it as a quantitative PCR. We call it as a qPCR. Okay, the next one is by using next generation sequencing. I think now we have a few generation of sequencing as well. Okay, so later on we will touch a bit of NGS technique, and last but not least, we have one special techniques that we're using, CRISPR-based detection as well. So I think some of us have heard of CRISPR-Cas9, right? So CRISPR-Cas basically we use for gene editings, but it also can be used as a detection method as well. Okay, so people have been utilize this method of CRISPR to have a more specific and more accurate detection as well. Okay, so later on we will try to expose how does we able to use CRISPR methods on the molecular detections in infection diseases as well. okay, other than gene editings. So each of these particular techniques have a very unique features. And of course, we are talking about the advantage on why hospital setting having these PCR machines, or why some of the hospital setting have qPCR, and some of it, if let's say they affords, they will have NGS machines in that particular hospital, right? So, and if let's say you have a better skill, okay, that's why we say a specific application. If let's say you have a special skill, then you can have a CRISPR-based method as well in your hospital setting, okay? But I believe that most of the research center, they are the one who having these CRISPR-based detections compared to the hospital settings. Okay, and I believe most of the big hospital settings only they will have NGS machine because it's a very expensive kind of machine as well. Okay. So next slide, I'm going to give a bit of the timeline, or what we call as a history of a molecular detections at once. Okay, starting from early of 1990, we already start to have these traditional methods on infection diagnosis, and then moving in early of the 1990s, we start to introduce the PCR. So when the PCR come in, they will start to we start to detect using the PCR methods. Okay, and then in the late of 90, we try to improvise our PCR technology so it can have better sensitivity and specificity as well. Okay, and I believe when we talk about PCR, some of you guys have already done a PCR method before. So I think the key of having a PCR, you need to design the primer, right? So the primer is the one that gives you a specificity on the particulars infection disease as well, okay, or what we call as antigens. So in 2000s, early 2000, we start to develops a very powerful tools, what we call as a qPCR. Okay, some of it we call as a real-time PCR, some of it we call as a quantitative PCR methods. So it allowed us to have a quantitative analysis. Why? Because a normal PCR methods, they are more towards qualitative. Qualitative, that means they are looking at the expressions of the genes on the bed. Okay, either the expression is there or no. Okay, so it's yes or no. But then if let's say you have a quantitative analysis, it's more towards a number. So they give you a number exactly that you can see in the real time. In the real life, you can see within one particular hour how much of expressions have been done. Okay, so that's why they call it a real-time PCR as well. So in 2010s, we start to introduce the expensive technique to become a methods that are used for molecular detection as well. So we have NGS, the next generation sequencing, and we also start to utilize the CRISPR technology as well. And I believe back then, when we using CRISPR, people always talked about the gene editing parts, right? But then moving forwards, I think in 2020, when SARS-CoV start to hit, some of the study you can see, Nature paper, they start to have CRISPR technique as well to use it as bacteria detections. Okay. Moving forward to the next slide. Okay. I just going to touch a bit on the PCR because I believe that having a webinar is about sharing the knowledge as well, right? So in early of 1990s, we have the Carrie Mullis. So she's the one who invented these PCR methods. Okay. So in early phase, this PCR method is just to amplify small segmented DNA methods. Okay, whereby we want to amplify small segmented DNA to a detectable level. So in a small volumes, you just imagine if let's say you have one numbers of DNA. So we try to multiply it. When you multiply it, so we're able to detect it. Okay, and this method is very sensitive, high sensitivity and high specificity as well. Why? Just imagine, as I mentioned just now, you have a small volume of DNA and then you start to amplify it. So when you start to amplify it, it have a highest number, biggest numbers, so you can detect it. Okay. So it also works by cycling through a different temperature to denaturations, annealing the primer and extension to a new DNA strand as well. So you can just imagine by using these powerful techniques, on the low numbers of these bacteria or viruses, you can detect it. Okay, because why we amplify the DNA segments. So that is a very powerful techniques that we use it. Okay, next slide. Okay, so I think this is just a normal flow through of identification of particular diseases that we No. So, for example, if let's say a patient's come in with the upper respiratory tract infection, okay, so what the doctor did is that they will collect the nasopharynx specimen collections. Okay, they take the nasal swab, and then they will put in the mediums because they want to contain back the RNA or the DNA itself. Okay, but of course, each of the techniques, if let's say we really look at the methods, they have the flaw as well. Okay, so after that, when we get the swab from the patients, we will do extraction as well. Okay, so over here we need to have a viral RNA extraction kit. Okay, then you can extract the RNA, and also you can perform towards the PCR and electrophoresis as well. So again, as I say, normal method of PCR, they will give you agarose gel methods you have to do, and then you can look at the band as well. Okay, then you look at the intensity of the particular band, if let's say it's presence or absence of the disease as well. Okay, so moving to the next slide. Okay, we have the polymerase chain reactions. Oh, okay, I think this one is the one that I mentioned just now earlier. We have the naturations and the links and extension as well. Okay, so sorry, I forget to change the objective tree into the extension. So this is a three methods that we've been utilizing, and also it serves as a fundamental technique as well for the PCR to amplify your DNA. Okay, next slide. I think just now I'm talking about the PCR. So we are wondering, we are looking at the DNA. What about if let's say it's a viral or what we call as a RNA viruses? Okay, so we can utilize this method, what we call as a reverse transcriptions PCR method as well. In a normal way, we call it as RT-PCR. Okay, so RT-PCR basically we use it to detect RNA virus, whereby it involves converting your RNA, because we know RNA is a single-stranded RNA, right? Single-stranded. So we convert it into a complementary DNA, what we call as a cDNA, by using a reverse transcriptase, and then after we already have a reverse transcriptase, and then we amplify it using the PCR as well. Okay, so this method is very important for diagnosing infection diseases caused by the RNA viruses. For example, the pandemic disease, influenza and SARS-CoV. Okay, so this RT-PCR during that influenza and COVID-19, they are fully utilized, these methods. Okay. So we are combining between the qPCR and some of it at one technique, we also combining qRT-PCR as well. Okay. So moving to the next slide. Okay, just now we already talked about the PCR, the golden standards of molecular techniques. Okay, I think if let's say we talk about molecular, the first thing that you ask around, people already know about PCR, right? Okay, why is because during that I believe in 2020, when the SARS-CoV start to hit pandemic, a lot of people know about PCR. A lot of people know about RNA and DNA itself. Okay, and quite surprisingly, some of the people, even my parent as well, asked me, "Oh, Henki, they talk about the CT value as well." I was quite, wow, how do they know about CT value? So actually, when a disease hit, okay, as a pandemic, actually it's a blessing in disguise as well, because we learn about techniques that we never encountered. For example, like normal people who are no background in medical or health sciences, they start to know about PCR. They start to know about CT value as well. Okay, so it's quite surprisingly. So then they also talk about the qPCR as well. So I believe that during that times, the moment as well, a lot of people about they're asking around, is your hospital setting is using PCR methods or qPCR method? I was like, wow, okay, they even know about the qPCR method as well, because we know when we talk about qPCR, it's fast, okay, because we can look at it as a real time. Okay, that's why during the times, I think a lot of patients have been asking if, let's say, the hospital using what kind of methods, right? So now I'm going to talk or touch a little bit regarding to the qPCR methods. Okay, so qPCR allow for a real-time monitoring of the DNA amplifications, okay, by providing a quantitative data analysis as well. So as I mentioned just now, quantitative, that means they give you a numbers. Okay, if let's say you look through the image of that particular image on your right side, okay, so you can see there is a curve over there, right? Okay, so I believe that people have encountered qPCR. You know that how does a qPCR look like and the data as well to look like, and then you can look at the CT value as well. Okay, so by using qPCR method is a very powerful methods. You can measure your viral loads and also monitor the progressions of the particular infection as well. Is it increasing? Okay, so a little bit regarding to the qPCR methods. Okay, we can look at the fluorescence dye or the props. I believe that everyone know that we have fluorescence dye, for example, like Cybergrid. Okay, and then when we talk about props, you have your TechMan prop as well. Okay, so these props and fluorescence can allow us to have a precise detections and the quantifications of the targeted DNA sequence, and also making the qPCR as a very important in the clinical setting, and especially for detecting the particular diseases as well. Okay, so in next slide, I think back then qPCR, the famous thing is to look at the gene expressions, okay, to quantize analysis of the gene expressions, and also we want to validate the DNA microarray result as well. So real-time PCR, they allows real-time monitoring, as I mentioned, within the particular hours, 1 hours. You can also quantify your DNA amplification as well. So this technique offers several advantage over the traditional PCR methods, whereby they include ability to quantify the amounts of the target DNA in the sample, and it also measure the viral load in the infection as well. So it not only look at the bacteria, it also can look at the bacteria, viruses, and fungus as well. Okay. So the next slide, okay, we look at it is the I'm going to introduce two very powerful tools. We have the NGS and the CRISPR technique as well. So when we talk about NGS, they allow for the high throughput sequencing genetic material. I think NGS, or what we call as a next generation sequencing, is quite a powerful technique as well. They allow for a simultaneously sequencing of the millions of DNA fragments. Okay, that's mean they are not doing one sequencings and the fragmentation as well. So this technique is actually using the molecular diagnostic, whereby they allow comprehensive detections and characterizations of the pathogen as well. So what does I mean by characterizations of pathogens? They include identifications of the novel strain and the mutation as well. Okay, and I believe if let's say you still remember SARS-CoV, okay, they have different strain as well, right? Okay, so when you're using normal PCR, sometimes you're unable to detect when there is a novel genes or novel strains or the mutations that they undergo. But using this NGS methods, you can look at the whole genome sequence, and then you can identify if let's say they have undergo mutation as well. Okay. The second technique that I'm going to introduce is the CRISPR technology as well. So CRISPR technology back then, as I mentioned earlier, is originally known for the gene editing capabilities, but it also have been adapted for the molecular diagnostic method. So this CRISPR-based detection method are highly specific and rapid identifications of the pathogens. They're able to target the genetic material as well. Okay, so I believe that this technology hold a great promise in the future of the molecular diagnostic between this NGS and the CRISPR as well. Okay, so next slide. We look at the next generation sequencing. So I believe if let's say we talk about NGS methods, there is a lot of like things that we can do with this NGS. We know it's a very powerful method as well. Okay, they provide a very high throughput analysis of the pathogens, and also it's able to track down the outbreaks and developing targeted therapy as well. So I believe if let's say you look at the image that we have, next generation sequencing applications, you can able to look at the epigenetic, microRNA, the phenotypes, okay? And also, I can talk about some of the features that you can do by using the NGS as well. So, when we talk about NGS, I think the first people that always look at the study is about the genome sequencing. Okay, so what is genome sequencing by using NGS? So they want to determine if, let's say, the complete DNA sequence of the organism genome as well. So over here, as I mentioned just now earlier, you can look at the SARS-CoV. Okay, you want to study on the genetic variations, you want to identify the disease related to particular genes, or you want to understand the evolutions relationship as well. Okay, second, I think the most famous thing is what we call as RNA sequencing. You can use RNA sequencing by using the NGS method as well. You want to analyze the gene expressions and also splicing pattern as well and non-coding RNA. Back then, I also worked with one of the long non-coding RNA as well. We call it a circular RNA because we found out that this circular RNA is quite stable in the blood system. We wanted to use it as a biomarker. Okay, so I think by using this RNA sequencing on the NGS, you can look at the genes regulations and then you can identify some of the novel transcriptions and you want to look at the biomarker discovery as well. Okay, and I think the third one, the famous thing about the NGS is regarding to the metagenomic. Okay, I believe that most of you guys have heard about metagenomic as well. So metagenomic, basically, we want to analyze the genetic material from a complex microbial community as well. So over here, you can take or you can do a characterizations on the microbes, and you want to study on the environmental sample, or you want to identify a novel species as well. Okay. By using this NGS method as well, we're able to identify some of the clinical diagnostics. We can do a clinical diagnostics methods by identifying some of the disease causing mutations and then assessing the disease risk as well. And also we can use it as a guiding personalized medicines. So over here, you can detect some of the rare diseases as well. Okay, it's a very powerful tool as well. You can predict some of the treatment response as well, and some of the genetic counseling as well methods that we can use by using this powerful NGS method. Okay, and when we talk about the infection disease, of course, you can use the NGS as well. So we can have one technique we call as a, maybe you can search around what we call as an infection disease genomic as well. So by using this infection disease genomic, you can study the genetic diversity of the pathogen as well. Okay, by tracking the disease outbreak, identifying the drug resistant mutation as well, like MRSA diseases as well. Okay, and also we can look at the epidemiology studies. Here also we use it for the vaccine development as well, and antimicrobial resistant monitoring as well. Okay. For the next slide, okay. Okay, just over here we have a overview of this particular NGS, whereby we can look at the sequencing of the millions of the DNA fragmentation as well. Okay, so as I mentioned just now, this NGS method is an instrument that to track the emergence of the spread of the SARS-CoV. You can use it for looking at the SARS-CoV variant as well. So by sequence the viral genome, we can identify the mutations and to monitor the evolutions of the viruses as well. Okay, so it also provide a critical information for the vaccine development as well, and it also one of the public health strategies as well during that times. Okay, and if let's say you still remember or you can able to recall during the SARS-CoV cases, why we're able to get the whole genome that fast, and then why we're able to have the mRNA vaccinations that fast as well, thanks to the NGS method as well. Okay, so during the NGS method, they come up with the whole genome. So a lot of scientists working on that particular thing as well. And it's also easily accessed through the internet as well. We can download the data. And then some of the scientists, they also work on that particular project as well. Right? So on the next slide, okay, that's the reasons why I'm going to highlight or talk more on the NGS method as well. So over here, we have 5 different techniques that we can look at it. Okay, but NGS method is a bit tricky. The first part that you need to look at is the sample collections. Okay, you can either use the DNA or RNA extraction as well. Okay, so this method will start to isolate the high quality DNA or RNA from the sample of your interest. You can either use cell, tissue, or the blood sample as well. The rules of thumbs of using NGS is rubbish in, rubbish out. That means you need to provide a good qualities of RNA or DNA. Okay, that's why over here we call as a quality control. We look at the quality control of your DNA or RNA extraction as well. Okay, so once you extracted your genetic material, either your DNA or RNA, then we access the quantity and the purity as well. Okay, how you want to access the quantity and purity? You can use the spectrophotometry techniques, or you can use the fluorometry as well. So I think in my case, when I want to run an NGS, it's very important I will use these two machines. Nanodrop. Nanodrop is to look at the purity and the quantity of your sample as well. Okay, so by looking at nanodrop, I usually look at the A260, 280, and then A260 and 230 as well. Okay, and then I also use one of the machine, what we call as the, I look at the RIN numbers. Okay, RNA integrity numbers. So before you want to put into your NGS machines, you have to check the quality as well. So that is very important part as well. Okay, so then the second things, okay, you need to have your library preparations. Okay, the most crucial part of this method is your library preparation as well. So your bioinformatic must be someone to have a library preparation. So they involve some of the several steps as well, like fragmentations. Okay, so they look at the DNA or RNA fragmented into small pieces. Okay, so they can be ranging from few hundred to few thousand of base pair as well. Okay, then the second one, you have your adapter ligation as well. So either your short DNA or your RNA will be adapted with a specific sequence. So they will be ligated to a fragmented molecule as well. Okay, so this adapter will serve as a primer, okay, and amplification and sequencing. So you can just imagine it's almost similar almost with what we're having in the PCR technique as well. Okay, and then we have a site selections. After you have everything, then they need a site selection as well. Okay, so site selection, they are performed to remove some of the unwanted fragmentations, and they also retain some of your desired fragmented length as well. Okay, during that times, once you already have all the sizing selections, so you can do a library amplifications method as well. So PCR or other amplification method, basically they use to create multiple copies and libraries molecule as well. So this step is very important and critical, depends on the sequencing method as well. Okay. So the following one, number 4, is we talk about the DNA sequencing. So DNA sequencing, we can use sequencing chemistry. So depending on the NGS platform, sequencing chemistry is variety as well. There's a lot. So the most common method is by using sequencing by synthesis. If let's say you haven't heard, you can look at the SPS method as well. Okay, so whereby your nucleotide base, we have ACGT, the one that most common one, will be added into one times, and then they will emit the fluorescent signals, so it can be detected by the sequence as well. Okay, so you can imagine it's almost similar with the PCR method as well. Okay, then you also need a data generation as well, whereby each of the nucleotide that have been incorporated, okay, so they will release the fluorescent signals, and then they will be recorded. So they will generate some of the sequence readings, and then it will be parallel with the millions of the cluster as well. Okay, so after you've done all the sequencing, the same thing as well as you've done in your PCR, you need to have your data analysis. Okay, so data analysis, you need a software we call as a base calling as well. Okay, and then you need to read some of the alignments, and then you have your bioinformatic analysis as well. So this is you have to get the pipelines, and then you have to do a downstream analysis as well. So downstream analysis, you can do a gene expression quantifications. When you have your NGS data, basically you need to verify it again. So we also have, you have your data of interest or your gene of interest, so you can do expression quantifications. And I believe if let's say you have a bioinformatic persons, you can even perform a pathway analysis as well, right? So also you have your pathway analysis, and I remember another one more thing we can call as a functional annotation as well. Okay. So this method is all the things that we can done by using NGS by a single machine. But of course, if let's say you're asking me, the price will be super expensive. Okay, you can see in one particular machine, they can done a lot of things. Next slide. Okay, over here we have what we call as a CRISPR-based detection. Just now, as I mentioned earlier, that when we talk about CRISPR, the first thing that you will remember is gene editing. Okay, CRISPR, or what we call as a clustered regulatory interspace short palindromic repeats. Okay, short form we call as a CRISPR. So they evolve with adaptive immunity methods. And I believe if let's say you look at the history of CRISPR, how did they find out that actually CRISPR is part of the immune or protective mechanism for the bacteria? Okay, so they found out they're able to, if let's say we talk about the CRISPR-Cas, usually we think about the digest or we think about the scissors, okay, gene editing scissors. So the same platforms that we apply in our particular gene of interest that we're looking at, or we want to detect some of the infection disease as well. Okay, so by using this exploration of CRISPR and the CRISPR associated genes, we call as a CRISPR-Cas, okay, whereby they are present in most of the bacterial genome. As I mentioned, it's because part of it is the genome, is the bacterial protective mechanism as well. So they developed some of the CRISPR-Cas system. So I believe up to date, okay, correct me if I'm mistaken. So they have 2 different classes, okay. In 2 different classes, they also have 6 different types, and they also have 33 different subtypes as well. I think the most important or most famous that we always heard about CRISPR-Cas13, CRISPR-Cas9 as well, right? So whereby they've been discovered. So they also use it for some of the biotechnology material as well, applications, and then they use it for specific RNA editings, knockdowns, and also transcriptions tracking as well, and nucleic acid detection as well. These are techniques that we have been using for bacterial analysis as well. Okay, so moving to the next slide. Okay, just now I was like, just give you a very rough introductions on the CRISPR-Cas. So over here, you can visualize, we can visualize about the CRISPR-Cas techniques that we have. As I mentioned just now, most of us familiar with the CRISPR-Cas9, and then we also have CRISPR-Cas12 as well. Okay, so in this image, we already have a step or what we call as application and advantage of by using this bacterial detections method, by using the CRISPR method as well. So you can either using CRISPR-Cas9, 12, 13, and the 14 as well to develop on the pathogen diagnosis. Okay, so the first things that you need, again, definitely you need the clinical sample. So your clinical sample will be enriched, okay, and then your pathogens nucleic acid will be extracted and will be amplified as well. Okay, so this RNA sample then will be reverse quantitase by amplification with T7 transcription as well. Okay, so then the target of your particular will be identified and then will be undergo cleavage. Cleavage, that will mean they will start to cut on the corresponding CRISPR-Cas system. That's mean they will identify by using the Cas9, Cas12, or Cas13 or Cas14. It depends on the interest that you're looking at. Okay. And of course, if let's say we always talk about the gene editing, we are using the CRISPR-Cas9. But identifications of the RNA, we can use the CRISPR-Cas13 as well. Okay, so the sensitivity can be enhanced. Okay, over here on the last flow, you can see they able to use the fluorescence method. Okay, other than fluorescence method, you can use the lateral flow assay as well. So the result can be observed by using the naked eye. So immediately you can look at the fluorescence. If let's say they have the green fluorescence, or you can look at the bands. So the bands is looking at the lateral flow device as well. Okay, and the quantitative detections of pathogen can be seen as well. Okay, so in addition, CRISPR-Cas method can be used to divert some of the diagnostic purpose. For example, like to distinguish between your pathogen genotypes. Okay, I think one of these genotypes that we're talking about is the single nucleotide polymorphism, SNP. Okay, you can use this CRISPR-Cas method as well. And I believe in 2020 or 2022, one of the paper in a Nature paper, they able to distinguish between the antibiotics resistant gene as well from the virulence studies. So it's quite powerful tool, as I mentioned just now, this using this CRISPR-Cas method. Okay, they also able to diagnose the pathogen infections and also perform the rapid onset detection as well. Okay, so these CRISPR-based pathogens, diagnosis facility will simple and also high sensitivity and specificity as well. Okay, of course, it's a time saving because it's fast, and also, but this method is not widely used yet because it's required a lot of research as well. Okay, the next slide. Okay, I think it's too much of the CRISPR right just now, okay, but I need to introduce some of the methods that we are currently using as well in the research phase, okay. If let's say you ever heard of APC, we call it as a allosteric props initiate as well, okay, catalysis, we can use a CRISPR-Cas13, okay. So this, I will call this allosteric prop as API. Okay, throughout this conversation, you will heard about the API. The API that's been allosteric props, whereby it's a single-stranded DNA molecule. Okay, they consist of these three functional domains. You can see on this picture, they have the aptamer as well. The aptamer domains, what we call as recognizations of the target pathogens. They will stain with the color purple color. Okay, when you look at the pictures, you can look at the purple color over there. That is to able to recognize the target pathogens. Okay, and then you look at the blue colors, whereby we call as a primer binding site domains. Okay, and then we also have the T7 promoter domains. They will stain as yellow colors. Okay, so in addition, some of the phosphate group also will be labeled as well at the three ends of your API. Okay, because you want to avoid your self extensions and to render the DNA molecular resistance from the enzymatic hydrolysis as well. Okay, so in case of absence of these target pathogens, your API will be non-active configurations, and then they will also have this hairpin structure as well. And the primer binding site domains and your T7 promoter domains will be analyzed, analyzed, and then they will block at the downstream reaction as well. So you won't see any particular reactions. But what if you have the presence of the pathogens? So your aptamer domains, the one that I say in purple color, okay, they will start to recognize and bind to the target pathogen as well. So again, usually when they start to recognize, they will target the particular pathogens, and then the hairpin structure of the API will unfold. So when they unfold, they will switch to activate the configurations, and then they allow the primer to anneal. Okay, it's almost similar with the PCR method as well. Okay, and then they release the primer binding site domains. When they release the primer binding site domains, so they will have this DNA polymerase, and then your API will start to act as a templates, and then they will yield towards the double-stranded DNA method as well. Okay, what we call as a DS DNA over here. Okay, so I hope you follow me as well. So followed by displacement of these target pathogens. So we next will do a polymerase extension reaction as well. Okay, so over here, you're using the T7 RNA polymerase to identify some of the T7 promoter sequence as well. Okay, so finally, at these particular methods, we can do a downstream reaction by using Cas13A. Okay, so over here you have a Cas13A, whereby this Cas13A, they were designed to contain two regions. One is what we call as a guidance sequence. Okay, I believe, let's say you look at the polymerase in CRISPR-Cas, usually have guide sequence as well, because they are more specific. And then you also have your repeat sequence as well. And then this repeat sequence is very important because they were part of your cRNA as well to anchor your particular Cas13A enzyme, and then they will guide the particular sequence into complementary and transcript the particular single-stranded RNA as well. Okay, so over here, then they will start to emit the particular fluorescence, so it becomes a reporter probe as well. Okay, so by using these methods, we can detect the particular antigen as well. Okay, so next slide, we're going to highlight some of the CRISPR detection as well. As I mentioned, they have a lot of amplification as well. Okay, so they can use to detect the genotype and look at the SNP as well. They're also able to detect some of the antibiotic resistant and the virulence gene as well. And we use it for the bacterial infections diagnosis and also quick process as well. Okay, and of course, if let's say we talk about the advantage of these CRISPR methods is simple and portable. Simple if let's say you already established the methods. Okay, that's why the R&D is very important. We try to push out, and then it's very high sensitivity and specificity as well, as I mentioned. Why? It's because if let's say you still remember, I mentioned about the CRISPR-Cas13A. They have the guidance. Okay, so that's why they are very sensitive and specific as well. Okay, and I won't say times, if let's say people who are working with CRISPR, they will not say it's a time saving, but after you have established this method, trust me, it's a time saving method, and you also can do a multiple detection as well. Okay, so the next one, I'm going to move on the diagnostic method, the diagnostics marker, what, when, and why as well. So over here, we have the direct methods and we have the indirect method as well. So the direct methods, we have the virus isolations, genome detection as well. Okay, so over here you can see they have multiples or numbers of diagnosis method you can done for infection disease. Okay, so first you can either detect the virus antigens. Okay, you can look at the antigens antibody reaction as well. So with these antibodies, they also have detections by using ELISA methods, or you can use the fluorescence method, immunofluorescence reactions. We also look at the viral genome detection as well. Okay, viral genome detection, the one that I mentioned about the PCR. So you can use the molecular test, and then you can look at the nucleic acid detection method as well, like PCR, RT-PCR, real time. Okay. Last but not least, we also have an indirect diagnosis method as well, what we always call as a serological diagnosis. So serological diagnosis does not test on the particular virus, but they look at the antiviral antibodies that been produced in response to the entry in your body by the viral antigen as well. Okay, that's why they call it as indirect, because they are not looking at the particular antigens, but they're looking at the antibodies that you produce after you get the infections. Okay, so over here, basically for the immunoenzymatic methods that we use is ELISA or Western blot method as well. Okay. Okay, we're moving to the next slide. Okay, now we move to the most famous disease that we have encountered on the infection disease, SARS-CoV-2, also known as a COVID-19 as well. Okay, so this SARS-CoV-2 leave a very big impact in my study as well, because throughout my PhD back then, since 2018, when SARS-CoV hit in 2020, some of my project on stem cell, I moved to SARS-CoV-2 study as well. So during these periods, I also look at, or I done some of the studies regarding to SARS-CoV-2. I apply with the stem cell and I look at the mRNA vaccination as well. So we're looking at these pandemic diseases, basically. That's why I said they actually blessing in disguise, whereby they really educate us as well. Okay, so we can improvise the method that we have as well. So that's the methods that we're using for molecular detections. So we have a rapid and accuracy techniques by using this RT-PCR, NGS, and the CRISPR-based technique as well. Okay, but I believe most of us, we heard about RT-PCR and NGS technique, but little do us know that we also incorporate some of the CRISPR-based method as well for the detections. Okay, so the next slide I'm going to show you is some of the rapid advanced methods we use for detections in SARS-CoV-2, or what we call as a COVID-19 as well. Okay, so during this SARS-CoV-2, we know that they have some of the particular receptor as well. Okay, so this receptor is the one that enable us to make it as a biomarkers. So you can see over here we have the receptor. We can look at the receptor or the whole virus as well. Okay, we can look at the spike proteins. So you can run several test examinations that we look at the antigen detections by using ELISA methods, or you can look at the ribosome acid, what we call as RNA method as well. So you take the sample of the RNA and then you can perform some of these PCR amplifications, RT-PCR method, NGS method, and also we have one gold method as well, isothermal amplifications, RT-LAMS methods, or you can utilize the RNA, as I mentioned just now, by using CRISPR. Okay, we also have a CRISPR-Cas9 methods over here. And as I mentioned, if let's say you're looking at the indirect methods, okay, just now the one I mentioned is more towards the direct methods. You look at the particular antigens. Now we're moving in the indirect methods. You can look at the antibodies that have been produced. You can look at the IgM and the IgG method as well. Okay, so over here, we can look at the antibody detections by using ELISA methods, or another methods, I think some of us quite familiar with the serum virus neutralization as well, what we call as SVN methods. Okay. Okay, the next slide I'm going to show is a bit on the RT-PCR as well. As I mentioned just now, even though we have a lot of techniques that we have, that RT-PCR during COVID-19 is a gold standard, okay, to diagnose the particular SARS-CoV-2. So this method will able to detect the presence of SARS-CoV-2 RNA Okay, in our respiratory sample, if let's say you still remember the times we are taking the swab, okay, because when you take the swab and then the sample, we can have the high accuracy and reliable diagnosis method as well. Okay, so RT-PCR is important because they manage and during the pandemic diseases, so they're able to identify some of the infected individual as well. Okay, what you need to identify because you want to prevent. Okay, so we want to prevent the spreading of the particular viruses as well. That's why it's very important to have the high accuracy and precision as well. Okay, so this image that you can see, we have A, B, C, D up to I as well. Okay, so from here, I'm going to go one by one. Okay, so first, of course, you need the RNA extractions. Once you have your RNA extractions, because it's RNA, that's why you have to undergo a reverse transcriptase on the B. So between the C and E is the one that I mentioned just now. Okay, you have your PCR amplifications method, you have your amplifieds, denaturations, annealing method, and elongations of your particular cDNA. Okay, and then moving forwards to the F. F over here, you can see the detections with the TaqMan props. Again, as I mentioned, either you can use the TaqMan props or you can use the CyberGreen as well. Okay. Moving to the G, you can use the RT qPCR instruments, and then H, you can look at the signal have been released. So over here, you can look at the fluorescence methods or from the reporter dye as well. Okay, so the one that you can see later on I is the primer and the prop screening as well. Okay, so here, as I mentioned just now earlier, you have to get your primers and prop as well. Okay, to have a high specificity and sensitivity as well. Okay, to the next slide. Okay, almost the same thing as well, but what I want to highlight over here is that remember what I was saying is that we can use the qRT-PCR method as well. So over here, you can use the qRT-PCR method to look at the numbers. That's why I say it called as a quantitative analysis as well. Okay, so you can see over there at the bottom level, you can see the lower CT value, that's mean the higher viral loads. What does it mean? Because even in normal low values, you can already detect the numbers of these particular things. So that's why low value of your CT value, that's mean indicates a high viral load as well in our body system. That's why you can see from 17 until 24, the CT value indicates a high viral loads. Okay, but when you look at people who've been released from the hospital because they have higher CT value, because they have a low volumes of the viral can be detected via PCR methods. Okay, so that's why they say anything that is larger than 36, that means there is no diagnosis of this particular SARS-CoV. Okay, moving to the next slide. Okay, over here, some of us are quite familiar with the microarray methods, right? So you can see the microarray method is basically you can use it to detect for the PCR for the SARS-CoV-19 as well. So over here, we call it as a nucleic acid hybridizations methods by using the DNA microarray. Okay, so what we did is that, again, you need a fluorescence label viral, and then you need to have a reference cDNA as well. So you can put it in the microarray well, okay, the one that you can see the hole over here, okay, that will have the functional specific DNA probe as well. So when you look at the numbers A over here, the red color one at the bottoms, okay, you can look at the A is basically it's a COVID-19 cDNA that indicates red fluorescence. Red color indicates there is a COVID-19. And then on B, you see it's overlays of the fluorescence pattern as well. On C, basically what we call as a reference cDNA. Okay, so that indicates by the green fluorescence colors. So again, as I mentioned just now, you can either use the qRT-PCR, but of course, one of methods people done for the research is also one by using the DNA microarray assay as well. Okay, okay, moving to the next one. As I mentioned just now, one of the things that we can utilize the powerful tools is by using the CRISPR-Cas13a as well. Okay, so over here you can see a little bit image on the particular on how we use this CRISPR-Cas13a on detections of the COVID-19 as well. Okay, so the CRISPR-Cas13a system, if let's say we put it in this image, is quite simple design. Okay, so this activity basically they require one molecule of this Cas13 enzyme and one cRDNA as well. Okay, so they have a specific cleavage on the target RNA that we're looking at, and then this Cas13 also have these cleavage methods on the non-target RNA to recognize the target particular RNA as well. Okay, So on A, you can see we have your RNA will be extracted from the patient specimen. So you can, again, you can take it from the nasal swabs, okay? And then DNA will be amplified as well by converting to the cDNA, and then you have your amplified of your DNA, and then will be extract from the nucleic acid. And then on C, you will have your construct of your guides RNA. Okay, this one will be more specific. And then your Cas13 will be using this guide RNA to find its target. Okay, so just remember you have your polymerase, Cas13, and then you need to have your guide RNA as well. Okay, so during these times, they will find and then they will label the target RNA and the reporter molecule, for example, the fluoresces, there will be cleavage or what we call as a cut. And then they will release and then will be conscious, so you can detect it as well. So in F methods, you can use the nucleic acid detection methods. Either you are using the agarose gel methods, or you can use it for the lateral flows method as well, or you can use the fluorescence visualizations by looking at the cybergreen as well. Okay. So the next slide is a bit most of the thing I did some of the comparison between the ELISA, RT-PCR, and then you can look at the microarray technique, CRISPR-Cas9 technique, and NGS technique. So as I mentioned, there's a lot of techniques that you can use to detect for the SARS-CoV, of course. But then looking at the sample, okay? So what kind of sample that you required, or what kind of sample that you can access, okay? And then, and I remember back then, during that time also China have one of the protocol as well, whereby they're using stools to analyze the COVID. Okay, and I believe that times people was like wondering why you're using stool instead of using the nasal swab. Some of the paper I read through that this tool is actually giving more sensitivity, 100% of sensitivity. Okay. You can read on the paper as well. Okay, later on you can ask from the links. I can share with you guys as well. Okay, so we also have looking at one of the techniques. We can look either you can look at the sample or you can look at the durations method as well. Okay, so ELISA method, it requires a longer hours, between 1 to 3 hours. Okay, I think if let's say you done ELISA method, you know how tedious is the job, right? You have to wash and then you have the multiple step of process of washing as well. Okay, by using RT-PCR, it's quite fast. Less than 2 hours, you can get the result as well. Okay, so over here you can see the advantage is high sensitivity, and then also easy to be done as well. Okay, as long as you got the machines. So microarray technique, very fast, but again, it's very expensive. So I don't think most of the hospital setting they will willingly to spend on the oligonucleotide as well. Okay, and then of course we have a CRISPR method as well. Okay, you can see the timing is quite fast, less than 40 minutes. So it's quite easy to perform as well. Okay, so over here, what I list down all this kind of method is because although this real-time qPCR method is sensitive and reliable, but it's quite time-consuming. That's why we have a lot of methods that research have been done to look at the current methods, especially during COVID-19 as well. We have done a lot of research experiments because we want to have a rapid, sensitive, and simple methods to operate on the diagnostic kit as well. So the next slide, it's just a simple comparison between the RT-qPCR and the ELISA methods and the rapid test as well. Okay, so over here we look at the different types of techniques that we can use. If let's say you still remember, by using this qRT-PCR, we're looking at the direct methods. That's means you're looking at the particular antigen itself. Okay, so again, it's a gold standard that we're using. Okay, but it's expensive. But I believe that during that time, SARS-CoV, in Malaysia, I believe the price is around 100 over during that times. Okay, but now it's that we're starting to reduce, and then people start to use the rapid test kit as well. It's much more cheaper, but then it look at the antibodies. And I believe if let's say you remember on how antibodies react, is that required sometimes to get the amounts. That's mean if let's say an individual they get this SARS-CoV, doesn't mean they can immediately be detected by using rapid tests. They need several days. Once they develop the antibodies, then you only can detect it. So it's a time-consuming method as well. Either ELISA or the rapid test. Okay, that's mean they need sometimes window periods. That's why you can look at the fourth columns. Okay, window of use for this accurate result. You can see in RT or qPCR between the 0 until 14 days you can use it to detect. Why? Because they are detecting the antigen itself. But you're looking at the ELISA and you're looking at this rapid test, you can only detect it after 5 days. Why? Because only during that times you will have your antibody will be produced. Okay, so that's why I say, if let's say you are looking at the immediate result, you want to know if let's say that particular individual have been infected, so which one are you going to use, the RT-PCR or you're looking at the rapid test? Of course, you're looking at the RT-qPCR methods. Okay, but if let's say you are trying to track the progress of the disease, okay, then you can use the rapid test or you using the ELISA methods. Okay, that's why I believe that most of during the SARS-CoV times, a lot of government or the country, they said, if let's say you want to diagnose a particular individual, you're not using the rapid test, but you're using this qRT-PCR. But if let's say you want to look at the progress of these patients, then only you're able to use the rapid test methods, the kits. Okay. Next slide, we are going to look at the comparison of technique. Okay, so this one I just do a very summarized methods on the technique that we mentioned just now. Okay, if let's say you're looking at this particular molecular techniques to be in your hospital setting, you can use this chart to do a comparison, a very normal methods. Either you have your PCR, RT-qPCR, or you have your qPCR methods or using NGS or CRISPR method. As I said, sensitivity at NGS, they provide you a very high sensitivity. Okay, but of course, the speed is very slow. If let's say you still remember the pages from previously, they require 3 to 5 days. Why? If let's say you still remember just now, I mentioned a lot, they need to have a library settings. Okay, you need to have a library, then only you can go downstream. Again, they provide a very high specificity. That's why NGS, basically, they are used for profiling. Okay, but equipments over here, the equipments, of course, you need a high-end equipment as well. And I believe that if let's say you're talking about PCR, RT-PCR, and then qPCR and CRISPR, basically they are more cheaper and then they are more accessible as well. Okay, they don't require high techniques or high proficiency to use that particular machines. Unlike NGS, you need to undergo a training. Okay, so this is the comparison between each of the techniques that you can look at. And then the next slide, I'm going to talk about regarding the future directions on the molecular technique as well. So of course, I think up to now, even though the SARS-CoV already been decreased, so we're still looking at the enhance on the sensitivity and specificity on our machine as well. Okay, so we try to have developed some of the portable diagnosis device as well. We have the point care testing as well. Okay, what we call as utilizing the kits methods. Okay, and then the next one, I think the next slide, this one I just put it into my slide just now earlier. Is why? It's because I believe that previous speaker, he mentioned about the AI. So I think it's quite important as well, we integrate with the AI and the machine learning as well. And I see in hospital setting currently, they have a lot of people who are doing machine learning as well. So people who are doing MLT, other than working on diagnostic, we also can, part of it, like try to develop some of the diagnostic method as well by interrupting or join on the AI and machine learning as well. Okay, so this to enhance the particular data analysis as well, and you're able to recognize some of the genetic variation. I mean, like currently we know that viruses have a lot of genetic variation as well. Okay, and then it also can develop some of the predictions model as well. You want to predict some of the outbreak, and also you're able to do a disease management as well. So AI is a quite powerful tool as well you can utilize to integrate into your molecular detection as well in the hospital settings. Okay, so the next slide, I'm going to touch a little bit on the global health implications of using this molecular technique as well. Okay, so I think these 3 things that I would like to highlight, they able to improve the outbreak control. As I mentioned, once you're able to utilize your molecular techniques, the first methods that you know is a rapid and accurate diagnosis. Okay, and then they also enhance the surveillance of these infection diseases as well. The ID that I written over here is the infection disease. Okay, so they enable for the early detections, and once you're able to detect the particular infection disease, you can do a management, so a quick response. So then they also reduce the disparity. That's what I'm saying just now. So when you have a better accuracy diagnosis method, you know the prevention technique as well. So they will start to reduce all these kind of like diseases as well. Okay, so they can enhance the surveillance of this infection disease. So the next one, I'm going to touch a little bit regarding to the ethical considerations. I believe that if let's say we talk about the NGS, we talk about the genes, DNA and RNA, people are afraid of the privacy, isn't it? Okay, so I think some of the country, they start to have this ethical consideration as well, especially when it comes to the gene genetic data. Okay, so we want to ensure the confidentialities and on your genetic data as well. And then we also, some of it, they also have the data security as well, whereby they protect against the unauthorized access. As I mentioned just now, because most of your data, basically, they will be on the system. So that's why we have people who to protect people that is unauthorized to access your data and using your data as well. Okay, so the last but not least, also we ensuring this technique will be fully responsible and very using for the public trust and achieve a global healthy equity as well. Okay. So last but not least, because of the time, so I think I reached to the conclusions of these talks. So this molecular detections is important because first, we're looking at the infection disease. You need to have a fast and accuracy. So they also provide a few techniques as well, as I mentioned, by using the NGS data. Okay, looking at our genetic profilings and looking at this particular virus profilings, and even we can look at the MRSA profiling as well. Okay, but of course, we need to look at the ethic as well. And also we have to improve our patients and the public health globally as well by using these molecular techniques. So I think by this slide, I will end my slide by saying thank you. On the next slide. So I would like to return back the floor to the moderator. If let's say you have any questions, so you can ask during that time. Thank you.
Okay, thank you so much, Dr. Hengki Isyawan. Now we will move to a discussion session, and I will read the question that have been written in the Q&A section. Therefore, I would like to invite our speaker back. Mr. Ferry Effendi, are you here? Mr. Ferry Effendi, can you hear my voice?
Hello. Yeah.
Okay. Thank you for waiting, and now we will begin the discussion session. For the audience, the participant, you may type your question in the Q&A section, or you can raise hand if you want to ask directly, please. Okay.
Hello.
Hello, good afternoon, Mr. Ferry Effendi.
Yeah, good afternoon.
Okay, let me introduce myself. My name is Angga Dwi Kurniawan. I come from Universitas Dr. Subandi. AI definitely has positive and negative sides to its use. My question is how to optimize AI in our learning as health students. Thank you, Mr. Ferry Effendi.
Yeah. Can I respond directly or?
Yes, yes, you can respond.
Okay, yeah. Yeah, okay, thank you from Universitas Dr. Subandi. Yeah, I think the utilize of AI currently is very massive around us, and it is depend on the policy in place. So for I assume that you are students, and also for us as faculty members, usually we just waiting for the policy in place, guided or developed by the its institution, because as we know that currently the Indonesian government itself still on going on discussing the current challenges in AI, especially in the higher education. So I would suggest you to refer to the current policy in place, especially in Universitas Dr. Subandi itself. How is the guideline, or how is the benefit, also the rules, using AI, especially in our daily activities, when we are going through the academic phase, So just to share with all of you that I think the policy in place is various, among region, and also among institution, and it is depend on the universities regulation, whether they approve or no, regarding the utilization of AI, especially in the learning, in the assignment, in the every aspect of academics activities, So if the university itself what is it, give a permission on green light, when we are using the AI, in our higher education activities, I think there are some rules that you need to be concerned, on how far AI can be used, especially when we are dealing with the healthcare industries, So we can see that even in the health itself, it has a different perspective on how to utilize AI, especially when we are going through maybe nursing workforce, nursing profession, or medicine, and any other workforce, around us, I believe they do also giving some perspective, on how we are dealing with this kind of assisted tools, So I would suggest that you can also always refer to the current policy and try to confirm, what is do and don't, regarding the AI utilization, and just keep in mind that all of the tools, around us is just a tools, we as a human need to be wise, and we need to choose which one that really having a positive impact, not only for ourselves but also for our community. That's from me.
Okay, thank you, Mr. Ferry Irawan. The next question is still for Mr. Ferry. What steps or strategies can be taken to improve the digital literacy and AI competency of healthcare professionals in Indonesia to ensure they can effectively utilize AI tools and system? As we know that there are resource limitation, infrastructure disparities between several areas in Indonesia. And then next question from, as a student, we are in, there is some restriction for us to use some AI tools such as ChatGPT. So how we can effectively use some AI tools for me as student, but still legally? Thank you.
Okay, two questions, from the chat box. So first is improving digital literacy
I think what we can do is we can integrate into our curriculum, yeah, incorporating digital literacy and AI training, yeah, into medical or nursing school curriculum is paramount, yeah. So yeah, we can offer like the basics of AI data analysis, yeah, and yeah, regarding our Tridharma higher education, yeah, we call it education, research, and also the community service. Yeah, I think this is really important. And also the second one, we can do like a continuing education, yeah, develop ongoing professional development program that focus on AI and digital tools for healthcare professionals. So yeah, maybe we can conduct like workshop, online courses, and also certification program. Because now we are very convenient, yeah, to following the continuing education program, especially for the health workers. Yeah, we do have a platform in the national level. We call it Pelataran Sehat, and you can joining the continuing education anytime, yeah, anywhere, yeah, every time you want, yeah, you may wish, you can just go online and go through the system. Yeah, I think training and education program is essential. And then another one maybe is the infrastructure development, as we may have seen that Indonesia is a big country, more than 17,000 islands, yeah, and yeah, we do have a challenge in the connectivity and also the equipment provision, yeah, across the provinces, yeah, more than 35 provinces in Indonesia with having more than 250 million people. Yeah, I think this is really essential, yeah, to prepare the infrastructure development, yeah. And also we can consider also the access to resources, yeah, especially when we should reach out the rural and remote areas, yeah, in over Indonesia, and how we can use the benefit of AI, yeah, to increase the capacity of the health workforce. I think that's for the first question, and for the second, yeah. So the second one, I think, relates to my previous answer, yeah. You should refer to the university policy, yeah, and yeah, we are hoping also that the government policy launch very soon, yeah. And the second one, I think, yeah, our second speaker also addressing about the ethical issues, yeah. So any disruption happening around us should be within the ethics corridor, yeah, and we can try to balance between the pros and cons, yeah, using AI tools, yeah, especially for the student, yeah. And yeah, I believe there are a lot of AI, not only ChatGPT, but yeah, we can have any alternative, but more important than that, yeah, we should have the basic principle, yeah, like veracity, honesty, and yeah, the etc. Yeah, that relates to our roles as student, as faculty members, or as technical staff, yeah, in the higher education. So yeah, I think that's for the second question. Thank you.
Okay, thank you. The next question, I think it's for Mr. Henki. Can all examination can be carried out by molecular examination? If I want to degenerative examination, can I detect with the DNA degenerative patient? Dr. Henki, I can hear your voice.
Oh, sorry, because I turned off my. Okay, so I think this is quite a good question as well, because personally, I think my PhD also I work on the degenerative medicine, degenerative patient as well. So, and of course, if let's say you're talking about, can you utilize the molecular examination? I'm definitely saying that I'm going to use NGS to detect this particular degenerative diseases, and then I will use it by using your DNA. by using the patient DNA, okay, not your DNA. So reasons why is because, as I mentioned just now, the SNP. You can use the SNP, you look at the polymorphism studies. So polymorphism studies, of course, you need to use the DNA as well. Okay, so one of my project with my student as well, we are looking at the degenerative medication diseases as well. So I was interested to look at the FGF23 genes. So the key for you to do a degenerative medication, the first thing you need to identify the particular gene of interest or some of the genetic mutation as well. So it's either you look at the genetic mutations, you do a comparison between a healthy individual. So what we usually do is that we will take a NGS methods on a control, or what we call as a healthy individual, and then we compare it with the people having this particular disease, and we look at the gene profiling as well. So from that gene profilings, you can pick one of the gene of interest, and then you can undergo the downstream analysis as well, the assay. So, and of course, it will depends on you want to play on the RNA side or you want to look at the DNA side. If let's say you're looking at the DNA side, so you're looking at the polymorphism studies, what we call as SNP examinations on the particular things. Okay, so, and of course, as I mentioned, you can do it. It's quite, I think it's quite, not say easy, but you can easily find a paper on how you want to do this genetic mutation studies, or some of the papers, they look at the biomarkers. Yeah, so I think biomarker is also, once you already have your genes mutations ready, you can look at the biomarker. You can pick up a biomarker, you can run examinations on that part as well. So that is also one of my study of interest as well. I'm looking at degenerative medications, and then I'm looking at polymorphisms, and I also look at the biomarker part as well. So of course, you can utilize your DNA in these studies. Thank you.
Okay, thank you, Dr. Next question is still for you. From Ms. Ayutri Agustin from Universitas Dr. Subandi. May RNA virus be amplified using conventional PCR, and how to determine the specific primers for PCR?
Okay, this is a very technical questions that I encountered back then as well, as I still recall. So walaikum salam. Saying about this RNA can be amplified using the conventional PCR, of course you can. But what do you need? You need your reverse transcriptase enzyme as well. You need to run cDNA, then only you can run it under the by using the conventional PCR. As I mentioned just now earlier as well, one of my project, I started with very basic project with my student as well. So what I did is that I look at the gene of interest. Okay, you have to remember, if let's say you're looking at the gene of interest itself, it started with what? It started with the RNA. Okay, you need to do RNA studies. So once I already extract the particular RNA, so I just ask my student to convert to cDNA, and then once they converted into cDNA, so you can run in the gel electrophoresis. So you can look at the band as well, the expressions. Okay. The second one, we look at the specific primer. If let's say you want to know your primer design is a good one or a bad one. So basically what I did is that I will do a checking through online. Okay, pick a primer's designs that you have, and then you can check it through. I think one of it is what they call, I forget already, one of the websites. You can just put into it, you can check if let's say they have a hairpins on your particular primers or without. Okay, I think later on, if let's say you get my email, I can give you the websites that I use to check for my specific primers. So there are few criteria that you need to follow. Of course, you need to have your length. You look at your length. That's why when we design a length of your primer to be a specific, you need to contain between 18 to 25 nucleotides on it. Not too short, not too long as well. Okay. And then one thing that I always check with my student is that the melting temperature as well. Okay. Over here, if let's say my student, they get the primer design from the internet, they get it from the paper. To be honest, I will ask the students if let's say, which journal are you referring? Okay, first, if let's say, might be people will agree with me or some will be disagree, but I always ask which impact factor paper that you pick. The higher impact factor papers, that means they need to have a producible results. That's why I will ask the impact factor of the paper they're choosing. Okay, if let's say it's a high impact factor paper, then inshallah, I guess the things that you're running is okay. Okay, if not, you can look at the melting temperature, the melting points. If let's say you're using the qPCR methods, you can detect the melting points. Okay, I think there's a bar over there whereby you can click and then you can look at the melting temperature. If let's say they give you a one peak high columns, or they give you a variable funny kind of like column as well. Okay, and then the key points that you need to look at is the GC content as well. So the GC's content, if let's say I'm not mistaken, is between 40 to 60%. Okay, to have a stable binding. Okay, and then last but not least, of course, you can check the secondary structure. As I said, some of the primer design software, they did give you a hairpins or dimer or primer dimer as well detections. So you can utilize these tools to detect for the secondary structure. So I'm very particular about my primer design as well. So I will put it into the on the websites, and then I will check my primer design if let's say they have hairpins or dimer as well. So I think one of the company, basically they have this particular software whereby once you add it, you can even put the level of difficulties or level of strictness. Either you want it to be level 3, level 2, level 1. That's mean level 1 is like super stringent, that you want to make sure there's no hairpin, no dimer, no primer dimer as well. Okay. So that is my suggestion for you to have a specific primer design. Thank you.
Okay. The last question is from Ms. Solihatil Hidayati. I want to ask which is easier to Dr. Hengki, right? Which is easier, isolating or extracting RNA or DNA? Why does the PCR process always start with RNA isolation? Maybe you can explain to us.
Okay, so thank you for Sohilatil for your questions. Okay, also a very tricky questions. When you're asking me either DNA or RNA, I will say based on theoretically DNA is easier to work with. Okay, but I love to work with RNA because when I was like 15 years ago when I doing my degree, I work with RNA. I love RNA work. Okay, so for me myself personally, I say RNA is quite easy to extract. Okay, but theoretically, of course, DNA is much more easier to extract. Why? It's because DNA is much more stable. Okay, when you take a sample, a specimen, the key points of you having this sample is that you need to store your RNA in -80. If let's say you store it in -20 or you store it in the room temperature, trust me, it will be degraded. Then you will get a bad qualities of RNA. Bad quality of sample, bad quality of RNA, you get what I mentioned just now. You can't even run your NGS because as I mentioned just now, rubbish in, rubbish out. That's when you get a bad result. Okay, so when you talk about the stability, DNA is much more stable compared to RNA. You talk about the protocol, of course. Back then in my times, I also used the Trizol to extract my RNA as well. I love using conventional methods compared to by using kits. I can extract my RNA easily, but the key of extracting an RNA, you need to do it on ice. To get a stable extractions of RNA, you need to do it on ice. DNA, I try to work on the normal table without ice. It's work perfectly. You can get a high purity, you can have a high concentration as well. So again, DNA is much more easier to extract. Okay, talking about contamination. DNA is less contaminated by the RNAs compared to the RNA itself. And RNA, as I mentioned, if let's say you already have your contaminations by the DNS, tada, you'll be start to degrade. Okay, so that's the reasons why I was saying that DNA is much more easier to extract compared to RNA. Personally, I love RNA work. Okay, but if let's say you're asking me, I would say DNA is much more easier. By myself, I love RNA. Okay, so why does most of the qPCR started with RNA isolations? If let's say you look at the qPCR study, most of the research paper, they use it qPCR for what? They use it for gene expression study. They're looking at the genes. So as I mentioned just now, if let's say you're looking at particular genes of interest, you're looking at the mRNA level, you're looking at the RNA level. Okay, that's the reasons why they always, when you look at paper, you flip on the paper, you look, oh, why are you using the qPCR? Because they are looking at the gene of interest, the particular of disease. Okay, you won't look at the studies of this particular disease on the DNA level. You look at the RNA level. Okay, so that's why you look at the gene expression study, they will start with the qPCR. You look at people who study on virus, RNA virus, they will start with the qPCR method as well. Okay, because why? It's because we want to have the quantity, the numbers of it. So that's why they always start with the RNA work. Okay, so I think it answers the questions because most of it they're using on the gene expression studies, or either if let's say in the infection disease, they are looking at the RNA diseases as well. Okay, thank you.
Okay, thank you so much, Dr. Hengki. Ladies and gentlemen, we finally come to the end of the session. Before the end of the session, Ms. Emilia will read the conclusion.
Thank you, Ms. Diaz. Excuse me, I will conclude the result of the presentation from our extraordinary speaker delivered. The first by Bapak Ferry Effendi, Sarjana Keperawatan Nurse, Magister Science PhD from Indonesia. We can live without AI, especially in healthcare as nursing and midwifery, wherever AI to improve decision making, patient care and service delivery. And the potential benefit of AI in healthcare, the first, improve diagnostic accurate. The second, efficiency in hospital and clinic management. And the third, increase accessibility to healthcare service, especially in remote area. Despite the many benefits of AI, but nurse and many health workers lack of knowledge and skill in AI. And the second from Dr. Hengki from Malaysia. Molecular detection involves identifying pathogens by detecting their genetic material, DNA or RNA. This process is crucial because it allows for precise identification of the pathogen causing infection, which is essential for effective treatment and management. Molecular detection techniques have revolutionized the diagnosis and management of infectious disease. This method offers unparalleled accuracy, speed, and sensitivity, making them indisposable tools in modern healthcare. Continued advancement in innovation will feature a change in their impact, improving patient outcome and public health globally. Thank you to the extraordinary presenter, very interesting material. Thank you, Mr. Diaz.
Okay, thank you, Ms. Emi. The committee will share the virtual certificate of appreciation to Mr. Ferry Effendi and Mr. Hengki Isyawan. Thank you so much, Dr. Hengki Isyawan Mulyadilai, for the material today. Next for Mr. Ferry Effendi. Mr. Ferry Effendi and Dr. Hengki Isyawan, thank you so much for your speech in this certificate appreciation from the committee of the Second International Conference on Health Sciences. Hopefully, we will see you again next time. Thank you.
Thank you so much.
Honorable Speaker, any final thought for the committee today? Maybe Mr. Ferry Effendi first for the final thought. Oh, I think Mr. Effendi is out from the Zoom. Mr. Hengki, any final thought for the session?
Thank you for inviting me. And then I think it's also one of the things that I would like to share as well about the molecular techniques that we have, the advanced that we have already. And I believe that if let's say to people who outside who like to do research, so try to found out more about this molecular technique as well, because it's advanced tools that we have that you can utilize it, and then for detections and a lot of things as well. So I think the curiosity that you need to have and try to explore, even though you think it's difficult to work on molecular, trust me, I done it before. So, but you will enjoy it. Okay, thank you.
Okay, so much, Mr. Hengki. Before I close the plenary session this afternoon, I will read any rhyme in Maduris. Kecepot gulana merah, salalopot nyoon sopora. Thank you for our disgusting speakers. To all participants, hopefully this session will be beneficial for all of us. Tias and Emi Astuli from this session. Wassalamualaikum warahmatullahi wabarakatuh.
Check. 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 Thank you to all speakers and moderator. The second plenary session of the second Universitas Dr. Subandi International Conference on Health Sciences has now completed. Dear ladies and gentlemen, we will have a 30-minute break to allow the Muslims to have Asar prayers. Please all participants return to the conference room at 15:45 p.m. Thank you and enjoy the break time. Tes. Ladies and gentlemen, welcome back to the second Universitas Dr. Subandi International Conference on Health Sciences. We are going to start our next agenda. At the third session, we have the Honorable Dr. Thani Glomjay and Dr. Roshini Opra from PBRI Thailand, who will talk about disparities related to health services in rural and urban areas. This session will be guided by Mrs. Alia Purwanti, Master of Science as moderator, and also Mrs. Ririn Handayani, Master of Midwifery as secretary. To moderator and secretary, we invite you on the stage.
Tes.
We started yet?
Not yet.
Oh, 10 menit tuh net.
Thank you, Ms. Maya, as host of this conference. Ladies and gentlemen, may I have your attention, please? The third session will be begin. Thank you very much for preparing yourself to join this conference. Please have a good signal and condition. Good afternoon, everyone. Assalamualaikum warahmatullahi wabarakatuh. Salam Om Swastiastu, Namo Buddhaya, Good Wishes. Respectable Chancellor of Universitas Dr. Subandi and his staff, Honorable Dean of the Faculty of Health Science and the entire academic community at Universitas Dr. Subandi, honorable all participants of this conference, it's honor for me, Mrs. Alia Purwanti, Master of Science, to be a moderator of this session, and Mrs. Ririn Handayani, Master of Midwifery, to be the notulen who will note and conclude in the end of the session. We are pleased to see you here and welcome all of you to this conference, Second International Conference of Health Sciences, Transforming the Future of Healthcare Through Potential Artificial Intelligence. We hope this conference will give many benefits for us, and we also hope that all participants are still enthusiastic about taking part in this third session of this conference. Ladies and gentlemen, this is the third session of this conference, and the topic is disparities related to health services in rural and urban areas. The material will be delivered by our honorable speaker from Boro Marajunani College of Nursing, Faculty of Nursing, Praboro Marachanok Institute, Thailand. Assistant Professor Dr. Tony Glomjai, and will collaborate with Dr. Rosni Opra. Permission to display their curriculum vitae. Without further ado, I would like to greet our honorable speaker today. Good afternoon, Dr. Tony and Dr. Rosni.
สวัสดีครับ Selamat sore.
Selamat sore.
Yes, good afternoon, everyone. Thank you so much. Thank you so much that you invite me and Dr. Roshni Opra for your speaker, for your the second international conference of University Dr. So and me. If I mispronunciation, I apologize for this. And thank you so much that you give me a chance to share our experience for this priority of rural and urban healthcare in Thailand. Particularly, Dr. Roshni Upra, she is very expert in community care or community nursing. She is the instructor in Boromrashini College of Nursing Payao, Faculty of Nursing, Boromrashino Institute. That is my university.
Okay, thank you so much, Dr. Tony and Dr. Rosni. Before the presentation begin, let me inform how the presentation will be going on first. Dr. Tony, accompanied by Dr. Rosni, will be invited to present the material for 60 minutes. After that, there will be a Q&A session for
Yeah.
15 minutes. The participant can type the question in Q&A column or push raise hand button to deliver the question directly. And don't forget to introduce your name and affiliation. The last but not least, before later we close the session, Mrs. Ririn as Notuland will deliver the conclusion of the session, and then we will close the session. Mr. Tony, would you be willing to directly share the material that will be presented?
I think Dr. Roshni will share her PowerPoint
Oh, okay.
for the presentation.
Okay,
Yes,
okay.
and we will talk together, like ask and answers for our topic. Okay? Are you okay?
Okay, okay, thank you, Dr. Tony. Now allow me to welcome our main speaker, Dr. Tony Glomjai, accompanied by Dr. Rosni Opra, to deliver their presentation about disparities related to health services in rural and urban area. Dr. Tony and Dr. Rosni, the time is yours.
Okay, thank you very much. Thank you for your introducing ourselves for the special field and a little bit of my curriculum vitae, right? And hello, Dr. Lochini.
Hi, Dr. Tony.
Yeah, thank you so much for your coming. Nice to meet you again. And thank you for your cooperations on the international conference for our friends from Indonesia, from UDS, right? This is the second time that I have a talk with the health services. Last time we talked about evidence-based practice in nursing. And today we will talk about the rural and urban health services in Thailand, right? And maybe you will share your experience and your knowledge that you have experiences with community nursing in Thailand. Particularly, you have a chance to teach your nursing student to support a community health system and for nursing procedure in the community. Okay.
Thank you very much.
Yes. First of all, would you like to introduce a little bit of yourself, please?
Okay,
Dr.
thank you very much,
Roshni.
Dr. Tony, for letting me here in this conference. It's really my pleasure, and it's been a good opportunity to be here. Thank you so much. And then let me greet the host. Thank you very much for organizing this wonderful international conference. It's my pleasure to be here. And as you know that my name is Dr. Roshni Upra, and I work at Baromrashoni College of Nursing, Chiang Mai. And Dr. Tony, I have been working with Dr. Tony a lot in international affairs, and he's a really very good guide and always invite me to help with this wonderful conference, which is really a great one. So, and I am a nurse lecturer in community health nursing. Normally, I supervise my student in community field. Yeah. So today, what we'll be talking about is like disparities related to health services in rural and urban area. Just like I said, according to the topic, we might guide to the key factors around the world first, and then we'll get to Thailand later on. So I think our talk will be about 40 to 45 minutes, and will be a joint session with Dr. Tony, just like a discussions and talk, so that you don't fall asleep while we talk. So it'll be something interesting. Yeah.
Okay, thank you so much for your introductions of yourself and your experiences for your work in your nursing college, right? We will start from the definitions of the health disparity. Can you give me the answer, Dr. Roshni? What is about the health disparity in your opinion?
Okay. Let me calm all my staff. My staff, can you share the first slide?
Excuse me, can you share your slide, your
Yeah.
PowerPoint?
Okay. Staff, please open the PowerPoint. Okay. Basically, what I prepare in the PowerPoint, okay, just stay with the second one, the second slide. Oh, I can do that. Okay, perfect. So I'll be looking on my table. because I've got a bit short eyesight and I forgot my spectacles, so and the screen is a bit far for me. So what you talk about health disparities, in my opinion and in the worldwide opinion, disparity means something unequal. And if you see the picture, sometimes when you browse through the internet, you'll see the word equal and equity. Equals mean you get everything in equal way, but it's not equity. So health disparity means that when people get into health system, you don't get the same services due to the populations, the distances, and the budget that is being allocated to the city or the suburban area or the rural areas. So that is called health disparities. Or in easy word, it's just like something unequal, which leads to inequity. So we have to distinguish between two words, equal and equity. If you see the pictures, you'll see that some of the pictures, to make it easy to understand, you will see that the picture that three people have been given a stool in the same size, but the people who stand on the stool, there'll be a man with height like 170, a woman with a height like 150, and a kid. All of them got the same size of stool, and that's called equal. But the thing is that all of them cannot see the other side because it's not tall enough for all of them to see the other side. So equity in health means you need that people will have or will be able to access the same kind of health services. That is called health equity. So what we found in these days all over the world is disparity, which means inequity in healthcare. So I think we'll go from there for my experience. And if you see this picture, you'll see that these health disparities can last for generations. I think it will keep on going. And then we need to close the gap of all these social determinants and all in healthcare. And as well as we also have social and economic disadvantage in the rural area. Because like in some country, we have the budget allocated to the population in the area, not the need of the people. So basically, I think this is what called disparities in healthcare services. Yeah, thank you.
Okay, thank you so much for your opinion about the disparity. Like your give us example in the picture is variety meaning of the people who will get the health services in the clinical setting like that. And you talk about equity and inequity, right? That's very important for the client or the patients who suffer from the disease, and they need some help or some supportive from the doctor or from nurses in the clinical setting like this. Okay,
Yes.
thank you so much. And can you tell a little bit for the impact of the disparity between the rural and the urban with the health services, please?
Perfect. Thank you, Dr. Tony. So actually, when you talk about impact, there's a lot of impact between disparities in healthcare services. And if you list the impact, there'll be a lot of impact. But then the World Health Organizations has suggested we can group all that impact into four main areas, which is access to healthcare services, quality of healthcare services, health outcomes, and socioeconomic factors. So these are the four main factors, key factors that we can group all the other area into them. So it make it easy to understand. So just bear in mind that access to healthcare services is very, very important. Quality of health services, health outcome, and socioeconomic factors. So we can go into details, brief detail into each topic. If you see the picture along the side, you can see that in rural area during the past time, we have like COVID mortality in rural Oklahoma. This is the example of worldwide. We'll see that the people in urban area mortality rate is lower than in the urban area. In the rural is higher than urban area. So in the city, it means that people, they get access to the vaccine faster before the vaccine could go to the rural area. That is the main thing that happened. So the disparity is not only in Thailand or in Indonesia, it's all around the world. And you can see that the death rate in rural is much higher everywhere. If you go to World WHO website, you will see that WHO is very, very concerned about disparities in healthcare services, especially
Yes.
in rural areas. Yeah. Thank you. That's the four main key factors, and we can go into detail later on in each topic.
Yeah, I think so. You can go to the detail of each impact of the rural and urban area in health services, please.
Okay, that's perfect. Thank you, Dr. Tony. So we will go to the access to the healthcare services. If you see in the PowerPoint, you will see that it says
Yeah,
that access
access
to
to the
health
health
services.
services.
Yeah, that's the thing that we will see that individual and family in rural areas face disparity in access to healthcare. What do we mean by this? If you fall sick when you are in rural area and you want to see some doctors, just like you got heart disease, you won't be able to get specialist, a cardiologist in the community center. You have to travel to another place, which is in the city center. You will find a cardiologist. And then when you travel to the city center, you will have to wait in a long queue to get treated. So one of the main reasons that people in the rural area get sick and cannot get access to healthcare is that we do not have enough or enough place to get treated. And the other thing is that when compared to urban area, the people in the rural area has worse health outcome. If you go and check the studies everywhere in the research, all of the papers that people in the rural area have a very poor health outcome when comparing to urban area. That's due to access to health services. Just for example, like in Thailand, when I visited some of the home or the family, we often see the patient who's got joint pain or what you call the total knee replacement that they need to be get treated. Like old people, aging people, they need to be treated with the joint pain, the knee. And when we ask them that, why don't you go to the hospital to get treated? They say that they don't have money to travel that far because the community health center doesn't have doctor to treat about the knee or total knee replacement. And then when we try to check for them in the city, they said the waiting queue is for like 2 years or 3 years.
Yes,
Yeah.
it's
But
quite long.
Yeah, that's quite long. But then if you have enough money to pay for the private hospital, you can get the queue within the next day. Or even in the government hospital, if you're willing to pay extra money, then you can get off-time queue, just like in the evening, the doctor will come and you will have to pay like 200,000 Thai baht. So this is the thing that we need to do. Even if you live in like city, like Chiang Rai city or something like just example, you can go and get treated in the government hospital, but still you have to wait for the queue. But some people, they wanted to get a very good doctor. We travel to Bangkok to get treated. But when you travel to Bangkok, first you have to wait for the queue to see the doctor. And then when you see the doctor, you will have to wait for the queue to get operated unless you are willing to pay. That's the thing. This is very, very important. That's why many people in the rural area, they prefer not to get treated. The money is also the matters, and the access to health services is also very important. That's the main thing. And the another thing is that, just like I mentioned earlier, is just the availability of the health services in the rural is not many choice for them. They have very less choice. And then the affordability, it means that how much can they afford, just like we said. Are they willing to pay, or not only pay for the treatment, just to pay for the van or the car to take the ill patient to her hospital? Some of the family, they doesn't have that much money in the rural area. It's just due to poverty and less income according to the GDP. They have a very less income. And the another thing is acceptability. Sometimes when people, they travel to the city center or in the urban area, the culture difference is so different that sometimes they does not accept it. They cannot get treated like that. Sometimes people also have a choice that they would like to prefer a place that they could be treated according to their culture preference. So this is also another thing. It's not that every doctor can treat all the patients. The patient also choose the doctor, because sometimes you can hear the patients say, no, I don't like this doctor. I'm not going to treat in this hospital. So the hospital name is also very important. So
Yeah.
the choice has to be made, and then we don't have much choice. So that's why people prefers to just stay at home and live like that. It doesn't make matters unless you get like very critically in, and then they will travel to get treated. Yeah, that's the
Okay.
yeah.
Thank you so much for the first impact. I think the audience will be have their opinions, like you says, for the rural is very different from the urban health services, like you said. And maybe after we discuss with the difference between rural and urban health services, we will give a time for the audience to ask our question and share the experiences. That's okay?
Yeah, I think that will be
And how
very
about the next impact for the quality of health services? Do you have any idea for this question, please? And for
you
next
mean the
next
next
slide.
impact, right? Okay,
Yes,
before we move to the next impact, which is the quality of health services, I would
right.
like to come back to access to health services. This is also another very important thing. It's just like, why people if you see the TV, sometimes the health conscious in the TV, you see people just like faint out like that and die due to heart disease. Because sometimes people, they don't worry to get checked up, and then they often go to the hospital when the condition is bad or critical. But if you have a good resource, not poverty, you can earn a lot of money, you can pay for private hospital, they are safe and they can choose a better doctor. So this is another important impact of access to health services. So shall we move to the next slide for the another
Yeah.
impact?
Yeah.
Okay.
Okay, thank you.
This is also another interesting thing: quality of health services, infrastructure, and emergency services. Okay, so when you talk about infrastructure, the infrastructure in the rural area, like in Thailand, we have only community health hospital. In that hospital, we only can treat a basic needs of the people, not critically emergency. When they need something critical emergency, we have to refer them to the city center or urban hospital, which really takes time, especially when you get a people with stroke, heart disease. It's quite critical to refer them. And then in this same hospital, the infrastructure, we won't be having a CT scanner in the community hospital, right? Yeah, the MRI, we won't have it. Everything, we do not have all these big machines to help the people. All we need or we have in the community hospital is the nurse who only asks the illness history. So this is the another barrier or key impact, that we do not have enough infrastructure. And then when you move to the emergency services, it takes a very long time to refer the patients from rural area to the urban area.
Yeah.
Especially in the place like, if you see lately, we've seen some news in Thailand that the emergency van has hit with accident in Chiang Mai. We have like the same hospital twice, and all the patients in the emergency van died due to the accident, because the distance is very important, because they have to travel from Hill Tribe to the city center. So distance and the area of location is also very important. If you're in the rural area, which is really far away, and Hill Tribe, that's also dangerous to refer a patient, and they would prefer not to come and see the doctor. So even if they're willing to come, but then so what? The emergency services, if you don't have a helicopter, you come by van and then you meet with an accident. Yeah, if you see the news, so many times we see people got accident with the emergency van. So this is quite another key impact, that due to not enough infrastructure in the rural area. So this is the another impact. And then you won't be having a good cardiologist, a good anesthetic in the rural hospital. That's why you have to refer, even for the maternity, if they do not give a normal delivery, they need cesarean section and they are from hill tribe. Sometimes you have to refer them to the city center. But last time we had the van accident and both the mother and child die. Yeah. So this is another sad thing that we shouldn't let it happen, but it already happened. Not only in Thailand. If you look at the news, WHO website all around the world, people have this kind of list. This is a very high list with the quality of healthcare services. Yeah. And
Yeah.
then, yeah. Dr. Tony, you have some question?
No question, but I have some suggestions for the urban health services like a usage, because in urban area we have many specialists like you stated for emergency or severe patient to investigate by the specific or specialist in a big hospital, like physician in big hospital in urban area is very important for severe people. If we stay or if we live in rural area, we have to transfer for rural area. That is very difficult, particularly in Thailand countryside is very difficult to get the bus or the transportation from rural area to the urban and get the high quality of investigation like you says for infrastructure, right?
Yeah.
And modernize equipment, medical equipment and technologies for the doctor in a big hospital, right? And particularly everything that you said, pay money. You have to pay money in the urban areas for good services, right?
Yeah.
Okay. And how about the outcome of the health services?
Yeah, let's move to the next. Thank you very much, Dr. Tony, because I think this really very important. Like you said that the doctors, physicians actually we would love some physicians to come from rural, to come from urban area to rural area sometimes, so that we don't have to refer the people like that. But how many people are willing to come to the rural area? That is also means that their future, their income, their family, right? Yeah, so this is really a big problem for all the country to sort this out. Yeah, unless you have a very good promotion for those who willing to stay in the rural area, I think we will have more doctors. Yeah, thank you. So let's move to the next key impact. The third one is the health outcome. Okay, so if you see the health outcome, we will see the chronic conditions and mortality rate. So we have been talking about this during our first, second, third, or fourth, fifth slides since the beginning, that the people in rural area have worse health outcome than in the urban area. Why is that so? They said that lack of health prevention, health screening due to poverty. So if you see like the picture, I try to bring the pictures from some studies. If you want to see the resources right down there, they said that majority of people in the rural area, this is not in Thailand, in other country, they said that the people doesn't meet the 5Ds of diabetics, the healthcare, just like the insulin, the prevention of tobacco and all the BP and all that, they fail to meet all these criteria. But luckily in Thailand, we have the healthcare volunteer people to help. But still, the chronic conditions in the rural area is worse than in the urban area because the late treatment, they will wait till the conditions got critical and then they will go and see the doctors. Normally, they come to the village health center, get treated, go back home and work. They will not do anything further than this. They do not control their diet because they just eat what they have. That is very important. And if you see the statistic, the people in the rural area have much higher mortality rate due to chronic condition, much more. And before in Thailand, if you're in the community field, like when I started my nursing career as a nurse lecturer, when you walk into the community area, we hardly see people get sick with diabetes or hypertension. But today, when you walk to each and every home or every household, you get at least 1 or 2 people with diabetes or hypertension. And now we also have kidney disease and then stroke. So all this come together with knowledge of healthcare, health literacy. You might think that people know what is 140, 90 blood pressure measurement, but if you ask them, they cannot tell you what is the difference. Believe me, if you ask them what is your HbA1c means for, they cannot tell you the meaning, but they can only tell you the numbers. So this is the health literacy that doesn't work out for them because they have very poor health literacy.
Yeah.
Why? Because of poverty, they're more concerned of their income for living more than their health condition. So from up there, chronic conditions, it is linked to the mortality rate. So finally, in the rural area is much higher than the urban area. So this is the another health outcome. This is very important. Yeah.
And I think so. The outcome of health services is very important for the people who live in the rural area or the urban area. And both of area have different situations, like you said. In the urban area, the outcome maybe for many factor support or encourage people to self-care or to look after themselves. Like you said, health literacy is very important for everyone to know about the health status of themselves. Like, and if they have the health literacies, for example, for diabetic patient, if they know the screening like A1C that you said, don't know only the number of the A1C, but the patient have to know how to prevent them from the complication and how to do for the self-care, like food, medication, and the wool. Yes, something like that. That's very important. And the educations for people who stay in urban area is a high education level more than people who stay in rural area. I mean, the health literacy between people who live in urban area may be better than people who stay in rural area, right?
Yeah, that you're right, Dr. Tony. You're really right because, like in the rural area, if you see the population, most of them at moment are aging people.
Yes,
Yeah, they have very low health
absolutely.
literacy. That's the another thing. Yeah, and then just like you said, in the urban area, people are much younger because they're people who migrated from the rural to the urban, and they have education and they have access to internet, and they some of them quite health conscious and they read through it and they understand the meaning of it. Yeah, you're right. That's very important thing. Yeah.
Okay.
Yeah,
And
and
how
another
about the socio-economic factors?
okay, that's the next impact, right? Oh,
Yes.
yeah, before we move to that, the another thing I forgot to mention is that the another thing that the impact the health outcome is that the timely access to the healthcare facility cause the mortality rate. Sometimes the rural area, just like we said earlier, the family, they cannot go to the hospital in time. That's the another thing that make them die. That's the another important thing. But people in the urban area, they have much quicker facilities. So that's the another main thing. Okay, let's move to the another topic, the another impact. Okay. I think, hold on.
Okay. Yes, you move on to next
Yes.
slide.
So the socio-economic factors is the income and health insurance and health literacy. So actually, the down one, health literacy, we already mentioned that earlier, and then income and insurance. So just like I said, the people in rural area, they have much lower income according to the Thailand GDP, and they have compared, they have a very low income because majority of the populations live in urban area and get much better income. And then for health insurance conscious, some of the people in the rural area believe that buying health insurance is just like cursing themselves. This is an olden way of believing. But for people in the urban area, which is higher educated, they think that getting health insurance is a very good security for their life. Although Thai government has to have a lot of campaign for healthcare services, which is very, very good, but they
Yes.
don't have health insurance, make people feel much better to get into healthcare access because a much better services, and then a quicker, faster, and a very good infrastructure in the private care. But when you go to rural area, if you walk in each and every house, none of them have it. If you count like a person, you will have like 3 or 4% of the population that have private health insurance. Yeah, they hardly have it. They don't have it, and their income is so low that you get surprised that in the northern area, it's very low that you have to ask themselves like how they get feed all the members in the family. Sometimes this is very, not only in Thailand but around the world, we have people in some rural area, they are really have a lot of poverty, so they will not have health conscious because to eat they also don't have money to eat. Then what will they concern about their health? That is very important. And then when we move to health literacy, this is a very, very interesting because for people in the urban area, as we said, they have a lot of health facility to get access the knowledge. So they know that what they should practice with healthcare. They have to do all the exercise, food conscious, and all that. But then why people in rural area, sometimes taking medications, they also get afraid that they will have kidney disease. Yeah. So they think that eating too much, taking too much medication make them get kidney disease, and they move forward to traditional medicine, which is not a proper traditional medicine. Traditional medicine is very good, not bad, but you need a proper place and a proper with a license. Traditional medicine is really good because they don't have all chemical substances. That's perfect. But they have to get a choice and with a licensed places to get treated. But some people, they get scared, they don't get treated, and then they go to the wrong places and they get disease. Yeah. When I opened my health literacy clinic in the community hospital to educate people, majority of them will come and ask you that, do I need to take this hypertension medication anymore because I'm afraid that I will get kidney disease and get sick. And then they stop taking the medication by themselves. So this is a very important thing that we need to educate them about the health literacy. Yeah, this is the income.
Okay, thank you so much.
Yeah.
I would like to share my experience. I have been to patient in Indonesia because I have exchange student and exchange staff with some university in Indonesia, and I visit patients' family in the communities. It's very interesting. I saw some family have Indonesian herb for their traditional medication, and some family have another strategy to release pain from the chronic disease or chronic pain by using Indonesian massage with the oil. Yeah, I saw some family use this style for their family member who suffer from pain disease or chronic pain, right? Can you give more a little bit more for the health promotion for the Thailand health system in rural area for the Thai people? Do you have any idea for this?
Okay, so you want us to move to the next slide after the socio-economic factors. So shall we move to the next slide now about Thailand situations? Okay, now, like, let's go back to the healthcare. Just like when you said your friend in Indonesia, they use traditional medicine. That's really good. I think we should promote that because, like, I have seen many people around myself who's being treated with the modern medications without proper health literacy, and they got side effect of the medications. This is quite bad, and it take them to the next level of treatment, which is really bad and worse health condition. So going back to traditional medicine is really good actually, but it has to be a proper one. Okay, and then if you see Thailand situation at the moment, this is some example that you will see that hypertension, diabetics, and cardiovascular disease. The orange color is the urban area, and the lighter one is the rural. All of that graph, you will see the people in the rural area in Thailand, they've got much higher rate of chronic disease.
Yeah.
Disparities in healthcare. That's the rate that we have seen. So that's just like from the key impact that we have been talking through so many slides in the beginning. That's the situation now. And then we said that we also have limited access and shortage of healthcare professional. But at moment, Thailand, we are trying to get doctor to be in the community health center every
Yes.
day. Some
Yes.
place who could afford, they will come every day. But the place where I work with my student, they come every Monday, Wednesday, and Friday, 3 days a week.
Ah.
Yeah. And in Thailand now, Thailand Nursing Council, they have got a plan, and now they are doing it. We have community nurse practitioner who can work. How can we call that? Not a doctor, mini doctor? Or can we just be an autonomy nurse practitioner who can look after the patient? They can diagnose the disease and give a medication as well. So this one will help. And for me, I think a nurse, as a nurse practitioner in the communities, to save our time, we just add the knowledge into each slide and the experience. For my opinion, I feel that nurse practitioner in the community does a very good job. And you can see that when you ask nurse to do some job, they did a very good job. I'm not saying that other professional is not doing a good job, but when you see doctor treat the organ. When you go to this is the advantage of being in rural. The nurse practitioner, they see the people as a whole. When you go to the hospital, the community hospital, the nurse practitioner will ask, Dr. Roshni, Dr. Troni, what's happened with you? And then they ask you overall of your situation, what happened to you? And then they look at all the medications that you got, and then they organize it for you properly. But if you go to the hospital in the urban area, the doctor will say, oh, Dr. Tony, you have got headache, you go to the neurosurgeon. And then, Dr. Tony, you got stomach ache, oh, please go to the gastro. So each doctor look at your organ. They're not looking at Dr. Tony, they're looking at your organ. So there's something that classy about healthcare in rural area and urban area. So we should promote looking at the patient as a whole, not as an organ. So this is the advantage of being in the rural. But although we have everything less, but we still have something good in the rural area. This is which is classy in Thailand, and I like it. This idea. Yeah. What's your opinion,
Okay.
Dr. Tony?
It's a good idea and good examples for Thai situations. And like you said, between rural and urban situations for NCD patients, the rural area, the rate or the proportions of the people who got NCD is higher than the urban area, right? And very interesting. And I would like to know about the strategy to resolve the problem, because we know the difference between rural and urban health services is quite very different in many factors. And how about the strategy to overcome or to resolve these problems?
Okay.
Please.
So thank you, Dr. Tony. WHO has identified several keys to overcome these disparities. They said that we should have health workforce distributions, I think this is quite ideal to do it practically, because you have, just like we said, that people prefer their future. So going to rural area, if you're already living in urban area, not many people would love to go there, but let's see how we can work out with this. So this is the recommendations from WHO, that to manage about health workforce distributions to make people balance in the rural and in the community. And the another thing is that access to essential medicine and technology. So we are now trying to use telehealth medications everywhere to overcome these situations. Yeah, that's the thing. And then the other one is that health infrastructure. At least we should have more infrastructure in the rural area. Like, you don't have to have only CT scanner in the city hospital. Maybe in one district, you can have one for the people in the rural area, especially the Hill tribe people who have to travel long distance to minimize the risk of accident. That is very, very important. And the health information system, that we should have the ability to provide them with all this information, so that people know that what they can do and cannot do, and at least this would minimize the disparities between rural and urban area. And another thing is that WHO encourage community engagement to help in this healthcare system. I think they mainly wanted we to go to the prevention role of the nurse more. Yeah, prevention is better than cure. So I think the community engagement is more like prevention. And to overcome this, Thailand has already implemented some of this. To date in Thailand, we have healthcare college that majority of Thai people don't have to pay. They only have to pay 30 baht or the golden card. This is really a very classy one, and people have access to healthcare. But the thing is that when you are in the rural area, you need to go and get the referral first. But lately, as much as my knowledge, they're trying to make it cover all over area with less timing to refer the patients. And health workforce, they're trying to organize family doctor, which is being in the process of Thailand. And then a nurse and nursing council is trying to organize nurse clinic in the rural area as well, nursing clinic in the rural with the nurse practitioner. And more health infrastructures, like we have trying to balance the community hospital and change the role. Some of them has been with the district and the city council, so that they provide more proper healthcare in the rural area and the health outcome education. And at moment, Thai government also had a lot of initiative. And what is not, we think that like community engagement in Thailand, we have the healthcare volunteer people who have been helping in the rural area a lot. And this is a very classy one, which serve the WHO community engagement. These people help to screen the patients in the rural area. Dr. Tony, you want to give some more thoughts about this? In the rural area.
Sorry, I turned off my microphone. Nothing to provide more solutions, because you have many choices to resolve the problem of the differences between the urban and rural health services, like Thailand try to overcome the problem that you said at the beginning of your talk about the health services and the problem of the patient who got the quality and inequity of health services in the hospital or the clinical setting between rural area and urban area. Like, we have 10 minutes left. Before I will give a summary. Do you have any idea for the next episode, or what's next of your? Oh, sorry, I catch a cold because it's heavy raining at the in my college. I'm so sorry for this. And what's next for the rural and urban area health system or health services in your opinion, Dr. Roshini?
To get it improved, like in my opinion, what I plan to do according to my visions of a nurse lecturer, that I think that it could help, is that at moment we have faculty practice, so we are trying to implement a PBRI model, as well as open a health literacy clinic in the community hospital. So when, like on Thursday, we have a patients with NCD coming to the hospital, we educate them and try to promote with health literacy clinic, NCD health literacy clinic, and help the patients with all kind of it. And you will see that people sometimes when they see doctor, they still have questions that not clear. So they'll come to our clinic and we organize the food diary for them, and we get it checked up that what did they eat and what's wrong with it. The result is quite good because we could control many people with diabetes with uncontrolled, and after they come to our clinic, they could control it, which is very, very, very pleased that we get many of them coming, or after I follow your guidance, I feel better and I become better. I could control my diabetics, my hypertension went lower, much better. And then at moment, what we think is that we should have a family doctor in the rural area.
Yeah.
Because according to my opinion, I feel like people should be looked by a family doctor, because a family doctor could look after you as a human, not an organ. I don't like when people go to the hospital and you see doctor by your organ. I want them to look at the patients, at the whole people, and then when you treat the patient with the medications, you know that what they actually take, and we can reduce the drug actions and reduce the overuse of drug. Because sometimes if you go to the rural hospital, this is the disadvantage of urban hospital. Urban hospital, each doctor treat by organ, and then they give medications which could be like, when you give warfarin, the neuromed also give warfarin, the cardiologist also give warfarin, and if they don't talk together, you come from different hospital in the urban area, you get overdose of warfarin. But if in the rural area we have family doctor, the family doctor will look at all your medication. So I think in this way it'll be much better. So to solve this problem for health disparities, I think we should have more family doctor. That's very important. Yeah, that's the thing. And as a role of nurse educator, I think that we can help in providing healthcare literacy for the patient with chronic disease, because if you stay in the community, you will before you used to think that people knows everything, but actually they don't know. Yeah, they know just what we told them, but actually they don't know how to utilize the knowledge of healthcare to look after themselves. So in my opinion, I think family doctor is good. That's perfect.
Yes, I think so. The family doctor is very important to cooperate, to to manage the health system, coverage the patient or the Thai population in the community like this. And I think it's maybe situation in Thailand maybe is the same situation in Indonesia. We will return microphone to the to the audience and ask them some suggestions or opinion for the rural and urban area health services. Dr. Lochini, could you please stop sharing your PowerPoint, please?
Okay.
Could you
Staff,
please
please
stop?
stop sharing the PowerPoint, Odd, please.
Yeah, and I will share my PowerPoint.
Okay. Odd, could you please stop sharing the PowerPoint?
I will.
Hold on. I just walked to see my staff. I think he can't hear me. Sorry, 1 second.
Okay. Okay, that's okay. Perfect. And I will share my PowerPoint to summarize our talk for the disparity related to the health services in rural and urban area, right? and then we will return the microphone to the audience and the MC for Indonesian audience for the suggestion on the question and answer next. I would like to summarize the definition or defining the disparity. The health disparity refer to the differences in the health outcomes and access to the healthcare services between different population groups. These disparities can be influenced by various factors. Like Dr. Roshni gives some example for us, including geographical location, as mean for transportations from the family or from the community to the center hospital or big hospital in the city center. And next is for the socio-economic status, education, and more factors. Rural and urban health services often experience stark differences in healthcare access and quality. Urban areas typically have more hospitals. This is true. It's true, Dr. Roshni. Urban area typically have more hospitals, clinics, and healthcare professionals, while rural area may struggle with a lack of resources and services. And the advantages of urban health services. The urban area have several advantages when it's come to health care, like a resource availability, more hospital, clinic, and specialists, advanced technology, access to the latest medical equipment and treatments. Education and awareness is a greater access to health education and awareness program. Disadvantages of urban health services. The urban area also face challenges like overcrowding, as a healthcare facility can become overcrowded, leading to long wait time. It's like a long queue. Is this correct, Dr. Roshni?
True, that's very true.
Yes. Higher cost. The cost of the healthcare services and living can be higher. And the next factor is very important to is environmental factor, the pollution and the other environmental factor can negatively impact health. The advantages of rural health services. The rural area challenge, despite their challenges, has some advantages. It's like community tie, strong community connection can support mental health and well-being. Lower pollution. Generally, rural area have less pollution compared to the urban settings. And the health initiatives, local health initiatives can be tailored to specific community needs. Disadvantages of rural health services. The rural health services face significant obstacles. For example, limited access, fewer healthcare facility and provider, travel distances, long distances to reach healthcare services, resource constraint, limited access to advanced medical technology and specialists. And the rural and urban health services in Thailand, like urban area in Thailand, Bangkok is very modernized city, have more hospital, clinic, and healthcare professionals, particularly private hospital with high quality. Maybe some private hospital in Bangkok is the international quality level compared to the rural areas. Rural areas often face challenges such as fewer healthcare facilities, limited access to specialists, and longer travel distances to reach the care. Example for this parity in Thailand is like access to medical facility and health outcome, like Dr. Roshini stated in her presentations for the outcome and how to resolve. Next one is for the preventive care, right? The advantages of urban health services. Urban area in Thailand have several advantages like resource availability, advanced technology, and health education. Disadvantages of urban health services like in Bangkok, like overcrowding, higher cost, and environmental factor. And advantages of the rural health services very important is the community support, rural pollution, and health initiative. Disadvantages of rural health services in Thailand is like limited access, travel distances, and resource constraint. And strategy to address disparity in Thailand. To address this disparity in Thailand, several strategies can be implemented. Some of solution, Dr. Roshini give a talk before I summarize the discussion. The first one is for the telehealth services, and the next one is for mobile clinics. Mobile clinic is quite very important now. To deploy mobile health clinic can provide essential services from the urban area to the remote area, the rural area. And policy from the government can incentive healthcare professionals to work in the rural area, particularly family doctor. Is it true, Dr. Roshini?
Yes, that's right.
Yeah, family doctor. Possibly to loan forgiveness or financial bonuses, or I love bonuses. Community engagement, engaging local leader and community in the health promotion and education can improve health outcomes and reduce disparity. My conclusions for my talk with Dr. Roshini today, the addressing the disparity in health services between rural and urban areas in Thailand is crucial for achieve health equity. By understanding the challenges and implementing to get target strategy, we can ensure that all Thai, or maybe in Indonesia, to have access to quality health care. And thank you for your attention. Thank you so much. Terima kasih. And now I will return the microphone to the audience. Is this okay, Dr. Roshini?
Yes, sure.
Maybe, yes, maybe we'll listen to the suggestion or opinion from the audience. How about the disparity in Indonesia, right? Okay, I think it's very important to compare between Thailand and Indonesia.
You are right. That's very interesting. Thank you.
Okay, MC, how are you?
I'm fine, thank you
Are
so
you fine? You have two person, right? Maybe you are twin, right? Are you twin?
No.
Because you look similar. The left girl and the right girl look like similar with the glasses, right?
I have to wear glasses because the screen is quite far to see their face, but I think they're twins.
No.
Okay. Please share your experiences with the disparity for the rural area and urban area health services in Indonesia. We would like to get some knowledge and exchange knowledge and experiences from your country. Please.
Okay, thank you so much, Dr. Tony and Dr. Rosni, for giving us such informative and interesting presentation about health services, both in rural and urban area. Through your explanation, we can find out the differences between the two, the problem that arise due to these differences, and how to overcome them. There is a question here or some participant who will share with us today, Miss Ulfia.
Excuse me, MC. I'm not sure my speaker or your microphone, the volume is quite low. Rojini, do you have a problem like me?
Yeah, I have the same problem. I can't hear them at all. It's like the voice coming from far away. So I'm trying.
Oh, yeah, I think so. Okay.
So we have the same problem.
Okay, can you my voice clearly?
It's better.
Okay, sorry. Okay, there is some a participant who will share with us, Miss Ulfia. Can you hear my voice?
Yes, I can hear you, Miss Alia.
Okay.
Good afternoon, Alfia.
Good afternoon.
Good afternoon, Mr. Tony. It's pleasure to meet you again.
Nice to meet you again. Thank you so much for your coming. Do you have any
Yeah.
idea for disparity health services in your country?
Yes, before I ask the question, I would like to share a little bit about our community services in Indonesia. We actually have a similar problem in Indonesia because we have a lot of island and
Yeah.
most of them is actually considered as a rural area. So we have a limited access to the hospital and stuff, while the community is also believe in traditional medicine more compared to the modern one. So it's quite similar to the Thailand, I think.
Yes, I forgot. You have many Iceland, right? And it's very difficult to refer your patients from the Iceland to the city center, like a big hospital in Jakarta, right?
Yes, it's
Yeah.
very
Maybe,
difficult to transport.
yes, maybe it's more difficult than Thailand because Thailand is only have our two island that we have peoples live in the Iceland, right? And you have more than 1,000 Iceland, right? I'm not
Yes,
sure.
we have a lot of island divided
Yeah.
in our country.
Yes, and one thing I recognize about your country is the storm, right? Heavy storm. Yes, because a heavy storm in Indonesia is uh affect to the health system. Okay, like people cannot live with the disaster or severe storm in a heavy rainings like that. Okay. Oh, thank you so much for your opinion. What is your question?
Okay, thank you for the time. I would like to ask you about the insurance in Thailand.
Uh-huh.
Is there any specific policy in Thailand that encourage people to have maybe a national insurance to reduce the cost of the healthcare system or stuff?
Mhm.
So we will have a chance to persuade the people to take care themselves, especially from the rural area. Thank you, Mr.
I
Tani and Rosin.
Okay, thank you so much for your nice question. I will refer your question to Dr. Roshini.
Thank you very much. So
You
thank you.
first.
Okay, thank you very much, Dr. Tony, and thank you very much.
Yeah.
Okay, for the health insurance, you mean the private health insurance, isn't it?
Uh-huh.
Okay,
I
no,
think it's
normally
private
Thai
insurance.
people in the rural area or even all around Thailand, we have the card named Gold Card, which is cover them for by the government when they have access to the hospital. They only have to pay the minimum of 30 Thai baht. That is the thing that majority of the Thai population has. Okay, now let's go to the private health insurance. Like I'm the government officer, I am already insured by the Thai government. So for this, the Thai government pay everything for me if I go to the government hospital. But nevertheless, I would prefer the private health insurance because of the services, the uh, the availability of the infrastructure and the staff, the doctors. Like when you go to the private hospital, you feel like you're into the 5 stars hotel. So if you, from your question, if you said if the Thai government promote the people to do the private health insurance, they promote, but not that much, not too much of promote, but they allow us to promote. But people feel that buying a private health insurance is quite expensive and it's a waste of their money unless they feel that they wanted the luxury of their life. They
Uh-huh.
will buy that. And some people, not only for luxury, for businessmen or people who are quite wealthy, all of them have a very good private health insurance because like you got a better care. You can just go to the hospital with full of facilities, a good doctor. So it's very good for them. Like if you got heart disease today, you can just get operated by that evening because you have private health insurance in the private hospital. But the cost of it is like millions Thai baht. Whereas when you go to the government hospital, you don't have to pay that much, or you may have to pay a little bit co-pay a little bit, but it takes much longer time and queue to get treated. So it depends of your income, your idea, and your perceptions of benefit of it. So it depends on the income actually, whether the people prefer to do it or not. Am I right, Dr. Tony? Yeah, I hope I answer your questions.
Yeah. I will summarize a little bit for Alfia. We have two choices in Thailand. The first one is insurance by the government, and by the government we have to pay 30 baht. Dr. Roji says, and when you go to the hospital, you will get the same quality of the healthcare provider in the hospital. Everyone get the same quality, the same quality services like that. And for the second one is private insurance. Private insurance is depend on your choice or depend on your plan. If you would like to be a luxury insurance, like Dr. Rochini gave example, you have to pay more per year, right? You have to pay money each year, a lot of money each year. You will get like a luxury, like a VIP services from the private hospital, and you will get the specialist or the room and the food service is like you stay in 5-star hotel like that.
That's it.
But you have to pay more. If you pay less than I said, you will get for standard services from the private hospital. And we have another choice. if you stay in the hospital, like an admission, if you admit in the hospital, you will get some money back from the company, right? The company depend on your choice. It depend on your your plan. Like
Right.
you choose to get some money like 1,000 baht per night or or 2,000 baht per night. You have to pay extra money in your insurance like this. Okay.
And yeah,
Uh,
let me, Dr. Tony, when if you finish, I have something to add it more.
okay. Okay. Please.
Okay, you're done? Okay,
And that,
sorry. Okay.
yeah.
Like, but something can be very fishy with the private insurance. Like if you get heart disease, like you insure for getting for your illness for the private insurance, and then eventually you got heart disease and you got treated with heart disease. They paid for everything, but
Mhm.
the another thing is that in emergency case, you get admitted to the private hospital. The first 72 hours will be paid by the Thai government, but they will take the money out of the private health insurance first. But whatever cannot claim from the private health insurance, Thai government will pay for you. That is in
Yeah.
life list and high emergency. And then once you got treated and being paid by the private insurance, they will cease the contract and they will pay you like they will say like, oh, okay, after you got surgery heart disease, you got covered, we give you the money 500,000 Thai baht and the contract is ceased. So this is the fishy thing about the private health insurance in some company. They do pay all the money and then paid off the contract like 500,000, and after that they cease the contract because they don't want to pay more, because once you got heart disease, they don't want to take care of you anymore. So this is something quite fishy in the private health insurance. I think it happens everywhere. Yeah.
Okay, thank you for your answer, Dr. Loshini. I have a questions from the audience in Q&A chatting. Good afternoon, Mr. Tani and Miss Roshini. I want to ask, as we know, there are disparity about education in the rural area and urban areas. So, how do you help promotion at the rural area of Thailand, especially during the COVID-19 pandemic? Okay, Dr. Roshini,
Okay,
answer
thank
the
you very much.
question.
Okay, when you said about the health educations, like in rural area, normally when you said people are role literate, the people who are not educated, most of them are all the aging people, because now we have the standard education system that everybody has to get educated. Come back to the COVID time. Just like I said, Thailand, we are quite lucky. We have health volunteer system. We got what we call them is community health volunteer or community health worker. These people, they will be allocated in each village. They look
Yeah.
after like 10 household, 15 household like that. So these people will educate the people during the COVID time. And even we also help the when you come back to the nursing college, we also help them to provide education as well when this during the past COVID-19 that we faced last 2 years. Yeah, that's the one we help. The nursing college has a very important role in educating the populations, and
Yeah.
the main people that help a lot is the healthcare worker in the community that we call the healthcare volunteers. Yeah. So this is
Yes.
how we overcome the COVID-19. Yeah.
Yeah, the village health volunteer is very important person to control the COVID-19 pandemic in Thailand, and they work very hard in that situation, and they like healthcare provider who works in the area who have the with the COVID-19 pandemic. One volunteer have to do with the 10 family, right? Okay, that is correct. Yes, one health volunteer look up respond or they have to look after 10 family.
Yeah, 10 to
That's
15.
okay?
Yeah, that's
Yeah.
right. You are right,
Okay,
Dr.
I think this is correct. Okay. And the second question, can you explain the approach taken in nursing care in rural areas? Can you explain the approach taken in nursing care in rural area? What's the answer, Dr. Roshidi?
Okay, I'll try and answer this. You mean the nurse's role? Maybe, right?
Yes, maybe nurses role.
Okay, so at
How to
moment,
approach?
okay, so like in the rural area, we have the community health hospital. In that community health hospital, we have 2 nurses or 3 nurses, depend upon the size of the village. And the nurses, they will have responsibility in doing about screening the NCD along with the community healthcare workers. And we also have the nurses who do the family care in the area, as well as doing about the treatment, just like a doctor that I talked earlier, that we have the nurse practitioner who help in looking after the patient. So basically, we will have the community healthcare workers who screen the patients. And then if we have the patient who have high list of NCD, they will refer the patients to the community hospital. The nurse will start the detailed screening, provide medication, and if the condition is beyond their ability, they will refer the patients to the bigger hospital, just like the city hospital. Yeah, from rural area to the city hospital that look after them. They call it the CUP, the hospital that look after the community hospital. Yeah, that's it.
Okay, thank you so much. Like Dr. Roshini said, nurses are very important person in the rural area to screen or to take care of the patient in the community. Because in Thailand, there are not many doctor or many physician in the rural area. The doctor only works in the hospital, not for the community. And we try to educate nurse practitioners to work in the community, particularly for working in the rural areas for the patient who have the severe condition or chronic illness like that, stay at home. Nurse practitioner will visit. They have to visit the patient at home and give some treatment or medications for the patient. This is very important in my country. In the future, we need more family doctor to work with nurses in the hospital, particularly in the rural area like health promotion hospital. Okay, this is very important strategy to solve the problem of healthcare system in Thailand. For the next question is maybe the last question. Okay, MC, right?
Okay.
Okay. The last question, how is the health services in Thailand? If we talk about the health services in Thailand, I would like to talk about the policy from the government and the Ministry of Health policy maker who formulate the plan for Thai people for healthy condition, and we have a strategy for 20 years in the future to look after and to prevent Thai people from the disease. We talk about this 4P strategy. The first one is excellent promotion, excellent prevention. The second one is excellent healthcare provider. The next one is excellent excellent procedure. Okay, this is a 4P for Thai government to formulate the policy to cover the health system in Thailand. And then the Thai government put a big money for health system in Thailand. Some of Thai people come to get the treatment or the nursing care in the hospital is for free of charge, no money for them. And we have the policy like a one ID cards for all hospital around Thailand. This policy means you only get ID card with you, and then you can go to any hospital in Thailand. It's for free of charge. Yeah, this is a very important policy for the government to support healthcare system in my country. And I think every patient can get the services, healthcare services from the healthcare provider with the high quality in the same situation. Like Dr. Roshni usually says for equity and inequity and quality. Okay. Does this answer your question? I don't know who asked this question. Okay. We have tried to answer all your question. Anything more for the suggestion or your opinion or question?
Okay, there is no question in column chat, but I personally also have experience that sometimes health workers give the impression of providing different services to the patient who take the insurance or not. We can see it from the way they talk, the way they behave toward patients. Because of that, I think knowledge about service is indeed needed, but what is no less important is how we behave toward other people, especially toward people who are sick and their family. I think we must really pay attention about that because it will influence people assessment about health services, even though the health facilities are very sophisticated and good. I think like that. And also in Indonesia, I think every university in this world have some program like in Indonesia we call KKN, like we share about our education, our knowledge to the village urban in rural area, how we can provide our health system, and we share about, like Dr. Tony said, how we can use a natural ingredient to be a medicine and anything else like that. Okay, thank you so much, Dr. Tony and Dr. Roshni, for sharing with us today.
Thank you so much for your nice summary.
Thank
And
you very much.
And thank you so much for Twin MC. Twin MC.
Thank
And
you
thank
so much,
you.
MC, and thank you so much, Dr. Tony, for having me here.
Okay, I'm very willing to welcome you to the conference. Maybe you can exchange your knowledge and your experiences to our friends from Indonesia. And thank you so much for Universitas Dr. Sobrani to welcome most of us and a very valuable opportunity to share our knowledge and our experiences with you and get some knowledge and experiences from your participant. Maybe I think in the future we can share or we can cooperate in
Of
the
course.
international conference by us and some Thai student and some Thai staff with you. Okay, thank you so much. Terima kasih.
Sama-sama. You're welcome. Okay, before I close the session, our Notulen or my twin
Okay.
would like to take conclusion once again for
Okay, thank you so much.
Okay, thank you, Mrs. Alia, for your time. Based on the presentation by Dr. Tony, accompanied Dr. Roshni, on the topic disparities related to health services between rural and urban area, we can understand that there is disparity in healthcare service between rural and urban area can have significant impact on access to healthcare service, the quality of healthcare service, and outcome healthcare service. Strategy that can be implemented include improving rural healthcare infrastructure, expand telehealth service, strengthening healthcare workforce policies, and community-based health program. So addressing the disparities in health service between rural and urban area is crucial for achieving health equity. Thank you. Back to Mrs. Alia.
Okay, thank you, Mrs. Ririn. This is the last part of this session. I would like we would like to give some appreciation to our speaker this afternoon. We will present a certificate for both of you, Dr. Tony and Dr. Rosni.
Thank you.
This is for you, Dr. Tony. Thank you so much. And Dr. Rosni. Once again, we wish that we will have another time to meet and share again about another interesting topic. Thank you so much. Good afternoon.
Bye. See you then.
Thank you. Bye-bye. See you
And bye.
later.
Have a good day.
Have a good day. You too.
Okay. Thank you for all participants for every active participation. The last but not least, we apologize if something is not
Next time you
acceptable.
can log me out, please.
Thank you for all crew who have worked together since this event was planned until this afternoon. See you later. Good afternoon. Wassalamualaikum warahmatullahi wabarakatuh. Shalom, Om Swastiastu, Namo Buddhaya, good wishes. Back to Miss Maya. Thank you, everyone.
Thank you to all speakers and moderator. Ladies and gentlemen, the end of the third plenary session also marks the end of the day one of our conference. We will see again tomorrow to attend the second day of the second Universitas Dr. Subandi International Conference on Health Sciences, here at 8 a.m. with the agenda of our speaker and oral presentation session. To all the oral presenters, please prepare yourself. Please go to your breakout room as informed tomorrow. And to all the participants who are not presenting a paper, please join one of the breakout rooms to attend the oral presentation. Amahya Alinatul Iza as your master of ceremony. I will see you tomorrow. Have a nice rest and thank you. Wassalamualaikum warahmatullahi wabarakatuh.
Oke, sudah ya.